Hello, and thank you so much for tuning into our second day of our national improved Medicare for All forum. Last night was phenomenal. We had such great panels, we had great musicians, we had great cameos. It was incredible. If you have not seen it, please go back. You can see it on my YouTube, Indie Left's YouTube, Real Progress and Actions YouTube. So there are ways to see it, but do not watch it until after today and tomorrow, because we have some more incredible things planned. So this first panel today, well, let me not be presumptuous. My name is Joy Marie Mann. I've done a show for about 5 years, and I will be your hostess with the mostest for much of the weekend. But this first panel is incredibly important because we're going to be discussing capitalism, which, let's face it, is kind of the overarching issue with why people are dying from lack of healthcare or insufficient healthcare. We're also going to be touching on the environmental aspect of people's health issues because of environmental, be it water, air, what have you, and what it would mean to have 1881A passed in this moment for those who do indeed need that care. So I definitely want to start. Let's introduce the panel. And thank you so much for joining us. We have, you may recognize him from one of my prior shows, Nathaniel Mulcahy, Dr. Mike Papas, and Adam Cooper. So I'm going to kind of let you guys introduce yourselves, because I know you each have kind of a list, and so it's easier that way. So the first question you take, you can just kind of introduce yourself as well. The first question I want to send is to Dr. Mike Papas, and I want to address this and then give both of you also the option to follow up. So Mike, the reason I had to have you was I saw a few videos on your take. You are a doctor in New York, and you did some videos on the capitalist system and witnessing what people are going through during a pandemic, with lack of healthcare and such. So can you just kind of describe what that's like as a doctor to see, and as a self-proclaimed socialist doctor, to see what is happening in where you practice?
Yeah, so thanks for having me. My name's Mike. I am a family med doc, formerly trained in New York City. I also am or am about to be a psychedelic medicine practitioner in New York City. I am a revolutionary socialist. I write and am a member of Left Voice, which is part of an international network of publications in countries around the world. So, yeah, I mean, to answer your question, I think that first I'd like to say, to be completely transparent, I'm not currently practicing medicine. I actually stopped practicing medicine partly because of what I saw during the practice of medicine during the pandemic. I think I was working in both the hospital setting and outpatient clinic setting at the peak of the first wave of the pandemic. I had already, it's not like my politics kind of changed during the pandemic. The only thing that really happened is I was even more convinced of my politics watching how the healthcare system functioned during the pandemic. I would say that basically what we saw was that the COVID pandemic specifically just highlighted, especially in the United States, how we have nothing of a public health system whatsoever. what we really have in the United States is we have a healthcare system that functions inside a capitalist economic system to at the crux work to try to extract monetary value from bodies that are damaged by capitalism. And that's what we saw basically during the pandemic. And that's part of the reason why in no way, shape, or form were we able to respond appropriately to the COVID pandemic and how it spread. I guess I think that what ultimately we saw happening, just to like, I guess first, just let me start with how the pandemic unfolded and those types of things really quickly. I think that it's important to recognize that the pandemic was predicted, it was completely avoidable, and it sure as hell didn't have to play out at all the way that it did. It was created by the dynamics of capitalism. It was allowed to spread, and the dynamics of capitalism actually allowed it to spread even worse than the way that it did. Throughout, we saw what I saw patients coming into the clinic who got sick because businesses were forced to stay open, industries weren't made to be safe, people were forced to like work in close quarters nonstop, kids were sent back to school when they still weren't safe, and all of that was because capitalists need to exploit people's labor for profit. And we're even seeing that now continue to happen today, which is so troubling for me as a healthcare worker, because in today, it's basically been that who really cares about it? We're just going to let it spread uniformly throughout the population. And I think that really what we've seen is that the only thing that's been learned from this pandemic is that the ruling class has looked at multiple ways, which I think we'll get into more, to exploit this pandemic to increase their net worth and to make more profit, and how we've seen how incapable the capitalist system has been to respond to crises of its own creating. And we've also seen how willing capitalists are to sacrifice lives at the altar of profit.
Spot on. And also that brings up the point that, you do hear people say that, you're getting vaccinations for free. Okay, you are getting it for free, but let's be transparent. Pfizer has made billions off of what they're donating to you. So I think it's really important that people keep that in mind. They're not being charitable. They're not doing something to help people. They are literally saying with every single person that gets a vaccine, we are raking in dollars. So, and I'm not saying don't get it because of that. I'm just, I'm proving the point that we need to think deeper than what's on the surface. Adam, would you like to respond or add anything?
Yeah, hi everyone. My name is Adam. I use he, his pronouns. I'm a PhD student at UC San Diego, where I study the emission of pollution from the ocean. We often think of it as a sink, but I see it as kind of Mother Earth's revenge. And a lot of times we're breathing in those pollutants when we go to the beach or when we live in coastal communities. I think on this point, another important aspect of the COVID-19 pandemic is just the massive health disparities caused by prior environmental injustice, especially through exposure to air pollution. So we really concentrated certain like working class portions of our country into areas with high industrial activity, and those same populations, mostly BIPOC folks, were forced to go to work, forced to get exposed, not given the proper PPE, not given good masks when we knew that's what they needed to do to avoid exposure to COVID-19, especially before the vaccine and the early stages of the pandemic. And so, yeah, like asthma rates, prior exposure to criteria air pollutants had a strong correlation with those negative health impacts.
Absolutely. Nathaniel.
Yeah, so I'm Nathaniel Mulcahy. I'm an engineer and a scientist. I run a humanitarian company called World Stove. And we deal with a lot of crises internationally. And from an environmental aspect as well, I've written environmental policy now for 16 years and have been part of the climate conferences at the UN because of that. Touching on one thing you mentioned, Joy, is certainly Pfizer is making profits, and the fact that the patents have not been released and have not been freed is one of the primary culprits of the spread of the pandemic. There's just not been enough vaccines, and by insisting on making profits off of them, we've allowed the thing to spread. Mike made a point that it has spread quite a far way, but at this point, it is now irretrievably spread. We've now seen jumps from species, so we're past human spread. It's jumped to deer. It's jumped to deer mice. We've now documented at least 3 cases of deer to human transmission. So at this point, there is no way to eradicate this virus. And the latest version of Omicron is at least as contagious as measles, which was up until now the most contagious thing out there. So we've dug a hole so deep that there is no escaping it. And yet we continue to pretend. And it's not just profits, which all of you have touched on at some point, but it's also political numbers. Because if you look at England, 3 weeks ago, they said, we're back to normal. All mandates are lifted. No masks, no distancing requirements. 3 weeks later, shockingly, huge spike in cases, huge spike in mortality, huge spike in infections. And England has always preceded, throughout the past 2 years, the United States by 3 to 8 weeks. So what we're seeing happen in England, where Boris Johnson wanted a little bump in his polls because he needed it, Biden has done the same exact mistake, and I predict in 3 to 8 weeks we will see the same spike in mortalities and hospitalizations, where already the hospitals are overfull. So I mean, it is the level of vile evilness, and right now they're saying we're back to normal. Excuse me, in February 28th of 2021, there were half as many mortality cases due to COVID as there are now. So when we had to lock everything down, we had half the number of cases, even though only 18% of the people were vaccinated at that time. We're now at 69, 70% vaccinated, and we have double the number of cases. But let's lift all the mask mandates. It just makes no sense whatsoever. It's just an illusion that they're trying to create. But the death rate is not an illusion. The mortality, the millions of people who are going to be mourning the 1 million lost people are not an illusion. And yet we're back to normal. How does that make sense to anybody?
Yeah, absolutely. Adam, I know you wanted to talk about, I digress slightly, but you wanted to discuss the use of plastics. And this is something that I've learned so much about being in Pennsylvania with the Keystone pipeline and everything. Would you like to address that and just kind of give people a background on just how much using plastics is involved in deteriorating health and environment?
Yeah, so there's an exercise I like to do. So if you'd all like to join me and take a deep breath in and a deep breath out. So very likely you just breathed in a micro or a nanoplastic. They're all around us. They come off of our clothing when we wash them in the washing machine. If you're next to a road, the abrasion of tires sends them into the air. And if you're on the coast, all the plastic pollution that is accumulated in the ocean gets emitted as microplastics from sea spray aerosol. We ingest around 5 grams of plastic every week. That's about the amount of plastic in a credit card. Scientists have coined a new term for this. We call it the plastisphere. It's no longer just the ecosystem, the biosphere, but plastic is an integral part of Earth's system, and it's all man-made, and it's all due to us. And as a young person, that's terrifying. And we still don't know the full public health ramifications of it, but evidence and the scientific literature to date has pointed towards really nasty chronic long-term effects, especially on endocrine disruption. disrupting hormonal systems, disrupting pregnancy, disrupting childhood development. And so we probably don't observe the full impact of this crisis until we can monitor those populations being born now, just growing up exposed to all of this plastic. And of course, it comes from something. It comes from petrochemical feedstocks. The same feedstocks, the same oil drilling, the same fracking that makes fossil fuels causing the climate crisis is generating this plastic crisis. And because we're living in a capitalist system where you can't strand those assets, you need to keep on drilling. I was shocked and dismayed to see President Biden calling for more oil drilling in response to the Russia-Ukraine war. So as we shift towards cleaner energy systems, we're just exponentially increasing the amount of plastic that we produce. We don't manage it well. We use a lot of it for only one time before we throw it away. And we're going to see a growing crisis that many believe to be the next major environmental crisis if we're somehow able to address climate change first.
Absolutely. And being in Pennsylvania, we have we have pipelines. I think we're the second highest pipelines as far as states in the United States. But we have this place called Conestoga. It's outside of Hershey, and it is indigenous land, shocker. And it has so many pipelines. I've been there to protest. They literally look like water slides. I'm not kidding you. They are bright orange plastic. They are on school children's property, playgrounds. They're on people's personal property where their homes are, and they cannot fight it. But just the amount of plastic in those pipelines, I cannot even fathom. So you're absolutely right. That's something we definitely need to think about more. And then Nathaniel, I know that you unfortunately have had an experience with lead poisoning, and you have the most adorable 5-year-old twins. So can you share your story about what they're going through?
Absolutely. So, and yes, I will confirm they are the most adorable. Yeah. So, to begin, we hear a lot about Flint, but Massachusetts has many towns, Malden being one of them, where the lead levels are much, much higher than even Flint, but it gets almost no press. Mainstream media and the political parties decided Flint was a good political image, and from Obama to Clinton to anybody else, they've showed up at one point or another, and not done anything, of course, but it's the obligatory photo op that any campaign seems to do. That said, we were very, very lucky. After a long time, we thought we couldn't have kids. We finally did after 12 years, which was a joyous occasion. They came very early. They spent 2 months in NICU, so they were already fragile, and Federico, our son, is immunocompromised. But when we finally got home, we decided we'd move out of our old house and move into a new house to give them a nice, clean, safe place to grow up. The people who sold us their house lied and sold us a house which the state had issued a hazard warning on, which makes it illegal to sell the house to anybody with children. There is zero enforcement. There's zero consequences. They just lied. The consequences, however, not legal, but they are medical, and both our children became severely lead poisoned. In terms of numbers, and Mike, you'll appreciate this, the current belief is anything, or the current legal definitions, anything above 5 parts per million in your bloodstream will result in permanent neurological damage. The reality is, scientifically, any measurable amount of lead in your system will cause permanent neurological damage. But right now, the laws are a little behind schedule. They're at 5. Our daughter clocked in at 26 and our son at 48. The reason our son was so much higher is our daughter learned to walk sooner. And so she was on her feet rather than our son, who was on hands and knees, and from hands to mouth ended up becoming much more poisoned. The state evicted us from our house, threatened to take our children from us, all because we were living in a house that's illegal to be occupied with children, and we didn't know the people who sold it to us. I've been an activist my whole life. In terms of time frames, my first real political rallies were with Abby Hoffman and Amy Carter. So I've been in the game of activism for some time. And so as a scientist, a parent, and an activist, I wanted to find out how this could happen to our kids and why is it happening. And I found out that Massachusetts has such outdated laws regarding lead poisoning that they've allowed the creation of a loophole which exempts health insurance companies for covering the treatment of lead poisoned babies. That seemed like a simple enough solution to close. So I wrote a bill. Not one Democratic representative agreed to co-sponsor it, despite the fact that we had 6 of the world's recognized experts from the Harvard Lead Summit determined that these were the changes that needed to be made to make lead legislation up to date within Massachusetts. Not one could sign it. After a huge battle, I managed to get 2 people to sign them, neither of which were Democrats, both Republicans. So, this whole vote blue no matter who baloney. Why are we not just voting for things that are protecting the environment and children? And how can you not vote for something which prevents babies from being poisoned? I mean, it just blows my mind. So when I tried to get them to sign this, even my local representative refused to sign it. And when I asked why, she said, because nobody goes against the health insurance companies in this state. I mean, number one. So I said, fine, I'll take a different approach. In the same way that when your car doesn't pass inspection, you have to have a big R on your windshield until you fix it. I said, great, we'll write a new bill which requires any house that doesn't pass inspection to get an R saying lead poisoning can't sell to babies on the front door. That cannot be removed until it's remediated. The response that time, nobody in the state goes against the real estate lobby. So capitalism is allowing children to be poisoned willfully because nobody wants to lose profits on a house and nobody wants to go against the health insurance companies because we get so many donations from them. I mean, the Congressman Richard Neal, who is the congressman in Massachusetts' 1st District, receives the highest number of contributions of any member in Congress from the health insurance lobby. So he's been, despite Massachusetts' illusion of progressiveness, he has been one of the main obstacles to Medicare for All. And it's because why would he want to give up the donations?
Absolutely. Yeah. I mean, he has the ability to literally call a floor vote on
Right.
Medicare for All. Because what do we have? Like 125, 135 signatures of reps? Yeah, I support it. Okay, what you doing about it? Because most of y'all don't even so much as tweet
Right.
about it and use a hashtag. So you're right. We actually had an action. I came up with the phrase. Thank you very much. Don't be a dick, Neil.
Right.
But essentially, people went to his house and demanded that he hold a floor vote. What are you scared of? Just a floor vote. That's it. We want people to take a stand. Are you with this or are you not? We want it on record. Couldn't even do that. So, yes,
Yeah.
huge
But Joy,
obstacles.
you picked the perfect target, and what's worse is the mass Dems are protecting him. So when in the last election cycle, Morse challenged him in a congressional race. Morse is the mayor of Holyoke, who had done a really good job of improving Holyoke and had done really remarkable work. He challenged him challenged Richard Neal to be primaried. Weeks before the primary, a scandal came out which accused Morse of all sorts of sexual improprieties. It was a huge blow to his campaign. Of course, he lost, and weeks later, it turns out the head of the Massachusetts Democratic Committee, Gustafson, no, oh dear, it'll come to me, was responsible for it. He confessed to it. He apologized for it. And then days later was almost unanimously reelected as chair of the Democratic Committee. So, right.
I don't know why like anything surprises me anymore. Mike, would you like to add anything? And also, as a doctor, have you yourself personally witnessed anyone who has those effects of, air, water, or any kind of environmental cause of health issues?
Yeah, so a couple comments. I think, so first, Nathaniel, hearing that story, I'm really sorry to hear about that. It's ridiculously infuriating that we live in a society that can both allow someone like Jeff Bezos to accumulate the wealth that he has accumulated, and we also live in a society where somebody cannot live in a home that their children are just safe from lead poisoning in 2022. But reflecting on what you said after writing those bills, seeing the responses, those types of things, reflecting on that, from that to what Adam said about, seeing the Biden administration push for even more oil drilling and let's just face it, more environmental destruction in a time when we are seeing pending climate collapse, species extinction, and then all of the health effects of basically what's downstream of the capitalist system's functioning, seeing like those types of things and how they're functioning today is combined with another thing that, Adam, what you said about, looking at how the environmental pollution affects people's general well-being. I saw that in New York, for example, where I was working in a clinic in the Bronx, and a lot of people were coming in affected by COVID, and the Bronx is one of the most polluted boroughs that there is because highways were just built right through the Bronx, basically a form of environmental racism. The point that I want to make about all of this is whether it's in what's happening in the Bronx and what happened in New York or what Biden's doing, that's all happening under Democratic administrations. I think that's super important. There's this idea that the Democrats are somehow our savior, and every time that there's an election cycle, they just pit the Democrats, kind of hold people hostage and say, oh, well, if you don't vote for us, then look at who you're going to get. And I think that we need to come to a conclusion that the Democratic Party is a capitalist party. The Democratic Party does not care about the general well-being of the public. They are a capitalist party with just a few more bells and whistles that have been able to weaponize progressive rhetoric to be able to get votes and actually to be able to stifle and shut down working class movements that would actually push our society in a progressive direction and actually challenge the downstream effects of the capitalist system and potentially the capitalist system as a whole. So I just wanted to say that as one thing. And the other thing, to more directly answer your question about what I've seen, is it's not just, what I've seen in the healthcare setting is not just the result of yes, it's a result of the environmental effects and a bunch. It's a result of a conglomeration of things basically that affects an individual's health. I think that what the healthcare system does very well is individualizes rhetoric around systemic problems. So we saw that during the pandemic. all of the individualized rhetoric. You need to wear a mask. If you don't get the vaccine, it's your own problem. You need to do this, that, or the other thing. To when even when it comes to diagnoses, well, you have COPD, or your lungs are being affected this way, or those types of things. Everything is individualized. It's partly individualized because then that makes illness commodifiable, and then hence able to be profitable, basically, in the healthcare system, the way that it functions. But I think that it's important to recognize that what we're seeing in the result of individual health, community health, societal health, and then the health of the general world and biosphere is a result of the violence that exists inside of the capitalist system itself. The way that I talk with my patients about this is we slowly over time go from, okay, well, what's affecting you, to, okay, well, what's your workplace like? We get into conversations about alienation in the workplace, the Marxist terminology of alienation, how that affects your, not just your physical health, but your psychological well-being, how you're divided against your fellow worker, how the boss and capitalists basically in general tried to divide you against each other so they can continue to exploit you. And I think that having conversations around those types of things are super important. We try to get to conversations around, it's a term that Engels spoke about, social murder, and how I think that basically anything that from what is happening, what happened during the pandemic to what's happening with the environmental destruction that we've discussed, it's a form of social murder that's actually being perpetrated by capitalism. These aren't passive things that are happening. These aren't, oh, well, they like to use a lot of, in corporate media, passive terminology. It's just such a darn shame that we have a pandemic. It's just such a darn shame that this thing is happening. These things, they're actively being occurring, and they're actively occurring through the violence of the capitalist system. These crises are built into the capitalist system. It's part of the DNA of capitalism. There was the last thing I'll say is there was this terminology from the 19th century. It's a Marxist theory of that there was a state of wars, crises, and revolutions. I think that we are in a state of like a uptick of wars, crises, and we're seeing more rebellions than revolutions currently. But we're seeing that as a result of how the capitalist system functions, and everything that we're talking about is built into that system.
Yeah, Joy, yeah, absolutely. I just want to get the name right because it's important. It's Gus Bickford is the chair of the Massachusetts Democratic Committee. He's the one who orchestrated the attack against Adam Morse and defended Dick's dickishness. Adam, if you get a chance, I read some while ago, again, dealing with children being harmed, and now in this case, even prenatally, I'd love you to touch on the fact that they're now finding microplastics in placentas. That is something, if you could elaborate on that, I think. Let's talk about the children. If we're talking about the future, my children are just 2, but there are millions of children who are being affected, not only by air pollution, but the microplastics. And Adam, I'd love to hear some of your insight into that.
Yeah, I mean, so I'm a chemist by training, and chemists pride ourselves on our material science and producing these compounds and these polymers that make up plastics that don't degrade. But that means they don't degrade. So when you ingest them, they incorporate into your body's system. And during pregnancy, they will incorporate into the placenta, into your children, and it's a generational pollutant transfer. And it's not just these microplastics, it's the plastic additives, things like bisphenol A, things like UV filters, which strongly mimic estrogen. These are very hydrophobic molecules. It means they're stored in the fat, and thus they persist a lot longer in human bodies because they'll just stay in our fat stores.
Wow. I'm learning a lot. Andy, is there any way that we can play my two Danziger clips now? They seem to really go with what we're discussing. And then I want to environmental things like this also are affecting the poor and people of color. Do you think that it's that it is that way on purpose?
Well, I think it is a reflection of a phenomenon that many call environmental racism. That's for sure. In other words, the worst environmental practices often take place in the poorest communities, often communities of color, in this case, indigenous peoples. You know, you see this all over the United States and really in many places around the world. I mean, for example, Chevron has a refinery in Richmond, California, which is a low-income, diverse, mostly minority community across the bay from San Francisco. And there's like a massive polluting, cancer-causing, like mega gross industrial site where oil is refined, like right in the middle of an urban area. It's crazy. And the level of asthma in that town because of the pollution from Chevron's refinery is off the charts. There was a fire there 10 years ago. 15,000 people had to get medical treatment. 15,000 for breathing, toxic vapors. So that's an example of environmental racism in my view. And I think what is happening here in Ecuador is another example. And I think people need to sort of look at it through that frame to understand why certain communities in our society pay a much higher cost for environmental damage than others.
Question, I just want to ask you about 1881A. Are you familiar with that?
Honestly, I'm not. Can you explain it?
Yes. So basically, it happened in Libby, Montana. There was an environmental crisis, and the town was able to get immediate Medicare full insurance because of it. And Biden has the ability to do an executive order on it, meaning he literally could sign an executive order today to give every single one of us full coverage, and he is not. So I wanted your take on that, on national Medicare for all, what you think it would do for people environmentally who would suddenly have the ability to, go to the doctor and have, medical services from things, that have happened to people like in Flint, things like that, actually have the ability and the means to take care of those things.
He should do that. He should sign that order or those executive orders to deal with the health impacts of environmental crises like Flint and, like
Absolutely.
things that are happening all over the place. I mean, the reality is people are being severely harmed by environmental impacts. Sometimes they don't even know it because it's imperceptible. It's little by little in the water they're drinking or the air they're breathing, food they're eating. But absolutely, I mean, let's just start with the National Health Plan. My golly, every country in the world has one but us. I mean, come on. So many of our problems in America would be solved if we just gave people basic health care. Health care is a right, should not be a privilege. So I would support that. And I think there's so much President Biden could be doing, things like that, to carry out an agenda that meets the needs of the majority of the people of this country. And unfortunately, he's not moving fast enough on a lot of these issues, including the cancellation of student debt, while we're on the subject. So, President Biden needs to release me, needs to take back the prosecution from Chevron. He needs to sign executive orders so people can be treated medically or have their healthcare needs met when they're victims of environmental contamination. And he needs to fight harder for a real national health plan. But again, he's just a piece of it. Ultimately, the power comes from the people, and it's up to us to really do the organizing, the harnessing, and the leveraging.
Donziger, you are a fucking hero. Free Donziger. We stand with you. We love you.
Heartbreaking to hear him say, "Release me." I mean, just jeez.
What an honor. He's such a hero. But the interesting thing is, for those who, for whatever reason, aren't knowledgeable about Stephen, the thing is, he helped the indigenous peoples in Ecuador. And the difference between that is that these people are so poor, they don't have doctors for miles and miles and miles. But here's the thing, we do. But our people just can't afford them. So, you're seeing some of the same things happen, but they are poor people and do not have access to any kind of medical care. And we do have the ability to have medical care, but we literally don't have the means. So I do want to discuss 1881A. For those who are watching who may not be familiar with it, I want to make very clear, Biden could sign an executive order literally right now and give all of you 100% coverage, and he is choosing not to do it. So let's be clear. We are watching eugenics of the poor. He doesn't care. Let's just be clear. If he cared, he could take care of it. So first thing, tell him to do it. I don't care if you tweet at him. I don't care if you call him, email him, send freaking pigeon postcards. I don't give a shit. Tell him he needs to do this. This is unnecessary violence. So that's the first thing. But also, I want to get the three of your perspectives on 1881A and the fact that we literally have legislature that could do this immediately. So I guess, Mike, I'm going to start with you as a doctor. What are your thoughts?
I mean, I think that it is completely, there are many explanations for it, but there is no reason why frankly, it's the heart of imperialism in the United States, that there is any reason why healthcare should not be a right. There's really no reason why anywhere in the world healthcare should not be a right. When we're talking about the United States, it's absolutely ridiculous that thus far we continue to have the system that we have in the way that it functions. It does not allow, as a healthcare worker myself, it basically pushes healthcare workers like myself to give more poor care. It's not just like necessarily the access that people have, but in the actual healthcare setting, basically people are funneled through that healthcare setting just like items on an assembly line. They're funneled in and out for quick financial extraction and sent right back into systems that are harming their health. And that's pretty much just the way that the system functions. And we're told, oh, this is part of, like, it falls kind of under the framework of disaster capitalism. Clinics like the clinic that I used to work at, that has Black Lives Matter and all these progressive phrases plastered all over its walls, basically during the pandemic was just telling people, you need to ramp up how fast you're seeing people. Don't push back against the dynamics of how you're seeing people here, because we just need to stay open, all of these types of things. And this is just how our healthcare system functions. So it's completely absolutely, there's no justification for the fact that we do not have a universal healthcare system today. I think that whatever the policy it is, to get to specifically to 1881A, it's clear that again, to get back to what I said before, Democratic politicians like Biden are beholden to the corporate interests. and that's why that nothing has been done thus far. I am personally of the framework that Medicare for all generally, national improved Medicare for all generally, is an initial step. Whether that would be getting people healthcare overall through 1881A or you name it is an initial step. But I think that what we really need is we need complete nationalization of the entire healthcare infrastructure and put it and particularly it needs to be put under worker control.
Yep.
That I think that is the ultimate end goal of what needs to happen. The workers in these healthcare industries, that's not just where healthcare is actually being, given. So not just in the clinics and hospitals, but also in the entire healthcare infrastructure. That's the pharmaceutical industrial complex. The whole insurance industrial complex should just be eliminated because it's a whole parasitic industry. But that all of that needs to be nationalized and put under worker control, because really the working class are the only people who can determine what is best needed for the majority of the population. It's not capitalists, it's not the bosses and their interests. And I think that the real key to winning that, whether it's that first step or you name it, is mobilization of the working class. Because I think that that's the way that it's going to come. It's not going to come through asking for, oh, could you please just give us this thing? Because clearly the corporate politicians do not care about giving us these things, or we would have already had them. At the height of a pandemic, it would have already happened. It needs to be demanded and forced through the working class.
Absolutely. And I digress slightly, but you touched on imperialism, and you are so right, because something I say is that, people wonder why we don't have national healthcare system and we don't have free college. Why do people enroll in the military? Free college, free insurance. It's linked, period. I'll go around in a circle. Adam?
Yeah, I just want to respond to something Mike brought up with mobilizing the working class. Joe Biden would not be in office without progressive young organizers. We wouldn't have control of Congress, we wouldn't have control of the Senate without a massive effort from young progressives. And I speak as a part of this generation. I organized with the Sunrise Movement, which really came into effect after being inspired by the Bernie Sanders 2016 campaign and mobilizing to elect Green New Deal progressive champions, the Squad, in 2018. And we showed out for Biden. The Sunrise Movement made over 1 million calls for Biden. And we elected a president, and we took control of a Congress and Senate on the mandate of a Green New Deal, on a mandate of Medicare for all, on a mandate and a promise to cancel my student loans, which still hasn't been done. And so beyond just being a moral imperative, the political reality is that the Democratic Party is propped up by the labor and the organizing power of the progressives in the party. And if they want to continue to stay in power, they need to start delivering some of these policies that we're fighting for. Because we're fighting for the policies, we're not fighting for the party. And I've seen this in my friends. If you don't deliver the policies, we're going to abandon the party, and we're going to look for alternative means of trying to get to the better future that we're all trying to fight for.
I guess I kind of have to push back on that, because Biden never said he was going to do any of those things. And we have 40 years of proof. He does not support Green New Deal, Medicare for all. He legit said he'd veto it. So I think we need to be more realistic than the let's push Biden left. It's not working. And I think that it was sad, quite frankly, to see so many people think that simply getting Trump out of office was going to be some kind of, magical thing, essentially. So we just need to, the power's in us. Let's put it that way. Women's right to vote, human rights, civil rights, LGBTQ. These movements happen from people in the streets. not by electoral politics. So we really, really want to focus, on those things. I mean, you're talking to someone with a Bernie tattoo. You're talking to someone who literally picked up and moved to Iowa to volunteer for 5 weeks for him. But at the same time, we cannot count on any politician at all, regardless. And I guess, that kind of goes to you, Nathaniel, because you actually ran for office. And I'm like,
I
you're
did.
so wonderful. Why? But you did. And you had a
Yep.
great platform.
Thank you.
So, what's your response on all of this?
Well, going back, I'd like to touch on one thing that Mike said, which really touched a brilliant point. The healthcare system in this country is parasitic. That's the word you use, and I can think of no better term. And what we do with parasites, we purge them from our bodies, right? If we've got worms, we eat papaya seeds. We've got to purge the parasites, I think might be a good way to look at it. And Mike, thank you for describing it as a parasite, because I'd never thought of it that way. But there is no better description of our current healthcare system. In terms of healthcare system, I don't know if you can see, I've got a couple little weird bumps here. There's one here and one here. In October 29th, 2004, I had an accident, and I shattered my C2, my C5, and my C6. That meant that I was paralyzed from here down. And when the accident happened, we wrote to the Christopher Reeves Institute, which is a specialist in spinal cord injury, and sent them the x-rays and said, what do we do? And the reply was, we're terribly sorry about your accident, but here is the name of a really good wheelchair company, and we're pretty sure we can get you a discount. That's U.S. healthcare. I walk. I dance badly, but I dance. And I can do all of this because when I had my accident, I wasn't in the US. I was in Italy, which has not perfect, but something equivalent to Medicare for all. And so my 18 months in intensive care, my 12 surgeries, and my 2.5 years of rehab cost me a total of €35. Under $40. If that had been treated in this country, first off, they wouldn't have treated me, period. No insurance company would have allowed the treatment. But if for some crazy bureaucratic glitch we managed to get it approved, my children's children would be paying off that debt. And it is not right that this country, in theory, the wealthiest in the world, should allow people to remain handicapped for life or with a permanent disability when there is the technology to fix it. It's just inconceivable. My mom, who is 90, I took my parents in when the pandemic started because they need a little help. She fell the other week and broke both her wrists. Not a good situation. She had surgery this past Monday. And the doctor said to me, we wouldn't have approved the surgery if she was living on her own. So in our country, our mindset is people are disposable. Had my mother not been living with grandchildren near her, they would have said, she's no longer useful to society. Let's not fix her. I mean, how ghoulish can we be to say, all right, you get to stay in a wheelchair. You get to stay with broken arms for life because you're too old. I mean, it is infuriating that this is the situation. And Mike's absolutely right. It's a parasitic society that is, for the sake of greater profits, is allowing this to continue. There is no reason that we should be able to do this. If every other country is doing it, we should have it too, even more so than before, and certainly during a pandemic. going back on just one earlier topic, when we were talking about the lead poisoning, I tried to get the state records on our house. It took a legal battle. It took thousands of dollars. And then finally we were given the documents which describe the issues on our house. Care to see what those are? And Joy, even with your eyesight, I think you'll be able to see this perfectly well. This is what several $1,000s of legal battle came out to for the state to give us the records on our house.
Wow.
That's it. That's all the information they would give us in our house. It has the page numbers and the date.
Perfect. Very
Yep.
useful.
Yep.
Incredible.
Yeah. In Massachusetts, the progressive state.
Yeah. Well, you got Liz Warren, so
Right.
what a hero.
Just rub it in. Why don't you just here's a little
I know.
salt.
I'm
Thanks.
sorry.
Jeez.
But that kind of, makes me think about what I went through. I mean, 2 years ago, I literally woke up without most of my eyesight overnight. Literally. No precursor, no nothing. So in addition to that, just having that trauma exacerbated with, each eye treatment, each eye over $12,000 every 30 days. And it wasn't pre-approved because my diagnosis is so rare and I'm under 55. So they were like, yeah, I mean, we just you either need to sign this paper saying you'll pay out of pocket if they deny you, or you just wait. So now the treatments I was getting, my sight will never come back. It's not going to happen, but the treatments was to try to stop it from getting worse. So every day I wake up, it's worse and worse. And 2 years later, now 85% of my sight is gone. And could I have had, more sight longer? Absolutely. Who the hell has $24,000 every 30 days? So, it is violence. People are being put in this situation. It is a hostage situation. If you want to take care of yourself, you risk medical bankruptcy. And I know people are going to say, well, you can apply for charity care. No, I can't. My husband works full time. I was denied. We filed joint taxes. It has nothing. If I was single and lived on my own, but we're married. He works full time. So no, and I have insurance. I still pay thousands of dollars every year for my eye surgeries and my treatments, things like that. Deductibles, copays, all those fun things. So yeah, I guess we'll go back around again. And Mike, as a physician, what have you had people come to you and say, I don't know what to do. I need this. I don't have the means.
Absolutely, all the time. I mean, I've had patients come in many times, for example, elevated blood pressure. We prescribe a blood pressure medication, comes back, the blood pressure is higher, sometimes comes back in what we call their hypertensive urgency or hypertensive emergency, where the blood pressure is so high it can potentially cause problems with other organs, so whether brain, eye, kidney, you name it. And I've had patients basically say, well, it's because it was going to cost X amount at the pharmacy. And it's absolutely disgusting that we live in a society where people have to make that type of choice, where medications might be that much money. And there comes with it this connotation like, okay, so we can, at our clinic, we have find ways to get the medication for cheaper or give it for free or this, that, or the other thing. But because of this dynamic and how it inherently functions, people just feel like I don't even want to go to they feel ashamed. They don't want to even come to speak because of the violence of how this system works. I've had patients where there's pretty good diabetes medications these days, like ones that, for example, I prescribed an injection to a patient that he would just use like once a week, and it brings down the number that looks at the blood sugar called an A1C pretty well. But when he came in, the A1C was even higher, and I talked with him about what's going on. It's because the medication costs X amount, and when you live in a society where people have to make a decision about whether to eat that night or have medication to literally control their blood pressure, you are living in a basically completely like failed state the way that it's working. I mean, it's absolutely ridiculous when you live in a society like that. And when you juxtapose that you live in a society where somebody needs to make a decision whether they're going to eat or take their medication that night, or pay the rent or take their medication that night, and at the same time, actually, I looked this up because I didn't know the number off the top of my head. But Joy, when you were mentioning how much money a month or those types of things, I looked up. Jeff Bezos makes $140K a minute. When you live in a society where somebody makes $140K a minute, and when you live in a world where the wealthiest basically increase their wealth by, I think it was like $3 or $5 trillion just during the pandemic alone, as millions of people died because capitalist governments around the world made decisions to keep industries open, to not pay people to stay home, to not give paid leave, to not do all of those things, because the continued profits of the ruling class is more important than the lives of millions of working class people. When you live in a society like that, and when you live in a system like that, that system's got to go. So not just the healthcare system, the way that it functions, where people have to decide between food, rent, you name it, that healthcare system's got to go, because we should not accept a healthcare system to function that way. But we should also not accept an economic system that's destroying the only planet we have to live on, and that's continuing to kill people, continuing to cause the wars that we see right now around the world, destabilize governments around the world, and then that contributes to the ongoing climate destruction that Adam and others were talking about. That system itself has got to go.
Absolutely. And, speaking of Bezos, not even his employees have good health care. That's what's insane. Like, even if people say it's a false equivalency to say, well, he makes all that money and we don't have health care because it's not related. Dude, his people literally do not have good health care. So it is related. Adam, I was sent this article, and I want to get your take on it. It's by Newsweek, and of course I won't read the whole thing, but the title kind of sums it up. About 200,000 Americans die every year from air pollution. This is insane. I didn't realize those numbers were so huge. And I can send the link, and we could put it in the comments. But yeah, what's your response to that? I didn't realize. I knew a lot of people got sick, but 200,000 deaths every year.
8 million globally. It's the emerging health threat of our time, is airborne exposure to these pollutants. About half of it's outside. That's your typical urban smog. If you live in a city, you're more likely to develop asthma, die earlier, and half of it's indoors. It's from methane-powered stovetops. If you cook with a gas stovetop, you're emitting methane gas into your house, you're emitting particulate matter, you're emitting nitrous oxides, with completely deleterious public health impacts, which go on to make you more at risk to further respiratory disease. And so we live in a country where a population is poisoned, and there's no way to treat a population comprehensively without single payer Medicare for all. Because a lot of these health impacts, you can catch them early, you can treat them, you can do preventative and restorative medicine, but that's not how a medical system is set up. It's cliche, but it's a sick care system. It's not a healthcare system. It's completely reactionary. And so without comprehensive early detection of the accumulation of these pollutants in your bloodstream, getting standard panels regularly, getting comprehensive panels, and also just having a society and economy designed around, when you identify these exposures, removing them. Not a society that's going to sue you or try to take your kids away for being in a home with lead exposure, but a society that'll replace the lead pipes, a society that will give you housing as a human right, and help you transition to a safe location. I don't see that, but I think that's the society we all need to build together.
And that that brings up a good point. Like, even if we considered performative, other countries have at least declared a climate emergency. The United States has not even so much as done that, which is alarming, but I think it's kind of obvious the reason they haven't done that is because then they're going to have to actually do something to act on it. And also, I mean, Biden fell asleep during the climate conference, so that's not really exciting. So I guess I'll continue going around. Nathaniel.
Yeah. So, I mean, falling asleep was embarrassing, but let's be real. What was worse is increasing the number of drillings days after the COP26 conference. The drilling he has permitted is the highest ever. Not Trump, Biden. And he did it days after his commitment to the Paris Climate Agreement. Just disgusting. In terms of environmental racism, the issues in terms of lead poisoning is most often in older homes that have not been remediated. Those are usually in lower income neighborhoods. Those are unfortunately usually more racially diverse neighborhoods. And when you think about the people who are living in those situations, that means they are the most likely to have lead poisoned children. And the treatment for lead poisoned children, we didn't touch on it, is $3,000 per week per child. The minimum is 1 year of treatment. Realistically, you need 2 years of treatment. So we are saying the people in the very poorest neighborhoods and the most diverse neighborhoods, we are going to saddle with a bill of $12,000 a month per child. I mean, it's just disgusting. In terms of the indoor air pollution that Adam touched on, that's actually the foundation of why my company started back in '99. So my company, half of the world's population cooks on open fires, the famous 3 rock stove. So basically 3 rocks, some sticks underneath, and a pot on top. And those are usually indoors and usually without a chimney. The highest rate of death, usually among women and children who are then attached to the moms as they're cooking. So we work on clean cooking solutions which have lower or no emissions and address global health issues. It's 3 billion people every day are exposed to that sort of indoor air pollution. It's just horrific. In terms of the climate crisis that we're not addressing, drilling is not the answer to addressing our energy needs. And even if we stopped all fossil fuel production and use today with a magic switch, because of existing CO2 levels in the atmosphere, global temperatures will increase for 100 to 1,000 years. So any of these goals that Biden's talking about of 2035, 2050 are absolutely just smoke in your eyes, quite literally, not just the toxic type, but the verbal type. And this means that if we're going to address these things, we have to start talking about correcting past mistakes. And we, as the nation that has done the most harm globally, yes, China is surpassing us now, but cumulatively, nobody comes close to us. We have the greatest responsibility in bringing down existing atmospheric CO2 levels. So the issues right now, our administration is accelerating climate change, the current administration, and anything they talk about for green deals, green promises, green anything, it's just a lie. You know, a goal of 2035 means we've missed the tipping point. A goal of 2050 is just laughable. If we want something to really, really happen right now, we need commitments of, okay, 2024, we will do this by 2024. The current administration has that authority. They won't after, because let's face it, the midterms are going to be disastrous. They're going to be an absolute bloodshed everywhere. So Biden's administration will only have any authority until 2024. And even after January of this coming year, we won't have much power, because we won't have control of the House. We won't have control of the Senate. They've done everything they can to lose desperately and gloriously. I mean, if somebody had to write a play on how to lose the midterms, they would have been the best play, the best game, because they've really done everything you need to catastrophically lose. So, Adam, I'm glad you're part of Sunrise. Sunrise is something that I really believe in. I've been to many, many, many Sunrise meetings, and until the pandemic, was a monthly attendee. I think they're great. They endorsed my congressional campaign, and I'm glad you mentioned that I did run for Congress, despite the fact that twice during my campaign the Democratic Party disenrolled me without telling me. So, wee.
But you're still fighting. That's what matters.
Yes.
As
Well,
trite as it sounds, you are a fighter, and that's why I had to have you on this panel.
we have
So
to.
I guess, and I don't want to ask this question to be defeatist. I just want people to understand the severity. I want to go around and have each of you explain from your perspective where you think we are going if we do not have national improved Medicare for all. Where are we going? And yes, I agree with Mike. It is the floor. We need way more than that, but this is the floor. So each of you, please, address where you think we're going if we don't get this like now. Mike, I'll start with you and go around again.
Okay. Are you also okay if I quickly comment on the last question and then answer your question? So, and the reason why I wanted to comment on the last question, just a couple quick things about the ecological crisis that we're facing. I previously talked about, individualizing illness and those types of things. I think also a lot of the responses to the pending ecological crisis have been, there's an attempt to individualize those. The recycle more, we just gotta get your green, go buy your Tesla and that's the solution, those types of things. And I think an important thing for everybody listening to hear is just how that idea is completely bankrupt, because a majority of the admissions, 70+%, are from the top 100 companies in the world. So a majority of what we're seeing is from the top companies in the world. And then this other specific thing that I wanted to make in connection to imperialism is the fact that the US military is the top polluter in the entire world. So we are not going to actually confront the ecological crisis that we're facing unless we confront US imperialism, because the US military is continuing to basically destroy the world. And in that vein, I think it's super ironic that recently, just goes back to how bankrupt the Democratic Party is, that bill that was voted on, going back to the pandemic, funding for the pandemic was cut, when meanwhile, continued funding for the military was approved. Lenin talked about imperialism being the highest stage of capitalism. And I think that unless we actually confront the imperialist system, we aren't going to, and particularly at the heart of the imperialism, the US military, we aren't going to confront the ecological crisis that we're facing. Where, to answer the question of where we're going, if we don't achieve Medicare for all, I think that we're going to continue to see even further what we're seeing now, which is people not receiving the type of healthcare that they need. Insurance companies are already denying chronic reimbursement for chronic medications. They're already denying paying for people's healthcare. We're going to continue to see that. And nobody should have the delusion that COVID, not that even COVID's over, but that COVID is the only pandemic that we're going to see. As we continue to destroy the environment and continue to encroach on remote areas of nature, we're going to continue to see like different types of viruses, or you name it, jump from different animals or plants or the environment to humans. And then we're going to see them spread along the networks of capitalism and go globally. And I am waiting for the time with fear that we're going to see another, illness jump, and hopefully it does not have a higher mortality rate. It does not have a rate of mortality like Ebola or something like that and go global, because we've seen that the ruling class is completely unwilling to address the pandemics like that, and that the capitalist system is completely unable to address the outcomes of the crises that it creates. Instead, what the ruling class is doing right now, I think Nathaniel was talking about this a little bit before, the capitalists see the writing on the wall. They are building bunkers and those types of things because they know that shit's going to hit the fan. So that's why we're having space launch explorations and building bunkers. I think that the only solution is for the working class internationally to mobilize and push back against this system, because pushing back against the system will also help us to achieve the type of healthcare system that we need in the United States and other parts of the world.
Absolutely. And, you are so right about imperialism. And I want people to, I've actually read much of the Build Back Better bill. It's 2,700 pages, so not entirely. But I want people to understand that was so much of breadcrumbs in that. It was nothing. And on this topic, it had even billions more to our military. So even having the highest military budget, the defense budget, in history, they want to give even more. And yes, it is our biggest polluter without question. So yeah, if you are for the environment, you need to be anti-imperialism. They go hand in hand. Adam.
Yeah, just to join in on the U.S. military, they're the cause of a lot of environmental crises in San Diego, where I live. Marine planes land next to a school I work with, and we track the particle counts of the leaded gasoline that they're using, emitting like localized air pollution and airborne exposure to lead. Navy ships are also polluting San Diego Bay, and really impacting the worst brunt of air pollution is in Barrio Logan, right next to that port. And yeah, we need to confront all crises at the same time. We need to confront capitalism. We need to confront imperialism. We need to confront the healthcare crisis. We need to confront the climate crisis. Because inherently, capitalism is extractive. We extract the earth and we get untold amounts of pollution. We extract the labor and we get defeated and we get a sick pool of people. And we extract healthcare and we get deaths in our healthcare system when folks are underserved. And I agree with Mike. I think the only thing that's going to change this is people power in the streets, inspiring change and showing that we know enough is enough and we're not going to stand for these systems of oppression any longer.
Absolutely. Nathaniel?
Yeah, so I'm sorry I kept flicking out the power.
Okay.
We had a power loss, but in any event, yeah, in terms of where I see us heading right now, if we don't change things, first and foremost, I see eugenics as being the game plan. The fact that people of color and the disabled are the most critically affected by the COVID pandemic. It is eugenics, and more people need to be calling it that. Um, Secondly, um, in terms of military spending, only 15 members of Congress voted against the latest budget. Only 15. You know, no change is going to come with 15 votes. We need complete revolution in terms of that. And if we want to really talk about national security, I've been toying with for years is all right, right now we're at $770 billion in annual expenses. If we took $770 billion and turned that into humanitarian aid and environmental remediation, not only would we save the planet, but we would be the most loved country in the world. Nobody is going to attack the country that is feeding every nation in the country in the world. Nobody is going to attack us. At that point, you are increasing national security more than any bomb will ever do. I happen to think that doing good will make us safer than having massive arsenals. And just the fact that our nuclear weapons issues, nobody should have nuclear weapons, but the fact that we have them, the cost of just keeping them stable and not dangerous is greater than the cost. One of those bombs is greater than the national cost of some nations for everything. So we are just bleeding money, which we could be using for far better good in this world. Those are the things I see that we really need to focus on. And with only 15 people in Congress willing to vote against that, I don't see any change happening soon unless we really ramp up the political efforts. And Sunrise, kudos to you, because you've been far more effective than Justice Democrats. You've been far more effective than all these other groups that claim to be progressive. And the way you're being effective is, I think, the only way that's going to change it, which is you are getting people at the lowest, smallest offices elected as well. And so you are taking a page out of, and I hate to use this phrase, but you were using the evil that was done by the Tea Party and doing it for good. You know, getting people elected on school boards and planning commissions and all the way up is how we're going to get that change, because we can't count from the top down at all.
So unfortunately, we are like at time, but I really wish this conversation was like 5 hours.
Yeah.
I feel you guys are awesome. I do just want to give you guys one last word. If you have like a lasting thought you want people to take away, and then also where people can find you, if you have a Twitter, a website, anything like that. So we'll go around again, Mike.
Crap, I don't know my Twitter off the top of my head. Maybe somebody can put it in the chat.
Yeah.
But let me just say what I was going to say, and then I'll try to say my Twitter. I think that the lasting thought that I would try to impart is it's important. We need to view things as a battle of classes here, a battle of the working class versus the capitalist class. Whether it's like healthcare workers or other work sectors, need to find militant modes of combat, whether it's through union activism, but in that, like fighting for broad union democracy and fighting against democratic bureaucracies that betray union militancy. But I think in general, workers need their own organizations to organize in their workplaces, to organize globally, to push back against these types of systems. I think that that's kind of my lasting thing. We write a lot about this at Left Voiced. You can find my writing at leftvoiced.org. I encourage others to follow us, write for us, engage with us in our international. I think my Twitter is something like Dr. M. Pappas or something like that. but I think it's also written on the Left Voice website.
I just typed in your first and last name and it came up when I was searching for you.
There we go.
That's the easiest way. Adam, how about yourself?
Yeah, so I joined the Sunrise Movement for their ethos of militant optimism and radical joy, and envisioning the better world that we think is possible, and then fighting like hell to get it. And so I think it is important for our mental healths and for sustainable organizing to always hold that better future in our mind and not get too bogged down in the crises we face because they're scary. They're existential threats. And it's easy to get lost in despair. And so I'd recommend, like, anyone watching, if you're not already organizing, organize with a group of like-minded individuals, organize at work with your labor, organize with your passions, and join together, because individual actions won't produce societal shifts. It's only through collective action with groups of dedicated, talented people that we're going to win the battles that we need to get won. You can follow me on Twitter at Chem Cooper. So CHEM and then my last name Cooper.
And Nathaniel.
Great. I agree. And Mike, your Twitter is DRM underscore papas.
Thank you.
So, you're welcome. My Twitter, by the way, is a voice for the number 4 MA and then the number 6. So yeah, my lasting thought on this is I'd like to agree with Adam. We have to be aggressively optimistic, because if we're not, there's no way we're going to have the energy it takes to fix anything. Clinging to those threads of optimism is vital. Getting more and more young people involved, maybe get the voting age reduced to 16, where people's minds aren't yet corrupted by the establishment, would be a big way to help the world. And transparency of government. Again, not to complain constantly about my state, but Massachusetts is the least transparent state in the nation, the only state where the entire legislative body is exempt from Freedom of Information Act requests. So, you're right, in darkness, right? So yeah, optimism, transparency, and get the youth involved, and I think we have a chance of doing something good. If not, let's hope passports are still valid, because but the problem is these problems are global. We can't run away from them. There is no fixing the entire planet and saying, well, I'm just going to go live in this one place, it's nice, because atmosphere is all connected, the pollution is all connected, the temperatures are all connected. So let's follow Adam's good advice and be aggressively optimistic going forward. In terms of this meeting, I too think it should have been 5 hours. I would have far preferred it being around the table. I love cooking for people. Come over. If you don't mind Italian food, I'll make you all 10 pounds fatter.
Well, thank you all so much. This was amazing. I would love to do it again. Of course, our summit is, today, just tomorrow and yesterday, but I think this is such a fascinating topic and such a perfect conversation to have. I am down doing it again in the future on my show because I think it's so important. So I want to thank all 3 of you again. You're all fighting the good fight. I will pass it to my comrade who is hosting the next panel in a moment, but I do want to share an exclusive, my dear friend Marianne Williamson, about the importance of 1881A. So we'll go to that first. Thank you so much again, gentlemen. So here is Marianne's special message for our
Right.
forum.
It should not have taken almost 1 million deaths of Americans for us to face the fact that COVID does represent a national medical emergency. Our system offers the president an opportunity to declare an official national medical emergency, which then allows him to expand Medicare to everyone. It's been done before. It was done in Libby, Montana. I've never understood, why isn't it being done in Flint, Michigan? It should be done wherever the health concerns of a population are such that medical care is urgently needed. We can do this, and it should have been done already. It hasn't been done for the same reason that we don't have Medicare for all. It hasn't been done because of the institutional resistance of the insurance companies, pharmaceutical companies, and so forth. We, the people, need to take a stand about this. And that is why all of us are in this conversation today, urging the president to declare a national medical emergency, expand Medicare to everyone, and help America get healthy. One of the reasons COVID has been so bad in America compared to other countries is because, for instance, our rates of diabetes were so high. And one of the reasons our rates of diabetes are so high is because of the high price of insulin. Too many people can't afford the insulin they need. And diabetes is one of the major pre-existing conditions that make people more vulnerable to COVID. We have a national medical emergency on our hand. We need this legislation. We need the president to declare a national medical emergency so that all Americans can have Medicare for all. Thanks.
That's my girl. And for those who don't know, Marianne Williamson is the reason I have my blind accessibility equipment. She's the reason I can still do things like this. It is because of her kindness and her doing a fundraiser for me and her advocacy for me, and my show and everything, that I am still doing this. So I forever will love you, Marianne, and I appreciate our friendship so much. As far as the topic we just discussed, I also have an exclusive from Jordan Sheridan about medical things he's witnessed in Flint. That will be later today. We also have panels on mental health, on disability, on healthcare workers sharing their stories. And we have a musician tonight, Timothy Bracken, who will be coming to us from Thailand. And our next panel is so incredibly important. They will be discussing racism in healthcare, and the constant inequities people of color face in our capitalist and racist system. So I'm going to pass it to my buddy, if you want to bring the panel in.
I just wanted to quickly mention, I have all three of the panelists, but I do not have the host yet. So I'm not, if you want to, maybe I could bring the panelists in and you could maybe begin the conversation until Elias arrives. I'm just not 100% sure where he's maybe having a few technical issues.
Okay. Well, I mean, I can start. Well, okay, let me. All right. Well, I am texting him. I can start. I am familiar with 2 out of 3 of the guests in any case. All right. Thank you all so very much for joining us. So Kim Brown. I did a show with you the other night. Dr. Claire Cohen, fellow Pennsylvania. It is nice to meet you. And Reverend Annie Chambers, always great to talk to you, and great to have you back. So this is such an important conversation, and it seems kind of odd for me to be hosting it. So I hope Mr. Cepeda gets here shortly. But in any case, I mean, let's start off with just getting your thoughts on the overall idea of racism and healthcare and things you have witnessed yourself, from actually, patients coming to you and sharing their inequities and things like that. We can go around like this. Dr. Cohen, as a physician, would you like to start?
Sure. So, what I wanted to get across to people is people who are not for Medicare for all will frequently say, well, Medicare for all by itself won't solve the healthcare inequities. And I want to say to them, yeah, by itself it won't. But what I hope to bring out through this panel today is that it will certainly make a big difference in addressing those inequities directly, and also it will help us in other ways to address those. Some of the things that we need to be aware of, for example, and just to make sure people are clear on this, this country, which is the richest nation in the history of the world, has among the worst health statistics of any of the so-called developed rich countries, which are about 25 to 30, maybe 35, depending on what criteria you use to use those. And a lot of why we have some of the worst statistics is because of those healthcare inequities. So I'm just going to use one, which is actually not in my field, but I want to use that one as an example. And that is maternal mortality. So the United States, as you know, has compared to the other European developed countries, or Western, if you want to call them, the worst maternal statistics, about 12 per every 100,000 live births, as compared to 3, 4, 5, 6, 7 in Canada. Well, if you look at Black American women alone, they have 3.5 times more than than white women. They have, for Black American women, it's 42 to 43 deaths per 1,000 live births. Okay, so that is really bad. But to give you a sense of how bad that is, I went and looked at all the mortality rates for all the countries in the world. If Black America was its own country, the death rate for Black American women is so bad that that country, a nation called Black America, would be 85th. It would rank 85th out of all the countries in the world. 84 countries would be better. So that means even some undeveloped countries would have a better rate. So how does Medicare for all play into this? Well, when we look at people of color, African Americans, first of all, they are the majority of people that have no insurance are people of color. If you look at Latinx and Black Americans, then if you look at underinsured people, Black Americans alone, for Black families, for Black families, the average Black family, even if they have insurance, they pay 20% of their income for insurance premium, as compared to whites who pay 11.66%. And when you look at medical debt, about one third of African Americans between the age of 18 and 64 have serious medical debt, which is at least $250 or up to thousands of dollars. Now, for Latinx people, that's 21%, but that's still high. For whites, that's 17%. That's still high. But 1 out of every 3 African Americans ages 18 to 64 has serious medical debt, and it's either because they're uninsured or underinsured because they have to pay. So I'll give a couple. I can be long-winded. So I'll give you a couple examples of what I'm talking about. One is from my practice, and one is from my real life experience. From my practice, or actually, I'll give you two from my practice. One is I had a parent who wanted to bring her young daughter in who was suicidal and depressed and suicidal. And by the way, suicidality and depression among teenagers has skyrocketed under the pandemic. She couldn't even see me, even though her daughter was at risk for killing herself, because she had a $3,500 deductible. A $3,500 deductible. There was no way she could afford to pay that. That was more than 20% of her income. I had another case where a patient wanted to see me specifically because she wanted her daughter to see me specifically because I was a Black physician. She also had a suicidal teenager, and she was employed and had her by a large employer who gave the employees 2 private insurance plans they could join. So for her, one plan had her Black dentist and one plan had me. And what people need to understand is doctors don't pick what insurance they take. The insurance companies have what they call restricted networks, and they determine what doctors are in their networks. So she needed major dental work. She could either get her abscesses treated by the dentist and have her daughter see a white psychiatrist, or she could see a white dentist and have me see her daughter. But she didn't have the freedom to choose both, which if she had Medicare for all, she could just see whoever she wanted. The personal example I want to give has to do with breast cancer. Breast cancer runs in my family. A recent study in JAMA showed that part of the reason why these mortality statistics, a major part, at least 50% of the reason why Black women have a much higher death rate in breast cancer is because of problems with insurance. Well, several years back, I had to go for a diagnostic mammogram because I had a suspicious mass in my breast. So it happened to be just at the time when I had to pay a deductible. My deductible was close to $1,000. Now, being a doctor, I could pay it. It was an ouch. It caused me some I had to do some manipulation for the month to pay that bill. But I paid it and got my diagnostic, got everything taken care of, the mass removed. I'm here today. I'm healthy. I had a cousin who was about my same age. She lives on the other side of the country on the west, or she did live on the West Coast. She had the same problem. I don't know what her deductible was, but she couldn't do that diagnostic. She didn't have the money for her deductible. So she waited until she could afford. By the time she went, she had cancer throughout her body. She passed. She died of breast cancer. If we had Medicare for all, that wouldn't have happened to her. I wouldn't have had an ouch, but she wouldn't be dead because she could have just gone to the doctor and gotten her care. So I'll leave it at that and give other people a chance to talk but as you can see, I have a lot to say about this issue.
Okay, so I am going to, it looks like we finally have our host.
Hi, Joy. I'm glad I finally got in.
Woo!
Thank you all for your patience. I apologize.
Oh my God. Whew. Okay, well, I am going to pass the mic. Thank you all so much for joining us this weekend. It's been amazing. To anyone watching, please continue to watch. We have amazing things planned all day. So again, thank you so much, ladies. And Mr. Cepeda, take it away.
Thanks, Joy. All right, again, thank you so much for letting me be on here with you all. I don't know what happened in my absence, so being late. It seemed I was waiting in a waiting room and couldn't get in until just a moment ago. So I really apologize. Did Joy do introductions of you all?
Just me, Dr.
Just you. All right, cool.
And everybody can tell you I gave a big, just response already.
Excellent. Excellent. Well, I'm sorry I missed it. That's the only downside of it. But I'm glad everyone else got it from you, Doctor. My name is Elias Cepeda. I'm very happy to be here trying to moderate a panel of wonderful guests that we have. We're going to be discussing, of course, and as everyone else has already been involved in this discussion that's begun, of racism in American healthcare, such as it is. Our three guests are Dr. Claire Cohen, and I'm told she's already been introduced. She has just incredible CV and is an active doctor and psychiatrist specifically, and as well as an activist in many issues, including public health. We have Kim Brown, and we have Reverend Annie Chambers. Kim Brown, and again, none of these intros could do these professionals, these leaders justice. But I'm reading here about a little bit about Kim Brown. She is, like myself, a longtime member of the media and a journalist. Described herself as a disgruntled former radio personality who grew frustrated with the erasure of leftist Black women's perspective from mainstream political discourse. And to address that, she created Burn It Down with Kim Brown, which you can and should subscribe to and follow on YouTube in order to set oppression ablaze. Kim Brown is also one of the co-hosts of the Remix Morning Show on Black Power Media. Thank you, Kim Brown, for being with us. Really appreciate your time and the perspective. And we also have, of course, Reverend Annie Chambers, who, again, talk about not being able to do someone's life's work justice to minimize for the sake of brevity, because I'm late, unfortunately. Reverend Annie Chambers is a lifelong activist. She's a civil rights liberation fighter. She's, of course, a reverend and minister, and among other things, an advocate for public health care and healthcare access. Just a little blurb, at least from where I'm coming at this from. I don't think any of our viewers would be surprised to learn that racism is systemic here in the United States, and of course globally, but here in the United States, it certainly affects the way wealth and housing and educational opportunities and access to healthcare are distributed, leading to, among other things, awful health outcome disparities from white Americans to people of color, specifically Black Americans. Just horrible outcomes. Like every 7 minutes, I've read a Black person in the United States dies prematurely, and even worse than in a sense, I feel, or even at least more surprising to many who even accept systemic racism as a reality, is that some of these awful healthcare outcomes, these disparities in healthcare outcomes between white and Black, let's say, it has to do more than with class and the way that racism systemically or systematically affects the way income is distributed in America. That, of course, has some huge negative ramifications, and we can discuss that. But also, studies show that when we account for things like class and income and education levels and comorbidities, Black people in the United States, when they are in front of the same doctor, when they have the same educational background, the same of attainment, the same income, and otherwise, but for race, the same class strata as their white colleagues or white counterparts in that doctor's office with access to the exact same healthcare, they get different and worse treatment for just about everything, from cardiac care to dialysis to consideration for transplants to consideration for pain medication. So it's not just class and economic status that affects health outcomes. It's not just the way that systemic racism data shows us affects the way that income is distributed and the way that people are divided into class. But Black Americans, just when they're in front of largely white doctors, just receive different and worse care. There's surveys out there of current medical doctors in the United States that really show a terrifying, like 18th century level of racist ideas pervading their thoughts about Black folk having higher levels of pain tolerance, and it really puts into stark relief the things we see, like Black mothers having the same type of mortality rates that they did in like the late 19th century. So we're going to talk about racism in American healthcare today with these excellent panelists that we're lucky to have here, and we're going to look at it in hopefully multiple ways and multiple facets. I wanted to jump in first with a question that everyone can certainly answer if it speaks to them, but I wanted to direct it first to Reverend Chambers. Reverend Chambers, I've read and I've seen interviews with you in the past. I know you've had healthcare experiences, not just here in the United States as an American, but you've also had healthcare experiences, including some scary situations in other countries, in countries that had some form of universal healthcare, namely Cuba, where you spent a lot of time. I was wondering, Reverend Chambers, if you wouldn't mind talking a little bit about and contrasting your experiences with healthcare in America versus in a place like Cuba that has long had some form of universal healthcare.
Universal. Yes. As I've always had a congenital heart failure all my life. They tell me, even from a child, but as I grew older, it got worse, and I've always been out in this struggle, and I can relate to universal health care. When I was in Cuba one time, I had fluctuations of my heart, and I had no problem. They got me to the hospital, they got me to the doctors, and they took care of it. And then they were the ones who told me what was really wrong with me, because I'd been to doctors before and nobody really told me what was wrong. But in Cuba, the doctors I got excellent health care from head to feet. I also have feet problems, and they even helped me, they helped me with that. And I was amazed that, you didn't have to have insurance, you didn't have to have a co-payment, you didn't have all these problems that we have here in our country, in America, rather, let me say that. The doctors were courteous, the people, the staff, the nurses, and everybody treated me with respect and gave me a real good treatment. They sent me home with some medicine that I couldn't get in America for many, many, many years. Now, I'm talking about this happened when I went to Cuba and had this attack. I was like 33 years old. I'm now 80 years old. I got sick here. I've had 2 heart attacks in my life, and I had a heart attack here, and all they ever gave me was nitroglycerin and things like that. They didn't give me any. I found out this last time when I had my heart bout. They gave me the medicine that they gave me. Oh God, I'm trying to think of how old the child was that I had, but I know that I was at that time 32 years old. I'm finally getting the medicine that the doctors in Cuba gave me. Now, and it helps me. I take it every day in Trusto. Now, even now, I have a hard time because at first my insurance didn't want to pay for it. And then, I had a doctor that continued to fight for me to get it. So I do get the medicine now. But not only just with my heart, COVID has been terrible in this country. And I have seen so many poor people die, literally die, because they couldn't get treatment. My own husband went to the hospital, and he's a diabetic. He had COVID and pneumonia, and they turned him out in the street. They literally turned him out in the street, and some people, he fell out, and some homeless people, because they know me and know the work that me and him do, you know, they brought him home to me. And then I made several calls, and he went back to this hospital, and again they sent him home with medicine like you would have a cold. Okay, that's what they gave him. And so he was very, very ill. Taking care of him meant that I got COVID, and I was very, very sick. And with my age and already, the heart condition, I was in pretty bad shape. Well, um, my one of my godsons took me and found out about corona antibiotics. They were not making it available to people. They had it stuck away, and my husband and I were the only two black people getting the treatment when we got there to get that treatment. We were the only poor people, and somebody even asked me, who do I work for? What senator or who do I work for? It was like, what you doing here? And we got the treatment like on a Thursday. That Sunday I was up washing clothes. So they did not make that available. And then the word got around. We were telling everybody about it. All of a sudden it closed down. There were no more treatments. So a lot of people died, and especially if you was black, homeless, and poor, a lot of people died from COVID. And this new thing that they got out now, they telling people you can get the shots, but they make it so hard for you to get your treatments, and they want to say it's free, but you go there, all they say, well, we're gonna give you the test, and you literally got you got the virus. So you don't, my thing is, you can test them, but at least start treating them. They test them and send you home and say, you call back in 3 or 4 days. We will let you know whether you got, COVID or whatever this other stuff is. And by that time, the person is very ill and incoherent and can't even do anything. And besides that, that even the ambulance wouldn't pick up people with COVID. Our healthcare workers, I had to fuss with the lady with the emergency ambulance. I had to call downtown and everywhere for them to take my husband out my house to carry him back to the hospital. That's how sick he was, and that's how sick I've seen him. I lost 5 family members. I lost 5 people in my family. 4 of them I put diapers on because of COVID, because they wouldn't treat them, or they tell them, you got COVID, but you take this and go home. And my grandson, he died in his sleep.
Oh my God.
He died. He went home, laid down like they told him, and he literally died. My son-in-law, who worked every day for the IRS, and he went home with the medication, and he died. But they got him to the hospital, but he never came back out. So I've lost people that's very close to me. I lost his brother. I lost a niece. I lost a granddaughter to COVID. The same way they just, if she couldn't get any treatment, and by the time she went to get the treatment, the COVID had just consumed her whole body. So right now in America, if my fight is every day for universal healthcare for all. We have to, and I talk to poor people. I say, we the ones who have to be on the front line of fighting this, because if we don't, we will literally die. And COVID showed it. I mean, it has showed it this time. I have never seen people die. It's like it was a plague for us. It was like a plague.
Thank you for sharing these, experiences, awful as they are, Reverend. I mean, the United States certainly has a larger proportion or disproportionate amount of COVID deaths, of global COVID deaths in relation to like our percentage of global population. And I know for a fact, I don't know how it all breaks down, but I know for a fact both uh, Latin populations and Black populations, and certainly they intersect, right? But like we have a higher percentage of COVID deaths in the United States, or a higher percentage of it than our percentage of the total population. So it's certainly this pandemic is really revealing existing disparities, and people are dying disproportionate to their place, or at least their numbers in society, and this is devastating because we're feeling in real time. And and uh, and 2 years in, almost 2 years in, despite over 1 million people probably dying here in the U.S. and disproportionately people of color and also people of lower income, we don't seem any closer to having at least the leaders in government uh, saying that we should join the 21st century and the rest of the civilized world and having universal health care. And despite people of all party affiliations and ideologies being in favor of it, it's super disconcerting. But to go to Kim Brown, Kim, as a as a media member, what are some of the most disturbing or frustrating distortions that you see surrounding healthcare and the health of Americans of color and Black Americans in the conventional narrative, in the way that in the mainstream discourse, the way things like healthcare disparities are discussed in mainstream discourse? What are some of the things that you find most frustrating or most false?
Well, I mean, first, I'm extremely moved by what Reverend Chambers shared with us regarding all of her experiences with COVID and the people that she lost because of that. And COVID, as she said, the pandemic was like the plague for us, for Black and brown people specifically. It was experienced unevenly. And I think that's part of the reason why there is such a haste to reopen this country, to quote unquote get back to normal. The lifting of the indoor masking mandates across the country, to me, is horrifying because the United States has not handled the pandemic well. As you said, Elias, that most of the people of the deaths have been Black and brown folks, and those who are going to be the ones continuing to die or to perhaps suffer long-term COVID as a result of this pandemic. As new variants and strains and potential surges come about, the people who are on the front lines, especially so-called essential workers, who again overwhelmingly happen to be Black and brown, our food service workers, our healthcare workers, our people who literally kept this country going throughout the pandemic, those people were the ones sacrificed the most, and those are the ones that will continue to be sacrificed. And to me, that is part of the story that I don't think that mainstream media hammers home enough, and nor do I have them any expectation of them to do that, because mainstream media outlets are corporate-owned outlets. They are conglomerates, so they have the interest of the capital. So capitalism has determined that the pandemic is done, and the rest of us just sort of need to get on with it. But that is harmful specifically to Black and brown communities because, as mentioned before, we are the ones most likely to be uninsured. We are the ones with less access to healthcare in the first place. And I mean, just the anecdotal stories about people being turned away for care, not being believed, and a lot of these discrepancies and indifference to Black and brown lives obviously predates the pandemic, but the pandemic, as Reverend Chambers just said, just highlighted it and made it, if it was ever any doubt that Black and brown people receive different levels of healthcare than white folks in America, the pandemic has clearly shown us that that is definitely the case. And the priorities given to saving white lives, to saving white middle class lives, and disregarding poor Black and brown lives. To me, that is something that the media, again, they don't hammer it home, and I don't expect them to hammer it home because it's not in their interest to do so, and it's not in the interest of the widespread capital at large. But even still, when we look even pre-pandemic at the way that Black people experience, for example, cancer deaths, or as Dr. Cohen referenced, Black maternal deaths and Black infant mortality, it is very clear that the United States capitalist healthcare system wants Black people to die, wants Black and brown people to die premature deaths. It feels as though that since the end of chattel slavery, when labor and resources and our lives of African people on this continent were sacrificed in order to create the wealth of this country, then our lives were even more expendable than they were before, right? Because now we may not have the same value to the system. So it's okay to do experiments on us. It's okay to disregard our symptoms when we do try to seek help for health problems. It's okay to not offer Black and brown people the same levels of care comparable to white Americans. So I think that beyond media outlets bringing these stories to the public, because I think the public is pretty well aware at the chasm of discrepancies between Black folks and white folks in the healthcare system, and then even more so when we extrapolate for those who are insured versus uninsured. I mean, the Medicare for all, part of the reason I think that it has not yet happened is because white America does not want to pay for Black folks' health care, period, point blank. There, I said it. You know what I'm saying? Like that, I think racism underpins a lot of why Medicare for all doesn't go very, very far, because the larger white collective understands that it is poor Black and brown people who are most likely not to have health insurance, and that's not something that they care for their money to go towards. So absolutely, racism underpins all of this, and the media, usually the mainstream outlets, independent outlets, do a much better job. But mainstream outlets, I think, intentionally do the devil's work in omitting a lot of context behind some of these numbers and stories.
Did we lose our host?
I thought I lost everybody else. If we're having some trouble, I mean, are you? I don't have a problem hosting.
Yeah, well, Kim, while we're waiting, if he doesn't mind, I'll respond to you. By the way, Kim, I watched you when you were on the Real News.
Oh.
And I've watched, although not all the time, I've watched Burn It Down with Kim Brown off and on.
Thank you, Dr. Cohen.
So I was excited to be on a panel with you.
Thank you.
But I wanted to respond to some of what you were saying, because as you were talking, and I realized I didn't get fully introduced. So I'm a member of Physicians for National Health Program, which, by the way, their current president is a retired Black internist. And I'm also a member of a group called National Single Payer. I'm on the committee for Medicare for All for DSA. I'm very involved, and locally I'm very involved. And as you said, it's more than, it's not just the issue of Medicare for all. There's well, I'll stop talking now that you're back on. I was just going to jump in.
My next question was going to be for you, Dr. Cohen, as well. I don't know. I was able to hear and see you all, thankfully for me, but sorry, it looks like I disappeared from the chat there. And thank you, Kim, for that really thoughtful response. Dr. Cohen, and you can take this in any direction. You can go back to whatever you were thinking of saying. But one thing that I wanted to ask you about, I mean, so race isn't biological, but racism certainly we know has physiological effects. When people experience, even perceive that they're experiencing discrimination, from what I read, the science tells us that has direct influence on their health, on their mental health, and all sorts of other things. I was wondering if you could talk a little bit about that from your experiences, what you've seen of how racism actually can have negative health consequences for individual patients of yours or ones you've seen, specifically maybe mental health and the mental health capacity.
Okay, so that's an interesting question. It's so there's a number of ways through which racism and I don't think we know all the ways, can affect health. So first of all, growing up in a racist society, we now know that children, for example, there's this concept called adverse childhood experiences, and we now know that the experiences that children have growing up when they're young have a profound and prolonged impact on their physical and mental health. So, for example, children who have parents who die or effectively die because they're imprisoned or just not there are much more prone, even if they have no genetic predisposition, to depression and anxiety when they grow up. Okay. Well, 1 in 5 Black children loses a parent when they're a child. There's a disproportionate amount of loss of Black parents, either through death, through violence, either community or domestic, or parents that go to jail and never come back. So right there, we know that you can see that Black children are set up to have depression and anxiety. Another thing that we know, not diabetes, hypertension. So everybody says hypertension and diabetes are genetic, and they are to some degree. But one fact that doesn't get discussed for hypertension is that there's not Africans, people from Africa are not at higher predisposition to get hypertension. It's Black Americans or people who moved or people who are second generation Africans who come here who become more predisposed to hypertension. So there's something in our experience. Well, some recent studies have shown in the last 20, 30 years that if you have 2 or more adverse childhood experience, and a significant proportion of Black children do, that changes your body, physiologically changes your body to make you more predisposed to your blood pressure going up and going up sooner as you get older. And we know that racism in of itself is an adverse childhood experience, but many of the experiences Black children go through, the school to prison pipeline, having parents that are overworked, having parents in jail, community violence. We could go on and on and on, many of the experiences. So Black children have a much higher incidence of being exposed to adverse childhood experiences, meaning that it sets their body up to be more likely to have hypertension. Diabetes, even though it's genetic, and definitely there's a higher incidence in Africa. Like many genetic disorders, you need something in the environment for it to happen. So in Africa, you rarely see type 2 diabetes in people who eat a traditional African diet, because it's not enough to have the genes for type 2 diabetes. You have to have the diet also. They go together, the genes plus the diet that's high in sugar and simple carbohydrates. Well, the traditional African diet isn't. So many Africans who come over here all of a sudden discover they have type 2 diabetes because the typical American diet is in fact, it's the amount of sugars is toxic. Okay, that's a discussion for another day. And on top of that, all the high simple carbohydrates. They did an interesting study here at the University of Pittsburgh not too long ago where they took African students and they took African Americans in the Pittsburgh area, and they had them switch diets for a couple of months. The Africans ate typical American diet, the Americans ate typical African diet. In that couple of months, the health of the African Americans got noticeably improved, and the health of the Africans noticeably deteriorated. So, so I hope that answers some of your question.
Yeah, no, absolutely.
There's some other, I could go on and on. I could tell you want to move on, but there's some other troubling things when somebody was talking about how doctors treat patients and experiencing the patient-doctor relationship, which I could
I would love for you to. Actually, I wanted to follow up on something that I think might touch on that and take it. I know Reverend Chambers was talking about how she felt she treated well and courteously with courtesy in Cuba. And then, correct me if I'm wrong, Reverend, of course, that type of that same level of respect and the courteousness was not extended in some of the things you were talking about most recently, like with your husband and you being sick. And I've read about some studies that were done. I think it was specifically in Michigan, and it was around COVID-19, and they took like majority Black population zip codes, and then ones with more mixed demographics, racially and ethnically, and it was polling people around what they called community stress around COVID-19, and it was reported community stress was reported as being felt much higher in the study in majority Black zip codes, but not around the same things. Like in the Black zip codes, folks were responding community stress, the pandemic, specifically around things like housing and food insecurity, where in zip codes with populations with more white folks, they were talking about things like feeling isolated or arguing with family. And this kind of makes me think about like the traditional like hierarchy of needs, and it makes me wonder in about your experience as a psychiatrist and all with not only just way with generally with the way doctors maybe interact with patients in bedside manner, but decolonizing healthcare and maybe specifically decolonizing mental health care or psychotherapy. And if you had any thoughts about that and any concerns about that in your work and your practice.
Okay, so there are a number of things. I'm going to try to tie this in more with why we need Medicare for all. So there are even doctors who think they're liberal. Studies show there's some troubling statistics in both psychiatry and in medicine at large that haven't changed. Maybe I'll stick with psychiatry. So when a psychiatric patient who is Black comes in to see us to a mental health facility, they're more like with what's called psychotic symptoms, hearing voices and seeing things. They're more likely to be diagnosed as schizophrenic than having something like bipolar disorder. Both are disorders that can cause people to hallucinate. Okay. Bipolar disorder, if well treated, there are a lot of famous people in history. Thelonious Monk. I could go on and on. That's my favorite one. That's why I always bring it up. Who have bipolar. Bipolar by itself is not, if managed well and treated well, does not have to be debilitating. In fact, there are a lot of very brilliant and very creative people who have had that disorder. Okay. On the other hand, schizophrenia tends to be a more debilitating disorder before medications. The reason why it was called dementia precox is after 20, 30, 40 years of having schizophrenia, people did tend to have dementia, did tend to degenerate. Okay. That doesn't happen with there's a lot of problems with the medications, but one of the things, they seem to stop that process of mental deterioration. So you much rather have a diagnosis of bipolar than schizophrenia, because people are going to treat you differently, including the mental health professional. They're going to assume that you're more able to get back on your feet with the right treatment. Yet Black people are much more likely to get diagnosis of schizophrenia and to have bipolar missed. Also, people who have PTSD may appear to have psychotic symptoms. And oftentimes I find that people often miss. It doesn't get talked about as much in the literature, but in my practice, I notice that people often, when a Black kid comes in, when kids have been traumatized, kids who have been traumatized show behavioral disturbance as well as emotional disturbance. Okay. So a kid who's been physically abused is likely to be, it's called hypervigilant and very reactive and very ready to fight. They're very ready to defend themselves. And you see lots of kids who end up being put in the criminal justice system because people aren't aware that this kid is so reactive because they've been abused, and they're reacting as if they have to defend themselves. Okay, and that doesn't get thought about. Oftentimes, when for another example, mental health wise, is as far as we can tell, autism. It's a autistic spectrum disorder. It's a disorder which is that's just as common. It has the same statistical prevalence and incidence in all races and all groups. And by the way, so does schizophrenia. But yet, kids with autism are much more who are Black or Latinx are much more likely to be missed. There's been a couple of good studies, one out of the University of Pennsylvania, than kids who are white. And kids who are Black and Latinx who have autism are much more likely to be diagnosed at an older age than kids who are white. And that's very significant because the best chance you have of doing well if you have autism is to be picked up very early and get intensive treatment, intensive intervention very early. So just the fact that there's that 4 to 5, 6 year difference, and when Black kids and Latinx kids get picked up as having autism, means that they are going to have a worse prognosis. And why is that? Because oftentimes when kids have psychiatric problems, they're, quote, bad. They're kicking, they're spitting, they're aggressive, they're showing a lot of behaviors. And too often when people see a Black kid who's acting like that, they don't go beyond bad kid, needs to go to jail. Whereas with white kids, people are more likely to think kid struggling, kid having a problem. What can we do to get them worked out, to figure out what's going on and give them help? It gets compounded where Medicare for All comes in is because oftentimes disproportionately Black people are low income, disproportionately low income. And oftentimes people who are low income are on Medicaid, which a lot of people don't realize nowadays is privatized in all but 2 states. It's run by private insurance companies. They manage it. And a lot of times they cut into things like how much time doctors can spend with patients. I've seen doctors that do 15-minute psychiatric evaluations. First of all, it's very touchy. It's very often for people very humiliating. It's stigmatizing to come and talk about mental health problems for yourself or for your children. People need time to connect, to feel comfortable, to trust. You ain't going to do that in 15 minutes. You don't know how many times I've had patients that have come to me because I insist that I'm going to spend time with my patients. I don't care what the system says. You don't know how many times patients have come to me and I found out they didn't follow the recommendations, they didn't do the care, they didn't tell the doctor important things they needed to know about them to even treat them appropriately. And the thing I hear over and over again from my Black patients, well, I didn't trust this guy, I didn't know who they were, and it wasn't just because they were white, but they only spent 10 minutes with me. I didn't feel comfortable talking about this. But why did they only spend 10 minutes or 15 minutes? Because the insurance is pushing doctors to send those patients through like widgets on a conveyor belt, because the private insurance has to make its money, its profit. And it can't make it if you're sitting there spending time talking to patients, making a relationship, getting to know them. It needs those patients to go through fast, fast, fast. We want volume. We got to see as many as we can see. And they don't really care if you're really connecting with the patients. To this day, every study shows that the most important factor in patient healing to this day is not how much medicine you have, not how highfalutin your technology is. It's the doctor-patient relationship. And if you don't have the time to spend to make a connection with your patient and to have your patient develop trust in you, And for you to get to know your patient, if you're not the same culture or whatever, you're not going to have a good doctor-patient relationship, and that in and of itself affects patient care. So
well, thank you, Reverend Chambers. You've organized a lot on this issue of privatization of Medicaid and its negative impact on patients, right?
Yes, because see, Medicare for all, healthcare for all means that a lot of the other problems we have in society bound us right on this. Because as the doctor have said, I've listened to her describe several young people I know. I work within the prison system with young people. I work with young people on the street, and I work with people in general. Um, and you know the problems. But then when the problem is you don't have the first of all, for Black people, healthcare, special mental health care is a stigmatism. They don't, nobody wants to say their child have a problem. Um, I'm the mother of 25 children biologically. And I had some children that just, it just seemed like no matter what was done, they could not learn. They could, they weren't writing, reading, or anything. And the schools were constantly passing these people. So I had to say, stop, something is wrong. And I went to the school, talked to them. They said, oh, don't worry about it. We're going to put them in a special class. But see, it wasn't working. That special classes was not working for my children. So I had to fight the school system. Then a diagnosis was done by mental health over at Kennedy Craigor that my children were dyslexic. And nobody took the time. And in Baltimore City at that time, they had no way to even deal with dyslexic children or dyslexic people. But John Hopkins had a program. And so with me fighting, because they offered to, they threatened to take my children from me. They threatened to put us in jail, but we kept on fighting. We would get out. I would not let them go to school. I'd take all of my children and go out in front of the school board and demonstrate all day long. And then I had other people that did come and join me, like my priests and some of the nuns and some of the other people. So when it got in court, the judge, I said to the judge, my children have a right to education. And the school board defense was, well, we're doing the best we can. But the doctors at John Hopkins and the it's the psychiatrists and psychologists had already said what was wrong with my children. They were dyslexic. And so, there were no teachers for them in the public school system. So then I had to sue the school system. But my children were able to go to the counties where there was no Black children in this school where they sent them. None. Where they sent them, but they would leave from Baltimore City every day and go to the county to go to school in this private school. It was a private school so that they could learn. And when they asked, actually, the school board said, "Well, we gonna get the money from to it." I said, "I don't care. They're entitled to an education." I really didn't care. I wanted my children, but then I found out myself that I was a dyslexic person. And so I was trained right along with my children because they were, one of my daughters even till today, she reads upside down. She can read it upside down. She writes upside down. She turn it around and hand it to you, and you can read it. I had children that start from, still a reading from, right to left. They just mix up, and then their words would, things would jumble up. They would explain to me what they were seeing. So all of these things, And I'm saying to explain this is why we talking about all the crime and all the stuff that we have in our system now. It's because of lack of health care. It's a lack of health care. You know, the children getting lead in their water. Those all of that affects these young people and affects people that grow up to be adults and they still have these problems. So if we had better health care, if we had health care for all and they could come and get the treatments, the health care that they need, we would even cut down the crime because, you know, they would be able to have at least get an education, at least get jobs. And when you graduate from high school and can't read the newspaper, that's a disgrace. That is a disgrace. But this is what's happening within our system with our young people. So that is why I fight so hard every day against these things. And to say, you know, the prison system is overrun with black and brown children, people. I call everybody a child. That I'm so old, but I call everybody a child because of the way the system is set up. It's set up to, you know, it's not set up to make you progress. It's making you fail. And on healthcare is one of the main things we need to have. If you don't have a home, if you don't have decent health care, and even down to the dental work, where I've known young people to die from having bad dentures and all of those things, you know. So we, you know, this is a big fight. And once again, I said to poor people, black, brown, I don't white, but you better fight for health care in America. Because when I can go to a country like Cuba and see a difference, and see a difference in the treatment and the health care in that country, and the difference in the treatment of the people, and how can, you know, it be when we here in America got all these resources and our people literally dying in the street. As we talk, you know, I work with homeless people. They can find people dead for the lack of health care. The fact that our hospitals will turn you away. When people were sick with COVID, they said, we poor, we can't take you. So young people laid out there and died. You know, if you didn't have anybody to fight or advocate for you, you was in bad shape. If, you know, even some of the people that had a marginal, you know, insurance, they just said, we're full. We can't take you. So these are the things that's happening in America right now that we have to really, this is a big fight. We must fight for health care for all. We must fight, you know, that health care is a human right. That it is a right. Why would we let our people die? Why, you know, it's like you said, you dispensable. I don't need you. Or you don't have a right on this earth, you know? So we have to continue this fight. So that's my work every day.
Thank you, Reverend Chambers. Yeah, you know, you're. I mean, it probably goes without saying, everyone listening to that, but like, obviously, you know, children like yours are fortunate to have parents like yourself to advocate for them, because when we don't have universal, like a universal basic standard of decency for care and things like healthcare, then it just falls to, with things like diagnoses, important diagnoses, only certain folks get it and others are left behind. I can't even list all the times and occurrences that like my parents advocated for me in ways small and big that not only made a material difference, them saying, no, I know my child, he needs this, but also just made a difference for me psychologically in terms of feelings like self-worth and feel like I had care, even if maybe larger society did it. And you're talking about your children having to go to the private schools. I couldn't help but think about myself. I always went to school. I live and always did have pretty much lived in the near the southwest side of Chicago here, and I've always went to school in other neighborhoods, right? Like I always got shipped to different private schools. and that was, cool in a lot of ways. I was always one of the few people of color in the entire school, so that comes with some challenges, of course. But why my parents, I think, did it was because, for whatever they were saving or getting scholarships for me, why they committed to doing that, it was just, I think, just to confront the sad reality that my neighborhood schools didn't have the resources commensurate to deal with all the different stuff I had to deal with, that they knew that I had to deal with, and learning differences and stuff like that. And it's crazy to see, because I would do a little bit of work with kids in Chicago public schools now, and you certainly you see families embarrassed about struggles they have to go through if they're in my neighborhood or neighborhoods like mine in the public schools, that my colleagues when I was in school, it was like 99% white and very, very wealthy as well, in neighborhoods of Chicago that are completely different and far away from my own that I grew up in. They were never embarrassed about their kids' learning differences, at least in a way that I could tell. Those kids would be taken and like given extra time, and it was cool. They just go see the learning specialist. They'd be given extra time on tests. They just throw resources at these kids. But these are like schools that if you're paying full tuition, you have to pay like $30,000 a year and stuff, right? So it's not seen as a problem. But if you don't have that type of money, or if you're not one of the few scholarship kids like myself, you just don't have those types of those opportunities, and it even affects the way you reflect on yourself and your abilities. Whereas like the wealthy kids, I don't think had the same. I'm sure they had struggles, but they weren't being told by everything around them that they were a problem. They weren't, disciplined in the same way for things like behavioral outbursts or drug use and stuff, the way that my neighbors are, right? Like kids in my school, we all did drugs. They all did high expensive drugs too. And they weren't locked up like my neighbors back home, and I'd go back to my neighborhood. So it's just, it's profound. It's sad, but like you said, Reverend, it speaks to the need for universal programs, specifically with healthcare. If everyone has the same type of access to diagnoses and then support to learn to read in the way that they need to read, then we won't have so many of the problems that follow. I have friends that I've gone to school with since I was very young that are dyslexic, and I remember them getting the special reading classes to learn to read for their dyslexia. And now there's some of the biggest readers I know, all of them. But if they would have, these were kids in different neighborhoods, but went to the same school, if they didn't have those diagnoses early on, they wouldn't have been, to like Dr. Cohen's point earlier about the autism spectrum. I think it's probably the case that, even if I'm speaking out of bounds here in a non-clinical sense, I think early diagnosis is almost always like a beneficial thing for people, whether they're young and old. I will let anyone jump in here. I did want to offer up to Kim Brown, either with your own experiences individually as a professional, and in media, or just with people in your cohort, your age group. I mean, how much of, I guess I have a two-part kind of general question. How much of an issue, either in the positive, people that have healthcare, how does that allow them to go about their daily life and their work easier, or in the negative sense, the lack of healthcare or healthcare instability, having not really good healthcare, or worrying that they'll lose it if they lose their job? How have you seen that play out or affect people's lives in your own age group, in your own profession? I could go on for a long time as a independent journalist now. I wasn't always independent, but as an independent journalist now, the type of stress that one has to think about, not just with income, but with how that's tied to healthcare. So wondering if you could talk about your experiences with that, or at least your observation for how crucial that is. And then the second part is, how have you felt the awareness of the issue developing in recent years? Like, I feel for my part that we're, at least a lot of people are now becoming a little bit more acutely able to like identify universal healthcare being a real linchpin, as opposed to just generally feeling stressed and alienated. Now we're starting to zone in and like, okay, this is one of the key things.
Absolutely. So to your first question, I've seen people, my peers, my colleagues, have to remain in jobs that made them absolutely miserable because they either themselves had a healthcare diagnosis that required them to have access to private healthcare insurance, or they had a child who had a mental or physical diagnosis where their child required a lot of care. So I see people whom remain in employee positions, in job positions where they know that they are being paid less because of either their race or gender or sexual identity, but they feel mandated, they feel obligated because they know that their access to healthcare is tied to their employment, which sends a terrible message generally in America, right? That the only way that you have access to healthcare is if you are producing labor and giving over your labor to the capitalist system. And if you're not able to do that, well, then it's okay. It doesn't matter what happens to you. It doesn't matter if you are ill and never receive treatment. It doesn't matter if you die, because your value is only commensurate to the amount of labor that you're able to contribute to the system, which is abhorrent, right? I mean, generally. And unfortunately, in this country, you know, we have really become quite accustomed to mass death. Like, Americans are not fazed by hundreds of thousands or even millions of people dying. And I think that contributes largely to the indifference, or I won't say indifference, maybe I'll say this lack of urgency around a mass movement for Medicare for all. I'm talking across racial and political and socioeconomic lines, because those that the haves are okay if the have-nots end up dying, right? So there's that aspect of it, just like the dehumanization of not working and not being entitled to healthcare. And the other part of your question, what was the second part of your question? I had it in my head and then
I threw a lot at, and it was not well organized. But I was just curious if you had any reflections on, either personally or with just, you know, your peer group or colleagues, as to like how well the consciousness of these issues is being developed. I feel like in circles, or at least in me personally, there's leaps that have been made in recent years about our consciousness of at least the need to address these things. I didn't think about universal healthcare quite as much maybe 8 years ago, 10 years ago, for whatever reason.
So I've kind of had, I guess you could say, secondhand experience with universal health care, because there was a contingent of my family that was born and raised in Canada. And when we would talk about doctor visits or, you know, having to visit a specialist, what they were saying absolutely did not match what my experience was. And it just made no sense to me. I'm like, how is this? Like, why? What do you mean you could just go into the doctor? And then I would hear complaints from ignorant Americans complaining about the Health Canada system, complaining about the NHS system in the UK. First of all, talking wholesale out their ass. They didn't know what they was talking about. Like, you know, if you need a surgery, you got to wait 6 months for a surgery. Well, I think you got to wait a lengthy amount of time for a surgery here. I mean, all the complaints that Americans who have not traveled or who have no credible experience with people who have access to better healthcare in their respective nations, they really do not know how much better that the rest of the world has it. And that's quite unfortunate and sad. But another point that I wanted to make is that, you know, it's impossible to have a question or a debate or even a discussion around nationalized healthcare when we see what the spending priorities of the US government are and what they continue to be, and even the spending priorities in our respective cities and states. So as we see the speed in which Ukraine got $200 million, and there's been all this, you know, we have to authorize all this new weaponry and missiles and equipment and money for Ukraine, while Flint, Michigan still does not have access to clean water, while East Chicago, Indiana does not, is still sitting on top of a EPA Superfund site. So we see how quickly the priorities can be when it's time for the war machine to get cranked up. And that is where I think we need to aim our ire. Like it is the US military industrial complex. It is the police state in which we live in. That is where our healthcare money goes. It goes to missiles. And we have to make sure that our leaders address that and are honest about that and confront that, because it's unsustainable. It is unsustainable. And one of the things I think the pandemic showed to us is that capitalism can collapse pretty easily, right? If people don't work, and if we do agree on a general strike at some point, I think this thing could be done, because we should not endure such conditions, especially relative to the amount of money that we give to this system, and especially how much money and capital and labor that is extracted from poor Black people specifically.
Thank you. I wanted to go to Dr. Cohen for some brief remarks. I know that you have to leave just a few minutes before the rest of us do, so I wanted to give you an opportunity to close out here. One of the things I've been curious about is how lonely you do or don't feel as a physician, as a psychiatrist, that isn't afraid to look at structural issues, isn't afraid to talk about racism, isn't afraid to talk about socialism or democratic socialism. Are there others like you out there? Do you feel you're kind of in an island? And then if you have any last words for any advice, I'm curious for just for patients, how they can maybe advocate for themselves in a woefully insufficient system as it is, as we try to fight for a better one.
Yeah. So first of all, what I'm finding is that there are more and more young physicians in training who are dissatisfied and who are aware of the structural issues of how capitalism is affecting the practice of medicine, distorting the practice of medicine. Even among physicians of my age group, although a lot of them don't understand about the distortions, there's a lot of dissatisfaction among physicians. And actually, there have been polls that show this. American physicians are among the most dissatisfied physicians in the world, because they know something's wrong. A lot of the ones in my age group don't get what is wrong, but still. So I don't. And then in Western PA, there's a group of us. There's only a handful, but there's a group of us that are anti-capitalist right there. We get it, and we're fighting. In terms of what people can do to fight, I think first of all, people need to be aware and educate themselves. Right now, our government is trying to privatize and get rid of what little public nonprofit medicine we have, Medicare for the seniors, and they're doing it real fast. They plan to have it totally privatized by 2030. And one of the things that I've been talking, now I talk with patients about it to make people aware. When you can't see the doctor you want, don't just sit there. You need to ask why. You're going to find out because private insurance companies are controlled. When you can't get the services you want. I just was in a case where we were trying to fight with the system, basically, is the best way to put it, because the real elephant in the room was that this kid needed certain services, but it wasn't going to make anybody profit to give them that services. So people were trying to do things that would end up with either the parents being childline and the parents were not neglectful parents, or the kid ending up in the criminal justice system, when the real issue was that our society needs to put the services that a kid like this needs there and the resources to treat this kid, rather than acting as if he's a criminal or that the parents are poor parents. So when you're feeling like the system isn't meeting your need, you need to look around and see who's fighting to get those services for you. And you need to understand how this for-profit system is the big problem. And how do you get involved with something like Medicare for All? We do some deep canvassing in our area. We do these community forums. I would, I encourage people to come to these community forums to get involved when you see them, so that you can understand how the system why the system isn't working for you. A lot of people feel it isn't, but go to PNHP's website. Listen. Don't turn off when people like me are talking about it. Listen and learn so that you'll know how to get involved. Or come to Medicare for All. I'm on your Facebook page. Always, I contribute a lot. I think that's why you may know me, because I'm always putting something on there. And people need to not to listen to those sites, because that's where you're going to find out why things are the way they are and what to do.
Dr. Cohen, thank you for that, and thank you for all your time. I know we're going to close up for a couple more minutes here, but we know you're busy and needed elsewhere. I really appreciate your time.
Thank you. All right, I enjoyed it.
Nice to see you, Dr. Cohen.
Thank you.
I wanted, this is for both of you. If we can squeeze it in here before, I think we just have a few more minutes. I'll go to the Reverend first. Again, along the lines of giving advice to others that are struggling or feeling it, or who are motivated listening to you all, but saddened on a daily basis or stressed on a daily basis. I wonder if you would all, and Reverend Chambers, you first, please, if you could reflect on, like, what do you do when you're overwhelmed, when you're sad, when you're distraught? I'm sure there's been many moments. What can you talk a little bit about what kept you going? Everyone feels, everyone feels the bad stuff. Everyone feels the temptation, to the very human temptation to, like, just give up if things are really hard. How do you go from the despair to the organizing? What kind of gets you through? What kind of gets you moving? Do you ignore stuff, or do you let yourself feel what you got to feel and then take steps forward? Just in any way you want to characterize that. How do you keep working and keep moving?
Well, let me say this first of all. I shared with everybody that I'm a dyslexic person. When I was a kid, I had a lot of brothers and sisters too. I have some still with me. And you can imagine, for me, back in the 40s, going to school, nobody knew what dyslexia really was, period. And they used to try to label me in public school as retarded. And my father would say, no, she's not retarded. There is something wrong, but she's not retarded. So he snatched me out of public school and put me into a private Catholic school. And it was there that the nuns did their best they could to teach me. They learned me basic things about, and that's how I survived for a long time. Then when I was in my early 30s, I know that my children weren't retarded either, but I knew that there was something wrong. And so I fought the school system. And as I'd said, the doctors, helped train me right along with my children. And I was able to go back to school and finish high school, and then go to college and get a master's degree in social work. Okay, so that have always given me the strength to come out swinging. I don't take no. And when people said to me, sometime now when I go to doctors and they be asking the other, people, especially the elderly lady, I said, I don't have time to be depressed. I don't have time for that. Because first of all, I was born a female in America. Second, I was born black. So the depression got to pass me by. Now, I know that there's time people do get down, but when I do get, if even the thought of that, see, if you say no to me, I want to know a reason why no, and then I'm going to fight you to why I can change it. I'm going to change it no matter what. Even if I'm in the courthouse, if I'm in front of a judge, I don't be quiet. We have to have this dialogue. You have to show me why you made this law or this ruling. And certain laws, I tell people all the time, they weren't made for me. They weren't thinking about Black people when they made that law. So I break them all the time. They call it civil disobedience. I said, well, I'm civil disobedient because I know you wasn't thinking about me when you made the law. Because I'm poor, I'm a female, and I'm Black. So my whole life is a struggle. And that's what I said to other poor people, Hispanic people. I said, look, honey, you didn't come to the land of milk and honey. You came to the land of struggling because you poor, and we're going to keep on fighting, regardless how, I tell poor white people, I say, look, you poor. Look at you. Nobody cares about your color now. We're in the same boat. We're going to swim or sink. So you have to come along with me. You have to come along with me, or you're going to starve just like I am. And I ain't playing no starving. I'll take some food first. See, I'll take what I need. And so that's what I said to parents. When they told me they was going to put me in jail and take my children, I said, come on. Because you may take some of us out here, but some of y'all will be taken too. So you have to, in this society, I tell people, get the strength to stand up and fight. That is my organizing, to fight back. You have to stand up and fight back. And I'll end with this as a minister and a woman of God. When they ask me, am I nonviolent? I will tell you right off, if you allow me to be. If you don't, then I will do just what Moses, had to do. I will fight you till the end. And sometimes we don't know how that fight gonna turn out, gonna happen. But believe me, Reverend do not plan on laying down, and I'm not a turnover chief minister.
Thank you, Reverend.
Right on.
Kim, any last thoughts? I know we have just a few moments left. I'd love to hear if you have any last thoughts to share with our viewers. I would love to hear them.
Yeah, that's tough to follow right there with Reverend Chambers.
Of course. Or let people know where they can find you. We literally have like 10, 15 seconds.
Oh,
as we're hearing from all of you.
Absolutely. No, you can please follow and subscribe to my YouTube channel at Burn It Down with Kim Brown. Just to say really quickly, as a Black disabled woman, I can totally understand and I echo and co-sign everything that Reverend Chambers just said. And it just illuminates the need for Medicare for all, because if we have more accessibility in our workplaces and such, that makes everything more equitable for all. So it's important that we all stand up for each other and try to make sure that this battle is won for accessible healthcare for everyone.
Well, thank you both so much, as well as Dr. Cohen. Thank you for taking time with me so generously, so I could learn. I really appreciate your all's time.
Thank you for having us.
Oh my, what a panel! Are you kidding me? Like,
amazing.
Okay, first of all, like 3 incredible women who did exactly what we as white people need to hear. We need to hear this. We need to acknowledge this. This is arguably one of the most important panels these entire 3 days, because everything we're learning about this weekend, regardless of the panel, is about inequity. Everything. And can I just say, if every single one of us had even a fraction of the fire of Reverend Chambers, we would be burning this shit down. Not literally, but like, we would be in the streets, hardcore. Reverend Chambers, I've had her on my show, but we had her speak in DC at our march, and let me tell you, she was in her electric wheelchair and she started that march.
Wow.
And just got goosebumps. These people that we're hearing from these 3 days are the exact people we need leading this fight. Like, so inspiring, all three of these women. And I saw a comment that said Dr. Cohen needs her own show as well. So this is
How
amazing.
about it? Yeah, no, absolutely. It's a true honor to get to listen to them and to be even thought of to moderate this. And that's thanks to you, Joy. You reached out to me, and I'm truly humbled by that. I really, really want to thank you so much for thinking of me and including me in this. It was absolutely phenomenal. I really enjoyed the experience. Real humbled by it.
Absolutely. Well, I try to bring you into pretty much everything I do.
I'm very lucky that you do.
He was on my show once, and I was like, okay, so I'm kind of snatching you up, putting you in my pocket, and then just pulling you out anytime I need to co-write an article or host something. Yeah, so
it's a privilege because I love getting to work with you and learn from you. So it's a total privilege. I really appreciate that.
Thank you so much. Much love, comrade.
You as well.
Appreciate you.
Take care.
So our next panel, I do want to give a trigger warning because it is about mental health. And this is a topic that so often gets ignored when it comes to healthcare. And it's actually something that would be one of the most beneficial things about having national Medicare for all is people would actually be able to receive treatment that is so often denied to them. So I'd like to bring in our panelists. So,
Joy, just a quick note: the gentleman, Gregor and Austin, are having a little problems hooking up. As soon as I get them straightened out, I'll bring them right into you.
Okay, thank you. So today we have Dr. Valerie McRae, who you may recognize from her DC March in July, and Lorraine, who is incredible, who I met on Twitter. And it was one of those things where you just follow each other, you love each other's posts, and then you offered to come on and talk, and I was like, yes, bring it, yes. So thank you so much for being here, both of you. Dr. McRae, we can start with you. As someone who works as a doctor in the mental health care field, I know in July you touched on that you see numbers higher than ever before as far as suicide ideation, depression, anxiety. I just read an article about the height of self-harm, things like that. And can you touch on that as a doctor, what you're seeing?
Well, of course, with COVID, we're seeing a spike with COVID because people are pretty isolated and kind of really fearful. So we're seeing a spike in where you can see it most is the request for medication. So there are more people on anti-anxiety, anti-depression medications than ever before right now. And I'm assuming we haven't gotten this latest. I don't have the latest statistics that with the situation in the Ukraine, I'm sure it's skyrocketing even more just because there's that fear of war. And just sort of all of that that's going with it. I know there was a spike with the whole Afghanistan thing with my military guys.
Mm-hmm.
When we pulled off out of Afghanistan, there was a spike in their mental health issues among the people that I was seeing. So between that and there's another layer here that when I'm not working with PTSD victims or people in the military or people in the communities, I also work in the prisons, which are our new mental health hospitals, actually. And that's the shame of it. So we could talk about that a little bit as well. Yeah.
Joy, you're muted.
Can't hear Joy.
You're muted, Joy.
I was saying something really, really interesting too. No, I'm just Lorraine, I know you have a personal story, and it's totally up to you how in depth you want to go. This is, your show, all of you. So, if you'd like to share a little bit about why the topic of mental health is important to you.
Yeah, well, as far as personally goes, I have a long history as far as first being diagnosed manic depressive bipolar when I was 17. And so I went through, I think, normal prescription and, therapy as far as trying to manage it. I got to, and this was like 25 years ago. So I got to a point where it was more harmful than it was beneficial. So I decided to kind of take it into my own hands as far as figuring out what worked best for me. And so from that, I was able to, uh, you know, honestly, exercise and nutrition has been a big part of me being able to manage that. So as far as on the spectrum of mental health goes, I feel very lucky that I seem to be on the lighter end, but I have several friends who are and family members who are on the more severe end. And my personal experience with them has been dealing with some of their episodes. And so whether it has been, threats of suicide, or whether it's been them getting off of medication and it being detrimental, and then trying to get them back on, I've found that everybody has their own limit, their own need. And when there are people who don't have access to whether it's medication or whether it's just therapy, talking and figuring out and gaining tools of how to manage their condition, they need support. And if they're not financially able to, then they just have to deal with it, and life is harder, is what I've seen. And so that's one of the reasons why I fully believe that Medicare for all is essential for mental health, because that way it's not an option. It's a guarantee. It's a guarantee that they're going to get the help that they need, whether it's medication, whether it's therapy, whether it's certain tools that they use, like there's DBT and whatever. So yeah, I definitely see the need for it. Yeah.
Absolutely. And you touch on the monetary aspect of it, and it's like, I know from someone who became disabled unexpectedly 2 years ago, it's like you go through such depression and anxiety, and you're like, okay, so I really feel like I need a therapist, but if I do that and I have even more charge card debt, then, and even with insurance I have, then I'm going to be even more depressed. So what do I do?
Right.
I mean, it's a hostage situation. You have to weigh which is best for me. And a lot of times you just say, I can't afford it. And you just try to cope other ways. Dr. McCrae, you bring up a really great point that I want people to kind of understand, that there are two kind of like types of depression. There is clinical depression, but there is also depression situationally. Like we see, you're right, with the with wars, with COVID, you see just the amount of even defeatism, depression, anxiety. So can you touch more on that, the way that our society impacts our mental health?
Oh my goodness. They're interwoven. they're so interwoven as far as society. It's almost mental health is also a public health issue as well. So whether or not it's dealing with pandemics or whether or not it's dealing with just the stress of poverty, these things also bring on depression as well. And some people live in that space of chronic stress, which of course is going to bring on anxiety. And then and depression as well. The mind and the body is so interwoven that a lot of times if you're depressed, you also have physical ailments as well, headaches, body aches, you just be physically ill as well, and vice versa. If you're physically ill for too long, if it's chronic, you're going to come to be depressed as well. So they're interwoven. But there is a difference between clinical depression and situational depression. That's not to say that the treatments are not similar, but a lot of times the clinical depression is usually in sort of that same category as bipolar depression. So it's more of a bipolar depression. And I think that's becoming more and more clear. Just because you're bipolar doesn't mean you have that manic state. Sometimes you can be bipolar but not have the highs of that.
Yeah.
So that can be interesting as well. So the clinical depression is probably an offshoot of the bipolar, except more with the without the mania, so to speak. It's interesting. So, oh, it looks like we've got some more folks joining us.
Yes. Thank you for joining us, gentlemen. I'm glad you got through. So this is Gregor and Austin. They're the people behind Purpose First. And you both deal with cannabis and helping veterans with PTSD. So can you just kind of, at first, just kind of touch on what your organization does?
Yeah, of course. Thank you very much. So my name's Gregor. This is Austin right here. So we started Purpose First just over a year ago, although we've been planning it for over 3 years. We moved to San Diego, and we moved to San Diego specifically because of the veteran population down here. It is #1 in all of America as far as populated cities for dense veteran population. Now, we wanted to make an impact in everyone's lives as soon as we could. So we got down here right after leaving the Bay Area. Now, I've been out of the Marine Corps for 5 years. Austin's been out of the Marine Corps for
6 years.
6 years. And we met as coworkers up in the Bay Area about 4 years ago. And from then on, we knew that we wanted to work together and we wanted to better our lives and better everyone's lives around us. And so we made the decision to build a business, to make an impact, to be the most purposeful business that we could, and to impact as many lives as we could. We've both struggled with mental health as veterans transitioning from active duty military to civilian life. And there isn't too many fast tracks to help you transition from one to the other. And Austin and myself, we use cannabis and have used cannabis to help us with our skills that we've learned to kind of de-escalate our own brains. I'm just speaking for myself, but it kind of helps me take a couple of steps back and reassess and be calm and really just be myself. I don't want to speak for Austin, but cannabis has helped me in my life for years. And I use as a medical patient, but I also use recreationally as well.
And so back to your main question, what is Purpose First? Purpose First, we started as a for-profit cannabis company, and we give free medical marijuana to veterans, a select amount. And then also we have a nonprofit that we do bi-weekly beach cleanups here in San Diego where we remove toxic pollution from entering the waterways and the ocean. And it's just been a super impactful thing for our community to cultivate community and also to give back to the earth and the humans on it at the same time.
Awesome. So that being said, Dr. McCrae, have you had experience with patients who have, depression, anxiety, PTSD, who have used cannabis and found that it helps their symptoms?
You know what? I deal with a lot of PTSD, especially with the military. I think I've listened to close to 4,000 war stories. Interesting, because I do their evaluations. I diagnose the PTSD. Interesting that I live in a state, Indiana, where marijuana is not legal. And so a lot of my clients, or a lot of the people, they talk about going up to Michigan, going wherever they can go. And sometimes I've suggested they move to those areas. But it is very helpful in ways that the other medications just are not, especially for sleep, to calm down enough to sleep, to sort of push the nightmares at bay a little bit. And just overall just anxiety and just being able to just get through your day. A lot of the veterans have found that marijuana has been very useful. But again, I'm in a state that it's illegal. So I can see the differences between the reports of the people that say that they go up to Michigan or go over to Colorado or whatever, just to get a break, just to get some sleep, just to get some rest. So I applaud these gentlemen, because it's definitely a necessary thing for a lot of my PTSD veterans and across the board when you're dealing with trauma. I don't necessarily push it all over the place, but sometimes you need to be anxious to get your life moving. Anxiety is a good part of pushing you forward. So not in all situations, but definitely with the veterans and what they're dealing with as far as what PTSD is concerned. So I applaud you for starting that, and I hope you guys can come and help advocate for the veterans here in Indiana. That would be great.
Thank you, Dr. McCrae. I appreciate that. Yeah, one of the things is the VA, when we get out, it's our #1 source of healthcare. And it's beautiful because it is free, but at the same time, all they have to offer really is heavy opioids. And they give those things out like candy, whether it's for a migraine or for PTSD or what have you. And there's no real natural remedies. There's no real homeopathic alternatives. And we see a huge failure in that, and the fact that our veterans are just kind of going in a downward spiral with all these opioids, and it just makes them not be a human anymore. It makes them turn into a zombie, if you will. And I've seen hundreds of veterans personally, because we've had this veteran compassion program, switch from 10 to 12 opioids a day to a natural medicine to just cannabis, and it's really, really beautiful and eye-opening. So I appreciate you saying that, Doctor.
Yes.
That's amazing. Lorraine, do you have any experience?
I definitely have experience with cannabis, and can attest, as far as myself goes, that it has been one of the things that that has gotten me through the last 25 years, as far as my personal trauma and overcoming it. And then I live in North Carolina, where it is illegal, but there are numerous military bases. And so I come in contact with a lot of veterans. And that is the universal consensus, is that as far as helping them get through it, cannabis has been the most effective. So
that's amazing to hear someone else say in support of a natural medication. You know, Austin and I, we've used recreationally and medically, and in all sorts of ways, it really does help. For myself, it helps me really just be myself, and then that can be used as a tool, or it could be used as a detriment.
Right.
And the way that I use it is in a positive way. And I take distance away from cannabis whenever I need it.
Right. Same.
Normally I would consume every day. Sometimes I go without a day or a week without using cannabis, and that's just to exercise control and to take space away from it, to stay sober sometimes, and it really does help me stay clear-headed and productive.
Right.
And I wake up clear-headed, and I go to sleep clear-headed, and it's really just a blessing to be able to have access to cannabis. As you said, Dr. McCrae, that not everybody has access, and it can be very difficult. Everyone has access to alcohol, everyone has access to hardcore pain meds, and not everyone has access to natural medication that's grown naturally and that's sold at a consistent quality rate for something that's fair.
And I love. Oh, I'm sorry. Go ahead.
Please.
Oh, I just want to say I love what you just said as far as being able to step away from it as needed. Because currently with my job, I am not able to, but I feel like because I had done it for so many years, whatever healing properties it activated, or whatever benefits I was able to get from it, has carried me through when I'm not using it. And also, like you said, as far as the control factor, one of the things I've learned through my journey with mental health is balance. And so being able to balance that use, again, is just another way for me to feel in control and feel like, I'm not dependent.
Right.
Awesome. I want to kind of digress a little bit onto the next topic. Dr. McCrae, you spoke about talking to prisoners, and I have interviewed a gentleman from prison multiple times on my show. His name is Temujin Kensu.
Okay.
And he has been wrongly incarcerated for 35 years, been proven innocent, yet still sits there. And it's really incredible what they do, even with incredible health problems, like to the point where brain tumor, stomach cancer, hardcore problems. He literally cannot even have vitamins in his cell. He has to go outside and eat dandelion to get nutrients he feels he needs. That's how bad it is. So I'm touching on that. I'm kind of, curious what your experiences are to, with people in prison not being able to get what would essentially help them.
Prison food is non-nutrition. It's just no nutrition in it. It's all, there's no fresh salads, no fresh fruits, those sort of things. It's very rare that you see that. Plus the guys are women and men. They also order off a commissary, which is more ramen noodles, and sometimes they make pizzas out of pepperoni and all that stuff. These are things that are prepackaged. They're old. They're just not good for you, full of nitrates or whatever. So that can't be helping their mental health either if you're not rejuvenating with some food that's life-giving instead of this processed shelf life, forever shelf life food that they're ingesting. They can feed. The reason why mental health winds up being in the prison system, if you think about it, if someone's in a mental health hospital, you're talking about thousands of dollars a day, whereas they feed the inmates on $1.57 a day. They're able to do that, especially in areas like Georgia, some of the other areas where they grow their own food, where they have a chicken plant and that sort of thing. They've gotten it down to less than $2 a day to feed an inmate. So of course, there's not going to be a big push to bring those people out of the prison system into the rest of the world, so to speak, or out with any type of paid mental health system. So they're stuck in a lot of ways. But with that being said, yeah, it's hard. Now you can usually some of the prisons though they will allow you to buy vitamins off of the commissary list, so that can be something usually that they can buy off the commissary list. But if they don't have the money to do that, that's a different story. But usually they can buy that along with soaps and all of that stuff. So, but it's very expensive and it's low quality. It's about profit with those situations. So, yeah, I'm sorry that he's stuck behind bars that long. We see a lot of that, and it's not any rhyme or reason to it. I see people with they come in when I'm checking them in for mental health, or my team or my staff is checking them in to see if they're mentally okay. It's not unusual for us to have one person that gets 8 months and the other one gets 20 years for the exact same charges. So there's no rhyme or reason to our whole system. And that in itself it's got some mental health components to it as well. So it's crazy. A lot of times that's where they do get consistent medications there in prisons, though, I will say that. But then once they get stabilized, there's no need for them to be there stuck in prison because of their mental health. But, again, Medicare for all, that's something we really need to look towards. One of the things that I wanted to talk about, I've seen the Medicare for all model, whereas they gradually, from kids to older adults, they gradually come this way to fill in. So you got the older adults starting with 55 on down. You're working your way down until everyone is covered. I've seen the models for how to get to Medicare for all. However, as Lorraine was talking about, most of the mental illnesses show up right around 17 years old, up to 25, 30 years old, especially for men, it's from 18, 17, like 16 and a half, up to 25 and a half. So we need to sort of start in the middle for mental health to make sure they're covered no matter what. The medical, their physical well-being, of course, is going to be fine, but the mental health part does not need that. We can't afford to do that sort of close-in thing because they're in the middle, they have no insurance at the exact time that mental health issues are showing up. So that needs to be covered across the board, 24/7. Every year of their life, mental health needs to be covered. That's not something we can wait for it to close in and fill in that gap for mental health. It's a critical time between age 18 and 25. Very critical time.
Absolutely. Lorraine, I know with your job, have you noticed people, a difference in their depression, anxiety, and such from, exercise and what they consume?
Yeah. Because I get to work for a company that's very involved in the community. And so, there's a range of people who are in there, maybe once a month to people who are in there every day. And one of the things that is evident, especially the last 2 years, is definitely the anxiety, the fear, especially with with COVID, that's a very personal, like that's your personal infection. And so everybody has their own kind of germophobia as far as that goes and how it's manifested. And I don't blame them, but definitely, exercise. Some people use exercise, to get over that. And some people, in spite of exercise, still have such a high anxiety rate that, even they need something beyond exercise, beyond some of the lifestyle that they are living. So, whether or not they're able to get the extra care that they need is really based on their financial ability.
Yes, you have to be a little bit well with depression before you can get to the gym in the first place, or
right.
Get to the exercise, because you just can't get you can't get out of the bed, you can't get out there to do the exercise. So a lot of times we tell people, well, you're going to feel better if you would just exercise. Or you're telling people that are so depressed that that's the last thing on their mind. That's so, if they could get to the gym, they will do great. It will improve, but they need sometimes a little help to even get there. So that would keep that in mind as well. So it's not just one thing. They need all of this together to sort of move them forward. And yeah.
And Dr.
Go ahead.
I'm so sorry. Go ahead.
No, I just, it was something else, but I forgot anyway. So I'm glad.
I was curious about what you thought about the nutritional aspect, because with the impact and the effect that macro and micronutrients have on our body chemistry, brain chemistry, would that be a sufficient way to help to manage that? And with that being one avenue, still I know that that's a struggle as far as financially with some people. But as far as your experience, what have you seen nutritional or nutrition impacts? How does it impact people with their mental health?
Well, we know what nutrition, how it negatively affects. We know that, for example, with people that don't get enough vitamin D or vitamin C, vitamin D, we know about the depression that's connected with people who live in climates where it's not enough sunshine. Right. And what they have to ingest to make sure that they balance that out, whether it's the vitamin Ds and all of that stuff. So we know that they need that. Unfortunately, a lot of our food chain doesn't have the same vitamins it did years ago before it was sort of tampered with along the way. So you really have to ingest a lot of good food to do that, to get what you need. So vitamins are very, very important. But I think just keeping the toxins out of your system it's a huge thing.
Right.
And then just fasting and not eating at all for a little while helps reset your clock as well, if you can do that.
I've been doing that and advocating for that a little bit more as well since I've started researching it.
You would be surprised with just taking a day or half a day and just making sure your system gets completely empty, what it does for body aches and mental wellness and all that stuff, just to get a restart. It helps a lot. It helps me a lot. I can only talk in those realms, but it does help me a lot. So there's so many avenues to mental health and fixing mental health, that the mind-body connection has to be considered, but we also have to consider the socioeconomic stuff too. And for those of you on the panel that don't know, I have ran for office a few times. Most recently I ran for U.S. Senate. We got bumped off the ballot. I got bumped off the ballot just a couple of weeks ago. So I have my own mental health issues about that. But we're going to keep continuing, because I think that you can't deal with these trauma situations over and over again, and these mental health situations over and over again without getting political. It sounds like Purpose First is starting to be political about the things that they're doing as well. It's a political thing. We have to get connected. We have to get connected. Now, I will say this: the only group that among my clients, the only group that has done better during COVID has been my military guys. And it's mainly because now the rest of the world is doing the way they were doing, which is staying at home, staying away from people, distancing, social distancing. They were doing that anyway. So then now the world looks more like them, since they're having to do the same things as well. So the changes in COVID didn't affect them as much as it did the regular population, because they don't like to be around people anyway, and being around crowds, being in Walmart, any of that stuff is just something they couldn't handle anyway. So the COVID thing, they're like, hey, this is like another day for us. So with that population, that was one population I didn't see get worse because of COVID by itself. Yeah.
Right.
Absolutely. And I had a doctor on my panel last night who said they're in Chicago area. They literally give out prescriptions for fruits and vegetables.
Oh,
Literally.
wow.
That's
Because they're in food deserts and they don't have the money to go to, stores and buy fruits and vegetables. They have prescriptions. This is bananas to me. I've never heard that. To the Purpose First duo, do you guys find that, the veterans who you work with, that if they do have a certain kind of diet or meditation or things like that along with the cannabis, that it is even more effective?
I definitely think so. I think what you put in your body is a reflection of how you're going to feel, how you're going to act. If you're eating a lot of processed, man-made stuff, probably not going to feel that good. If you're eating a lot of natural stuff that comes from the earth, probably going to feel pretty decent. So I think not even trying to get into the weeds or advancing that, just being simple. Man-made stuff usually isn't that good for us. All these opioids, all this stuff that we're advocating against, kind of goes along with food. I mean, natural, simple, whole foods is usually really, really, really good for us. I haven't seen too many bad things from people eating a bunch of fruit, carrots, like a bunch of healthy food. So you see a bunch of people that eat fast food or processed stuff or whatever, it tends to not lean good. And I feel like how your physical body is a lot of correlation of how your mental health is as well.
And what's interesting about that is that we have a lot of food deserts in the African American communities, and the crime rate or the murder rate is really high. And then some of these things, and even just the environment and the lead in the water and in the pipes and those sort of things, all these things have to be considered when you think about the mental health of someone who's either been shot or been shot at or shooting at someone. There's a lot more into that. These kids aren't born just off the chain. There's a lot that they're not getting nutritionally, that they're not getting, and there's some bad stuff they're getting in the water, in the food. But it's not balanced. And so we've got so many things that it's not just these kids are in gangs or this and don't have dads or whatever. A lot of it, it's a lot of things coming together. And then they don't have mental health help either.
On top of that.
So to be able to get and screen each child for mental health issues, especially for PTSD, because a lot of these kids look like ADHD kids, but when in actuality, they're stressed out kids. And it shows up as, as misbehavior or ADHD or not being able to sit still, or it doesn't look like an adult's PTSD. It looks totally different. It looks more hyper and that sort of thing. So there's a lot. And if we had mental health treatment for in at least some sort of assessment tool, even in the schools, so we can catch it early, and there's no stigma attached and no bill to pay for it attached to it, that would be great.
Absolutely. To Gregor and Austin, something we do hear about a lot is, well, the VA is free. They have great care. But, and trigger warning for those watching, there was a gentleman, I would say a year or so ago, who actually committed suicide while he was sitting on the waiting list of the VA clinic. And he had already been waiting over a year. So, and then for those who saw Bernard Sanders, one of his rallies, a veteran stood up and said, he was going to commit suicide because he had all these bills, even though, he's with the VA, and thankfully Bernie got that taken care of. But so we see these things, but there is that presumption that, well, VA has great health care, but we know that they are understaffed and there are caveats and everything like that. So in your experience, what have you found that could be improved by the VA that would obviously be improved with national improved Medicare for all?
That's a great question. I'd like to just start by saying that, I only speak from my experience. Austin only speaks from his experience and the stories of our friends and fellow veterans that we know. We have been a part of nonprofits, veteran nonprofits that give free weed to veterans specifically. And so we do have a fair amount of stories about cannabis-related medicine in the lives of veterans and civilians, but specifically veterans. Now to revert back to what you asked, I believe that, implementing cannabis in your life is all subjective. It's all on a case-by-case basis. And if it helps you, that's amazing if it helps you. If not, we should always exercise control in a sober mindset, and then take space away from everything so that we can seek development within ourselves. Anytime that we gain improvement in ourselves, we seek self-improvement and we look in the mirror. And that's before going to get help, going to get diagnosed, and really just trying to help ourselves. Specifically to the VA, I think that it can be improved most with just taking time to care. Now that goes with any representative of the VA, any doctor in the VA. I notice that sometimes it's omitted, specifically listening and taking the time to care for the veterans and the people, dependents, what have you, that it's kind of forgotten to take the time to care, to truly listen to each story. They're all individual. They're all people. They're all different stories and different experiences. And you really have to listen and take the time to truly care. And that's really reflected in the service that we receive and that we know has been received. And it's very easy to tell when someone does care, and it shows.
So I believe with the VA, you say a great system. I have not seen that. My experiences have not been that way. All the veterans I've talked to, definitely not. I kind of compare it to the DMV. You look at the government organizations, a public organization, why do you have to wait hours in line? This is just like the VA. You're waiting for a long time to be seen. If you just broke your leg, or you just had a mental breakdown, or you just had this, whatever, you're going to be waiting for a long time to be seen. Yes, the staffing is a problem. So yeah, to bring it back to the VA, to a greater healthcare thing, staffing is a problem, and also paying their employees. You're going to get what you pay for. Right. These VA employees, they're amazing people, amazing human beings. But at the same time, you're getting low staff, you're getting low paid employees. So they're not going to care as much for their patients as you would a private healthcare system. You get a Kaiser and you're treated like the president. You go to the VA and you're a veteran, you're treated like a number. And it's really unfortunate. I think the two biggest things would be the amount of healthcare workers and how much they're paid. I think that would correlate into a better healthcare system for all.
I can say that my boyfriend says the same thing as far as his experience with the VA has not been very good. And in regards to mental health in particular, that's something that hasn't, not with him, but just in general, that's something that has only recently been almost accepted or advocated for mainstream. Back maybe 15 years ago, up to 15 years ago, it was almost taboo or shamed, or so I'm grateful that it is being advocated for now.
Yeah, it's amazing that it's free, but at the same time, if you're not getting seen for your problems and your problems just get worse, then it's almost like, what is the point? It's really difficult to see.
And I think it varies quite a bit from VA to VA.
Right.
I get people from all over the state that come for their evaluations, and some of them have great experiences. Some of them have horrible experiences as far as the long waits and that sort of thing. And once you get into the system, it's a little bit easier. I think one of the problems the VA has is there's no rhyme or reason to who gets care and who doesn't. So some people who need to be cared for are not getting the information they need to go through all the red tape to get seen. And I just don't even know, with all the red tape, how someone who's severely depressed or who's have severe PTSD, I don't know how they can navigate that system. It's a very difficult system to navigate through. I see people for disability that clearly are almost at 100% disability, but yet still they've never been seen by a physician, have never been seen by psychiatry or psychologists. So I see the other side of that too. I do the disability side. I was on the treatment side with the VA. I didn't like their model for interacting with patients, because I'm one that does like to listen and give time, especially to my Vietnam veterans that have waited a long time to be heard. And so I'm not trying to rush them or pack them in a 30-minute session. I'm just not about that. I'd rather take my time and make sure I know what they're about, but make sure I can hear them, or they can be heard. So I was with the VA for a very short while, and I walked away from it just because they wanted to put mental health on a medical model, which is you're in, you get the list of symptoms, you give them some medications, and they're out the door. And I didn't like that model at all. So I couldn't agree with that. That's totally different than the training I have as a psychologist. So I didn't stick with that very long at all. Yeah, it varies. I've heard some people who have wonderful stories from VA. They're not all bad. But then some people, the VAs just aren't close. They come from little small towns and rural areas, so they have a hard time getting to the services they need. And that's the same way with maternity, the same way with, women or clinics for women that are pregnant or need gynecological services or whatever. There's fewer and fewer places in some of these areas as well. So we've got a lot of different issues in our medical system. I think we can start resolving a lot of these if we go to a Medicare for all system where it's even across the board, as far as you don't have bills when you get home. Those bills will make you sick when you see how much you owe. Worry about losing your home and your property and all this. I have a friend in Canada that was in a really bad motorcycle accident. He never got a single bill, not one single bill. He was unconscious for months. He was in a hospital for months, never got a single bill. We need to move it quickly to that, as quickly to that as possible. I can't say, Medicare for all is the one thing that's not having Medicare for all is actually fueling, I believe, a lot of the mental illnesses we have.
Yeah.
People have to worry about getting sick. You should have to worry about getting sick.
Absolutely.
Getting sick is sick enough. And everybody I know knows at least one person in their family, or they know at least one person that they're either afraid for or afraid of. We all have that person that we know that we're afraid for or afraid of because of their mental health status. So we're all touched by it, and we need help as far as making sure they have everything they need to get some help and get them moving and get them straight, so we can be straight. Mental illness affects not just that person, but it affects everybody who loves that person.
Yes.
And that's what's hard. It tears down everybody who's connected to that person.
Right.
Awesome point. So the next question is about disability. You mentioned mental health and disabled people. I wasn't blind at birth. Like, I literally lost my sight overnight 2 years ago. And that physical disability thrust upon me, that trauma, also exacerbated the depression and anxiety I already had. So, I guess we can go around again. Dr. McCrae, so what do you see in your patients with disabilities, like how much their mental health is impacted by their disability?
It's interesting that some people like yourself are just amazing through their disability. And if anything, it helps to fuel them to do something bigger, something more. It fuels them to do something bigger than themselves. And other people, they're just so overwhelmed by everything it takes to get through their day. So it just depends, and it doesn't help if they don't have services, readily available to help them through that. With disability, you have a lot of aloneness. A lot of people, I'm going to bring this up too, because we get a lot of people with hearing problems. That's a disability, but you've got a sight issue. Hearing is an issue as well. When people can't hear what's going on around them and everybody's laughing and joking and that sort of thing, those people are more prone to Alzheimer's going forward. They're more prone to dementia because they're not stimulating their brain in the same way. They can't hear, so they're not stimulating their brain in the same way. So they're alone. They can't get the jokes. People are laughing around. They're pretending like they hear when they really don't. They're isolated emotionally. So mental illness and hearing kind of go hand in hand in a lot of different ways. So we have to think about that as well. And so I can imagine what it's like to lose your sight, 85% of your sight overnight. That's a lot to adjust to. Has it stabilized at all?
Oh no, it's permanent. Like I've had eye surgeries and stuff. Like
So it's constantly getting worse. So we're talking about what we call a chronic adjustment disorder, where you're always having to worry about the next thing and the next thing, and then that leads to this. So it's a chronic sense of depression and anxiety. You're constantly adjusting to the next thing, and that's, I commend you for everything you do in the midst of that, because that's a lot.
Thank you so much. Yeah, and you're right. It does affect families too. Like, I'll be like to my husband, I can't plug in my phone charger, plug it in for me, because like I can't find, just the littlest things. So yeah, all of that just, God, it just weighs so heavy on your mind, and it really exacerbates any kind of depression or anxiety you might have. Lorraine, have you experienced anything like that, or any of your relatives or friends?
Yeah, so I had a friend who was paraplegic. He had an accident at 16 years old, broke his neck, and then from that point on, he was wheelchair bound. And one of the things that he struggled with was that similar, just trying to get through the next activity, just trying to, trying to accomplish basic things. But then in addition to that was the guilt for if he did have to ask for help, or if he did have to lean on any friends or family. So, that adds not only to, I would assume, feeling of isolation, but then feeling of shame for having to need somebody else. And then with my mom, she actually got died of brain cancer, but it was a long process. And so, during that period when she did, and my mother was very independent, so she would get very frustrated and angry. And of course, not only would that be toxic for her, but then it would be kind of traumatic for us as well. And so it is a ripple effect.
Absolutely.
Most definitely. But one of the things that I have found with, say, the veterans with disabilities, those people that were injured in combat, those people that lost a limb and that sort of thing in combat, what I have found actually is that their depression and anxiety is not as bad as the people who stood next to them and almost got killed. Those people that stood next to them or watched someone else get killed or was in that situation where they almost got killed, they're stuck in that state of waiting for something else to happen.
Right.
That's why they need the weed to bring them down, because they're stuck in this sort of something else is going to happen at any moment. Whereas the people who actually got hit sometimes were able to cycle all the way through it. So they have other issues, but not necessarily that acute anxiety that something bad is going to happen, because with them, something bad did happen. Those that where nothing bad happened, but almost happened, they're stuck at this heightened sense of doom, like it's going to happen at any moment. So that's why they have difficulty at Walmart or anything else. They're waiting for this thing to happen. They, just a bag on the side of the road, anything like that. They think it's going to happen at any moment. They're waiting for it, and their body is stuck in that state of waiting or thinking something's going to happen right then and there. That's what I've seen a lot of those veterans like that. So sometimes the disability, when the people are injured, when they think they're going to be injured, it doesn't necessarily mean that those people are more mentally ill than the people who weren't injured. The people that weren't injured sometimes are worse off than the people that were injured. That's my my experience with the ones that have been injured. Because are you sure you don't have depression? Are you sure you're not anxious? Are you sure? They're like, no, I'm fine. I just have to deal with all the pain and getting around, but I don't have that thing. So the people who almost got injured are in worse shape, that almost got injured, that are in worse shape. So the people that are left behind are in a lot of worse shape than the people who actually experience the events. And that goes for trauma at home. A lot of times people who watch the domestic violence, who are right there, they're worse off than the people who actually sometimes go through the actual domestic violence or whatever, just being in the vicinity. So we have to think about mental health broader than the person who's just the victim.
Right.
That's a really great point. Austin and Gregor, do you see that happening as well? And I've heard people call it like survivor's guilt, things like that. Do you see that with the veterans you work with?
Now, I would say that first and foremost, everyone's story is different. Everyone is individual, and the way that we process trauma is all case by case. Some of these folks that have been through trauma are still traumatized and live that every day. And their family can attest to that, and their friends as well. And I would just say that to fast track this, since it is an individual basis, I think that we all need to take a step back, realize that yes, maybe we weren't impacted physically by the IED or what have you, but we are around. And yes, we did go through trauma. And yes, my best friend or my brother, yes, is gone. But guess what? We are here today, and we are lucky to be here. And first and foremost, we need to take our own health into our own hands, because you wake up and you seek that improvement yourself. You see the mirror and you should be thankful. Sometimes we forget and we're complacent with our lives and our freedoms in this body and in this world. And it's very important that we seek that from within. And some fundamentals of health, I feel like we really do forget in our healthcare system. For instance, yoga. This is a part of spiritual health, mental and physical. Yet many people in America don't do it. And this is a foundation of health. And it helps with being in touch with yourself, going through your traumas, and really finding peace within. And if we didn't, we weren't so quick to diagnose potential diseases and or anxieties, I think that we can actually get through them a bit quicker and help with more holistic methods instead of diagnosing potential diseases with something that we don't really actually need to use or put in our bodies.
So I see a lot of survivor's guilt. The people that were around the trauma that had happened, they almost sometimes wish that it happened to them, because it's just so much to take on and to see, and they think so much of, why was it them and not me, and why did I witness that, and it didn't happen to me. So yeah, survivor's guilt definitely is a big thing, especially with veterans, and that trauma just tends to compile, I feel like, sometimes. So yeah, that survivor's guilt is definitely there with quite a bit of veterans.
Yeah.
And do you both find that in talking to your veterans, do you think that, I mean, we've discussed what it is like once you are out of the military for the VA, but do you find that, some of the veterans you interact with have stated that it's hard to also get treatment when you're in active combat?
Yeah, so during active duty, it's almost looked down upon to get treatment, to be honest with you. You're looked at as a broken item if you can't go and train in the field or do your job. So it's a bad negative stigma toward even getting treatment, and you're almost shunned for it. So yeah, I definitely think that treatment in active duty is worse than treatment outside, because you're not as shunned for it. So it's an unfortunate thing, and sometimes a lot of these military members just go 130%, and they're hurting themselves even more, going out with more injuries, and in fact their brother and sister to the left or right of them is affected by that, because now they're not at their 100%. So yeah, it's unfortunate, and during active duty it's even worse. The healthcare is even worse.
Yeah, it is a lot worse from what I understand too. Especially the women that there's what we call military sexual trauma as well. They can't seem to get help until after they get out because of the stigma, and it's just a mess. So we see a lot of that as well. Yeah, the stigma is really bad, but it's no different out well, there's a lot of stigma in the Black community about mental health. It's starting to ease up a little bit, and I'm not sure about the Latino community. They tend to will show up at a doctor's office with a physical ailment, a physical pain. They're willing to talk about the physical pain, and then you talk to them more, and you realize that it's a mental health issue. But the stigma is there. But if we could have a situation where not only is it there, but that it's good to talk about, but also people can actually go get some help right away. Go talk to somebody, a social worker, somebody, about what's going on with them and their family. But the stigma, it's a problem. That's one of the main reasons why I put my head in the ring. It's like, okay, I want to at least get mental health on the table. I want mental health to be an item to be prioritizing in Washington. And I'm going to continue with that quest. But the main thing is just trying to get rid of the stigma attached to mental illness, because it's stopping us from doing a lot of things. And a lot of the stuff we could just do a lot better. And yes, it does need to have the components of the yogas and the meditation and those things too, because those things can actually work just as well, if not better, than some of the medications. A lot of the mindfulness training, which is part of that, is just mainly centering yourself in the right now, right here, not right now. And that's what yoga helps to do as well, is to center yourself into what's now. And most people, if you just ask them, are you okay right now? Not with all these things you're worried about. Are you okay right now? And everybody, 99 times out of 100, they're okay right then, and they can calm down a little bit. So it's a matter of being in the now that we have to get better at. As Americans, we don't do that very often. We're always in the future, always in the past, never in the present. Yeah. So it's just a bad American habit that we have that keeps us totally anxious all the time, or depressed about the past, or anxious about the future. So it's an American habit, I think, that we have.
Great.
You actually stole my next question. I was going to ask about women and people of color, especially when, not just veterans, but how many of your patients do you find that come in not just because of trigger warning, like sexual assault and things like that, but how many of them do you think, is it often that your patients say, I'm dealing with sexism at work and it's leading to depression, or I'm making less money and it's, or people are, whistling at me in the street and it makes me feel, you know, unvaluable or anything like that? Is that something that you see with some of your women patients?
With my female patients, I see a lot of self-esteem issues, a lot of self-degrading issues, a lot of putting themselves down. I see that with men too, but I see it more with women. Uh, I will say that this generation, this new group of people, young people are not so body conscious like they were back in our day when Twiggy was the thing and
Yeah.
being super thin. Now people are starting to acknowledge how beautiful big women are. So that's cool. The body image thing is less of a problem with this new group of folks coming up. But then there's still that perfection thing in the nails and the eyebrows and everything else. They all have to look like they are screen ready at all times. That's another issue. But at least weight isn't the issue right now as far as the focus. But having the perfectly chilled eyebrows and the nails perfectly, there's a lot of stress there trying to look like what people do using those. Social media hasn't helped.
Right.
Because with the various methods people have for making their skin look better or their eyes bigger, brighter, or whatever, they have all these things that they can do, Photoshop. And so young people looking at that, they're like, I want that body, I want that face, I want this, it's really affecting people a lot, especially the women, as far as feeling like they need to live up to that,
Mm-hmm.
to live up to the housewives of the famous or whatever. They need to live up to all of that stuff. So we're getting other pressure now with the media influences for them to look or be a certain way. So the impact of that is really something. In the African American community, of course, we're having issues. But the problem is only less than 4% of the psychologists are Black, even though
Wow.
a big percentage of the issues are coming from the poor communities, and a lot of the communities that are poor are Black or Latino communities. So, and there's fewer of us to take care of those issues.
Right.
So, of course, it's a cyclical thing there.
I would say that because I'm part Filipino and Native American, and so I have existed mainly in the community with people of color and Latinos and Black, and my experience of or the culture that we tend to adopt is the I'm fine, everything's fine, because we have to truck through, we have to push through no matter what, because we don't have the luxury of being able to address those types of woes, and with being in an environment that is that is more poor, there is for myself is what I'm speaking. There is, you were talking about being catcalled or being assaulted sexually. We don't think that again, myself and the people that I interact with in my group, we just don't feel like we're going to be heard. So there's that that we're just gonna push it down because that's just what we have to do, versus being able to lift it up, address it, and then try to stop it on a global or local level.
Yeah. And then addressing, racism and mental health, and that, especially, the mental health issues among the Native American group is just it's just mind-boggling how they've suffered over the generations. The suicide rates are higher. Believe it or not, the only group of people that are killed by police officers more than African American males are Native Americans. Are killed at a higher rate by police officers, slightly higher. I don't know what that's about, but it doesn't sound right. But definitely racism plays a role in that. Right. So the Native American community, we have to address some of that, all of that. There's a lot of apologizing that hasn't been done. There's a lot of fixing that hasn't been done, and it has to be done. For everybody to move forward. There's a lot that has to be addressed.
And it's a lot of just sweeping under the rug the epidemic. I guess it would be epidemics of, sexual assault, even murder. Serial killers tend to gear towards, people of color to target. But that isn't. It's just swept under the rug.
Yeah.
So it's not even acknowledged.
Yeah.
Yeah.
MMIW is hardly ever talked about. Missing and murdered Indigenous women. I mean, you're talking thousands every year.
Yes.
And that's their families affected too.
Yes.
No closure, no answers, no nothing. So that's also a tragedy in itself.
And feeling like prey, feeling that constant fear of walking down the street, or just that constant fight or flight, just that anxiety of, am I even safe?
Right. Yes.
Absolutely. Gregor and Austin, as far as your work with veterans, do you deal with women veterans? And if so, do you find that just, of course, overall, but do you find that there are differences in what they're suffering from?
Yes, in my interactions with female veterans, I have seen some of the similar traits and how they're treated, especially by other males, civilian males and veteran males. I'll just be 100% with you. It's got to be very, very difficult. And any time that I can support any female veteran or civilian, and I do my best to help them stand up against the stigmas of sexism and or racism as well. They're doubted consistently and not treated fairly at all. And this is in my experience. And I feel like that was while I was active duty and also as a veteran as well.
Yeah, I feel like women in particular are just preyed on by men, and it's really unfortunate, especially because obviously biologically men are just physically a little bit bigger. So that just, I can only imagine that's really freaking scary. So I have so much empathy for women in society today. And of course, you're just talking about social media and how everyone wants to look perfect and this and that. And, we all are walking around trying to look almost fake, if you will. And then that just allows men to prey on them more. It's just, it's a scary thing. So I have a lot of empathy for women in society today.
I mean, as a woman who's been doing a show by herself for 5 years, it took me a minute to ignore those comments and, oh my God, I'm talking about something serious. Why are you making those emojis and stuff like that? It's a lot. It's a whole other kind of pressure. It's truly mind-blowing, but now I'm just whatever. I feel bad for you if that's what you're concentrating on when I'm talking about imperialism or something. But in any case, one of the things I definitely wanted to touch on was before losing my sight, I worked in healthcare for over a decade. And I noticed, and so many of my comrades have the same exact experience. There was even judgment within the healthcare system. I would be like processing a claim or pre-authorization for something, psychiatric or something, and you would have a nurse walk by and be like, "Oops, somebody's going in the padded room," and stuff like that in healthcare. So I just kind of want to address that going around again. Dr. McCrae, what would you say to people in healthcare who, may not understand the severity of such a thing, and also why that's not funny?
Well, I think that you have to, when you're in healthcare, when you're constantly around people that are ill or are mentally ill, you have to make a concerted effort not to get jaded or not to be, you have to make a decision that, hey, no matter what, I'm not going to be part of this negative conversation. I'm not going to ignore the bells that are going off in the nursing home just because everybody else does. You have to make a concerted effort to care. And you also have to know when to disconnect when you find yourself being kind of crass or being negative or being pessimistic about everybody. Um, I see a lot of that in prisons because they assume that everybody's lying. And I've seen people be really, really sick, close to dying because even the nurses were like, "Ah, he's just lying," or "This person's just a fake," or whatever. I've watched people almost close to death because they had bad attitudes. And I think it just has to do with being immersed in that all the time. We have to have a system that takes care of the caregivers as well. And they have to be able to get a break. They have to be paid well enough where they can take a break before they start to become jaded and mean. And some people need to be taught not to become jaded and mean. And some people need to be caught on the rug about their behavior. A lot of it is fear, too. A lot of times when people are afraid that that might be them down the road, they can be some of the meanest people towards those people that are suffering. So a lot of times they need mental health treatment as well. Say, hey, wait a minute, what is this about? Why are you being so mean to these folks? What is your fear connected to this person's illness? Who else do you know that has that illness? It's just interesting how these things are connected, but definitely they have to be taught to be, not everyone's good at being nice, but if they're overworked and underpaid, they're really not going to be nice. So you have to teach them to be nice no matter what, and call them on they might not even notice they're being rude because they've been doing it for so long.
Do you think part of it might be a defense mechanism, or maybe even cognitive dissonance of, holy crap, people are going through so much pain and I'm doing what I can, but I can't take it away?
Yes. Listen, their fear, their frustration, so they take it out on the very patients that need them the most. It's really, really interesting. I tell people all the time, always go to a hospital with your patient, with your family. Somebody has to be there because it's a situation where if somebody's not there that loves them, there's an attitude that can take over that situation and your person might not be cared for because people just can be mean. And I think it's because of their fear that could be them at any given point.
Absolutely. Lorraine?
I've got a friend who is a psychiatric nurse at a psychiatric hospital in our state. And one of the things that she had said during a conversation where I was just extremely curious about what she did, she said that she had to fight kind of desensitizing herself because she would stop having empathy, like you said, Joy, as a defense mechanism, because she sees so much craziness, she said, and that basically she had to kind of put up a wall and step back from it so that she wasn't feeling like she was traumatized from it.
Right. There's such thing as like vicarious trauma through other people's trauma, and then there's just that caretaker burnout that happens. You got to take care of yourself first. You got to pull back and take care of yourself, or you will become kind of mean and jaded. And here comes another one.
Yeah.
So yeah, it's important that the caretaker takes care of themselves.
Yeah. And I think also some of them go through experiences that are scary. And so they almost get angry and resentful towards those patients.
That's purposely. Somebody else is going to speak.
So I was going to say, it kind of brings it back to the 2 points I was making earlier from the VA translating to the bigger healthcare system. I think when staff is low staffed, it adds another layer of stress on these healthcare workers that is not needed. And then also being underpaid, you don't feel valued. So you carry around that jadedness, and that just gets spread onto the patients, and it's unfair. So I feel like with more staff, they're able to take more breaks, have more of a mental health break for themselves, and then also they're getting paid more. They feel more of a value. They feel like they belong to the hospital. So I think if we could just have more staff and better paid employees, I think it would result in better care for the individual.
Right.
Absolutely. So we could talk about this for like 5 more hours pretty much, but unfortunately it's time for the next panel. But I do want to just go around and give everyone a chance for last thoughts, and also where people can find you, your website, your Twitter, anything you want to plug. And just thank you all so much. This was amazing. We can go around the same way. Dr. McCray?
I'm easily reached by email at valerie@drvaleriemccray.org. That's Valerie with the IE, VALERIE. So it's Valerie@drvaleriemccray.org. You can email me and I'll get right back. I'll get back with you. That I handle my own email these days, so I will get back with you. And then we can talk from there if you need help or need guidance on getting somewhere. We are going to hit the 2024 election coming up for the Senate race. But I've got time to do that. So I've got time to handle the mental health part of it as well. So just give me a call. Just email me. Y'all get back with you.
Awesome. Lorraine?
So I just want to say thank you to everyone for letting me be here with you. It's been an awesome conversation, and I love to learn, and I love to connect with other people who are trying to make a difference in this world. So thank you for that. Right now, you can reach me at just my Twitter, at Ba Intelligent, capital B-A Intelligent. And I'm just kind of doing that right now. But if anybody has any questions or anything that you think I can support you with as far as, wellness and health and, just even someone to listen and to empathize and to empower, please feel free to reach out to me.
Awesome.
Oh, and just real fast, I want to say, Dr. McCray, let me know how I can support you. With your in 2024, honey.
Hey, I've got I'll get your information from Joy. I will do that.
Right.
We just want to say thank you so much for having us. It's an honor to be here and to talk on mental health care for all. We want to help in any way possible. We want to make an impact, and we want to help people improve our healthcare system for all. And if you'd like to reach out to us, you can catch us at a beach cleanup. We do them the first Saturday of every month and the third Saturday of every month at 11 a.m. in San Diego Pacific Beach. You can reach us at purposefirstbc@gmail.com.
Yeah, I'm really, really grateful for the opportunity. Let's keep working to destigmatize mental health, because honestly, usually everybody is going through something, no matter if it's small or big. So I think, when you ask how someone's doing, they automatically say good. And that's usually not the case. So let's continue to work on just, you know, making mental health more of a thing. I think with generational trauma, it's finally coming to light that this is something that we need to work on in society. And yeah, we're super grateful for the opportunity. We also have an Instagram that's Purpose First Beach Cleanups. And yeah, catch us in San Diego. We're also building a sustainable hemp company to replace things like plastic. So much love, and let's continue to work together.
I love that.
Nice. Awesome. I cannot thank the four of you enough. You are all amazing. Keep doing what you are doing. Dr. McCrae, Lorraine, Gregor, Austin, please follow these amazing people. And this was amazing. This needed to be said, and I am so glad that you all joined us. So much love, and thank you so much.
I love you, Joy.
Anytime. I love you too, Joy. You're great. Thank you, guys. I love meeting you all.
Thank you so much.
Love y'all.
Love you. Have an awesome day.
Thank you.
Thank
Stay
you so
tuned,
much.
everyone. We actually have even more panels. Oh my gosh. Are you guys kidding me with this 3-day forum? It is so amazing. I am learning so much. It's just awesome. Like, I'm kind of fangirling over the whole 3 days. So the next panel is disability, the inequities within the disability community, inequities of the ADA, inequities of the Social Security disability system, and everything like that. We are going to have a 4-person, very candid discussion from all 3 of our all 4 of our perspectives. All 4 of us are disabled with medical needs, different things, of course, and we're just going to be discussing, having a candid conversation about this. And we, invite everyone to tune in, not just disabled people. This is for everyone to learn some of the struggles we go through. Before we add these 3 new wonderful panelists, I do want to say thank you so much to our sponsors. And I want to push, we have an incredible raffle ticket thing going on where you can win a basket with over $150 worth of merch, Medicare for All, shirt, hat, all kinds of treats. And you get one for every $20 donation. For instance, you donate $40, you get 2 entries, what have you. So we could really, really use the donations. We have upcoming events as well. And let's keep it real. Some of us from last July still have our expenses on our credit cards. So this is 100%, like, when we say grassroots, we mean grassroots. Like, we're a whole bunch of poor activists just doing what we can. So yes, anything you can donate is so much appreciated. So thank you again to these wonderful panels. And Andy, if you'd like to bring in my next guest.
And just one quick note, Joy, I'm so sorry, but we have not yet heard from Mr. Derek Graham. So as soon as we get him, we'll bring him in.
All righty. So I am joined by 2 fabulous people. The gentleman below here, you may recognize, maybe, from, see, facial expressions like that. There it is, right there. There it is. Mr. JB, brother from another mother. I do so many shows with you, and I love it. You are on the Revolutionary Blackout Network. And Michelle, I've done some panels with you. You are an incredible disability activist and just an awesome organizer overall as a whole. So thank you both so much for joining me for this really important discussion. If you want to just elaborate and introduce yourselves more, we can go this way. Michelle?
You're going to make me go first. I love being voluntold. So my name is Michelle Mashburn. I'm a nonprofit executive. I'm also a disabled woman. I've walked through invisible disabilities and then now into visible ones where I use a power wheelchair. I also have a lot of complex medical things that I juggle as well. So that makes me kind of everything informs what I do and how I do it. I've been on disability most of my life. I am hoping soon to transition off, but that's a whole nother scary prospect, especially in light of our healthcare systems. So that's who I am. I'm also a Green Party member. There's a few other identities, but I'm here. I'm glad to be here. Looking forward to the conversation.
Absolutely. And Mr. JB.
Oop, he's muted.
You're muted, boo.
I'm sorry. Let me start again. Good evening, everyone. My name is James Fauntleroy. I am part of the Revolutionary Blackout Network. I also have my own channel called the JB Font Channel, also on YouTube. And I am a political commentator. And I also, I would say, I advocate for either a single payer healthcare system or a fully nationalized healthcare system. And yeah, I'm also disabled. My disability is more invisible. I suffer from chronic kidney failure. I'm on kidney dialysis. I go 3 days a week. I was diagnosed with nephrotic syndrome at the age of 8 or 9, I think. And so I've had to deal with having a chronic kidney disease ever since I was little, but I've been on dialysis for over 15 years. So it's nice to be here. And thank you so much for having me.
Of course. So we can actually start with that. That's a really great point. There are invisible disabilities.
Oh, yeah.
I will tell you guys personally, I can't drive obviously because of my blindness, but I am completely self-conscious about getting one of those placards for the car. I have not even applied. I have this horrible fear that I'll be like, why do you have that? Because people do it all the time. I noticed, I just became disabled 2 years ago. So I noticed going in stores, like if I'm trying to put my charge card in, and I'm having issues. So JB, as someone with, an invisible disability, what are some of the things that, you would tell people about, some frustrations that you deal with?
I just let them know. And if they want to say anything about it, then that's on them. It's like, that's a you problem, not a me problem. There's times where I know my limitations. And so if I have to express my limitations, then that's what it is. And I typically try to let people know that limitation beforehand. And so there's no ambiguity as to what I can and can't do. If they have a problem with it, then don't call me. That's basically it. And if they have an issue with it, okay, then that's your issue. But the thing is that part of my question is, if you have an issue with it, then you want to give me a kidney? If not, then you're gonna have to deal with the issue. And that's basically the way it is. And we're disabled, but we're not somebody that is using our disability to inconvenience you. You know what I mean? And I think people need to realize that we've had to come to terms with it, but you also have to come to terms with it too if you want to deal with us. Because if you want to be in our life, then you have it's just like having a friend that is in a wheelchair and you want your friend to come over and you have a couple steps in front of your door and you're like, just come over. And then as soon as they come to your front door, you go, oh, really? And it's like, You knew I was in this before you met me. So either you and the rest of our boys come on each side, pick it up and bring me inside, or you build a ramp so that when next time I can come over, then I can get in. Until then this is what you have to deal with. And so that's something I think that people have to learn to deal with. Like, you have to focus on people's limitations. Like, for instance, people will focus on a pregnant woman's limitations when she's pregnant, and they're fine with it. But when somebody has a disability and they don't want to focus in on their limitations to help them be able to do what needs to be done, why won't you do that? And I'm not saying that being pregnant is a disability. Absolutely not. What I'm saying is that if it forces limitations upon you, in order to carry to term a healthy baby. So therefore that you have limitations. Well, with being disabled, you also have those limitations as well. Or if somebody comes out the hospital, you have to do, they have limitations as well, until they fully heal. And so that's just something that I think that people need to be more cognizant of.
Absolutely. Michelle?
Mm-hmm.
It's always interesting, especially being with other disabled people in general, on how much we take on the burden that society places on us.
Mm-hmm.
I am disabled. I have human needs. My needs will improve how much I can, quote unquote, produce for society. But yet I'm told that I'm the burden. But yet, like, a pregnant woman isn't seen as a burden. So there's a stigma attached to that. And I think whether it's, you deal with it in different ways, whether it's invisible or visible. Your disability is invisible or visible. And then we have our internalized shame and our internalized ableism. And this reality that we don't yet, in America especially, we don't yet see disability as a normal, natural part of the life trajectory. We see it under the public health lens of it's a failure. There's a stigma. You are a burden, and then the programs that we access end up making us even that much more of a burden, because we're always rubbing two nickels together thinking we're going to suddenly become comfortable, not even rich, but comfortable and safe, which is that cortisol response when you're not safe is just messed up. So my ongoing call to disabled people is embrace your needs, because they're normal and natural. Stop worrying about what other people say, because we need you, Joy, as the powerhouse you are, to be in that role. And when you need it, use it. When you don't need it, don't use it. It's as simple as that. There's going to be drama. Society hasn't yet caught up with this thing of disability being a normal part of life experience. They want to blame us. They want to do all this other stuff. But what we need to do is just move in those spaces and show people how we can be. If you meet my needs, if JB, I'm sure with you too, if you meet your basic needs, we can all do so much more, but when we're parsing it out and saying, oh, you're not producing enough, and the way you produce is not right because you're drooling right now, and their discomfort with their abled fragility, which is what that is their discomfort with whatever I need. My use of a chair, I see this a lot where people react to me being in the chair with a fear response because it's kind of big and I'm kind of big, and I can understand I can break a foot with my chair, but it's that ongoing thing of their fear is not my fear. And we just need to meet our needs, and it's hard to do that sometimes in the structures that we're in.
Yeah,
absolutely. And I know, Michelle, one of the things we've spoken about before is ADA, and I know you've studied up on that very much. Both of you have been, in this longer than I have, but 2 years, and I am just blown away by, the ADA, it's supposed to be this magical thing. They have it set up so that, there's no disparities within people with disabilities. And I'm learning that the one place I literally went online to buy, it was prescription. I had to get one of my reading devices online. They made me do a CAPTCHA or whatever the hell it is to get my reading device. So you are telling a blind person who needs a prescription to get a specific device that they have to pick out the freaking traffic lights before, like, I had to wait till my husband got home. Like, what if you don't have someone else? What if, you know, or things like, you know, ramps. I've seen so many places that don't have ramps, which I thought was illegal. I thought it's supposed to be, but it's my understanding the ADA hasn't even been updated since its inception, correct?
No, it has. It has been updated. 2010, I think, was the last major update. And then there's a lot of other micro-parcel rules that get put out in like building codes, employment law, different things like that. But the thing that this goes back again to the ADA, the ADA was passed for a specific reason to hopefully improve the equity for, well, actually, it wasn't even about equity, it was about rights of mostly white disabled people also, which is part of the problem in the framing of it. But it was our responsibility. It's the disabled responsibility to police the businesses, the health companies, all this other stuff. So when you're having to do that, they don't have to do anything unless you make them do it. I'm sorry, I don't have the energy to survive sometimes, so I can't really push you into doing the things that you're supposed to be doing.
Yeah.
It's a lose-lose. And then there's a fear reaction too with the ADA. When you go into a business that has been in business, and it's, say, a mom and pop place, and they have a fear response because they're afraid you're going to sue them. And that lawsuit would cost them a lot of money and potentially closes places down. But usually disabled people, and I'll say this for more physically disabilities myself, you know, the way I deal with society is it's only when there's an attitudinal barrier that I'm really pissed off. You know, when you're failing to at least acknowledge I'm a human being and you want to push me out of your store and make me go away. You know, it's a mess. The whole system's a mess.
That's kind of wild though, because it's like we have to police, you know, businesses for ourselves just in order to be able to get access. And it's like, wait a minute, why don't you have people within the bureaucratic process that do that?
Mm-hmm.
I mean, you know, like, what do our federal dollars go towards? You know, and it just makes me upset because, like, there should be inspectors that go to buildings and go, okay, so is this ADA approved up to code? If not, then you guys need to get this done, or we're going to have to shut down because, you know, lest someone who is disabled tries to come in and they can't, or there's a hazard there that prevents them from truly being able to access the business.
Mm-hmm.
You know, and even then giving subsidies to businesses so they can put a ramp or put these accessible things for people who are disabled. I'm not saying that put it all on businesses. I'm saying give them subsidies so that they can do that.
Yeah.
You know?
Yeah,
But what
and I
about
think transportation is something that I find is, you know, I can't drive. So, you know, when I use an Uber or Lyft, it got to the point where I literally type in the comments, I am visually impaired. Because what would happen was I would get one and they would come out to get me. And the person would literally get out of their car and be like, I'm right here. And I would just, it would upset me, you know, and because I'm still self-conscious, this is all still very new to me. And I'm like, okay, if you are driving people for a living, why do you not acknowledge the fact that maybe some of them might have health conditions, disabilities, whatever, but it made me self-conscious to the point after it happening numerous times that I just put in the comments, visually impaired, impaired, may not see car. I'm wearing XYZ. Please pull up. And it's like, again, that, you know, that onus is on me. Like, it is my responsibility somehow to be like, check yourself.
And you have the added complication that you can also be turned down by Uber and Lyft drivers if you are disabled.
Absolutely.
So by disclosing that, you're also running a risk of them saying, "Oh, I don't want to deal with her right now. I can go take this other person."
Absolutely.
Yeah.
Absolutely. One of the, also with transportation, have either of you dealt with anything as far as, buses, trains, anything like that? I mean, Michelle, you're in a wheelchair. I can't even fathom, like, what are some of the obstacles?
So I actually had to buy a car during the pandemic. I had to buy a wheelchair accessible van. Because of a lot of the fear factor and the exposure and COVID and all this other stuff. The cleaning of vehicles, the paratransit system is woefully inadequate. With some states, they have their Medicaid program will pay for transportation. I have a funny story for that if you really want to hear it, because I was in the hospital, they arranged for transport home. I had my chair with me, and they just called the medical transport company without telling them I had a wheelchair. So they had to lift my wheelchair up into a second ambulance transport vehicle, and my chair weighs like 300 pounds because it's a complex rehab chair and all this other stuff. And this was done in a hospital, mind you.
Oh my God.
So it's like, okay, I'm supposed to rely on this system that doesn't help me very much. And it forced me into a point where, and I'm currently struggling because I also lost my mother recently. So, I'm struggling to make ends meet because my mom was still here. Bought this van. I loaned it out to the hilt because wheelchair accessible vans are $60,000 used, actually. So, here I have a 10-year loan on a van, and my mother passed away, so that income stream is no longer here. And it's always this balancing act. So it's not one thing or the other. It's that you have to fine tune your balance. Because any day being in a wheelchair, I go to my medical provider place during COVID, they had barred the wheelchair accessible entry point to put their COVID clinic right there for COVID testing. So I actually had to file a federal complaint, civil rights complaint against the building, against the company, very well affluent medical care place, facility, comprehensive network, whatever. They could not figure out why they were blocking me because they needed the space. They didn't want to think about me. They didn't want to think about disabled access because, you guys can do virtual, whatever, So these issues are all complex, but I go into my medical provider, they have their cart in the wheelchair seating spot. So I have to go take up 3 chairs, which people look at me sideways for doing, in order to have a space to be out of the way, more or less, or at least not having people run into me all the time. So these are all variables, and I may have garbled that. I'm not sure about the clarity of it, but these are things that you deal with, but yet they're not solely for physically disabled people that we encounter these things, because I think I encountered some of these things with the attitudes when I was predominantly just dealing with mental health stuff. It's like the barriers are still there. It's just, and then how we look at the barriers is whether we end up coming out empowered or come out, subjugated, basically. So
Yeah.
Absolutely. And oh my gosh, on that, before I get to JB, oh my gosh, like, why does this stuff even shock me? But that is mind blowing. Also, let me just say this before I forget. If you are like a young or healthy or able-bodied person and there's like 20 seats open, can you get the F up off the damn handicap seats? Can you not go in the damn handicap bathroom? Can you just like start being more conscious of the fact that like some people actually need those things? So if you're at the movie theater and you want to sit up front, sorry if those seats are full, etc., because it's not meant for you. So leave these things available for the people who actually need them. I just needed to rant because I've seen, like elderly people with walkers get on the train and have to stand because there's like a a 16-year-old kid sitting there listening to his headphones. And I'm like, get up. What's your problem? So you see stuff like that. GB.
Mm-hmm. So I just want to reflect a little bit with Michelle, what she said about oh my God, transportation. When it comes to, I'm forgetting for some paratransit. For some reason, I couldn't remember the word. But when it comes to paratransit, for me, I'm what they call ambulatory, meaning I can walk, I can climb stairs, blah, 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 just whatever. But for me, the barrier is cost. And I have to pay a copay each time I get on just so that I can get to and from dialysis. Mind you, for some reason, there's a barrier where I can only do it for dialysis and dialysis related things. I can't use that same paratransit transport to go to the store. I can't use it to go to shop for things. I can't use that transport to go to different places. Like, say if I got a job and if I wanted to go to work, I can't use it for that.
Mhm.
So it's like, well, why? And it's like, well, that's just how yours is set up. But people don't realize the cost barrier that it is, especially when disabled people who receive disability benefits don't receive hardly anything at all. By the way, also, Michelle, if a hospital set you up with transportation and didn't tell them that, that you were in a wheelchair, that was them dropping the ball, completely all their fault. Because guess what? These people are supposed to ask when you're setting up the appointment, is the person ambulatory or are they in a wheelchair? And if they say they're in a wheelchair, then that means it's up to them to schedule the proper vehicle to take you in a wheelchair so that they can lift you and put you inside the proper vehicle. Because that didn't happen, that was their fault. So guess what? They can suck their teeth and they can moan all they want, but guess what? It was somebody else's fault they dropped the ball. I just wanted to put that out there because I was like, because that got me mad. I was just like, no, you don't do that, Michelle.
Yeah, it's mine. It's like, but I know so it's not just solely, it wasn't the driver's fault. It was the admin person in the hospital. It was definitely their responsibility, their lack of information share. But I've known people that are disabled, they use a wheelchair, they get admitted to a hospital for whatever reason. And the first response of the nurses is, oh, let me move this for you so that we can have access to your bed, talking about the wheelchair. It's like, my wheelchair is an extension of me and you need to not touch it unless I absolutely do not need it. If you're taking it away from me, you're taking away, in some situations, the ability for a person to be autonomous. And the autonomy is where we get our power. The autonomy is where we can do more, because we can make the decision on how we do it. And we can do things in ways that most people don't realize, but we just do it a little bit different. I rely on an in-home care provider, and it's like, I'm fortunate, I'm lucky. I've learned how to move in these systems that require almost a freaking PhD to start moving in anyways. Where I work, I teach the interns and young kids how to read an insurance paper, how to read what this insurance policy is going to cover, and to know when it's not going to cover you. But that's not a skill that's learned everywhere, and we shouldn't have to. Why are we wasting our energy on that when it's beyond time for us? Because not having a unified plan is what's killing people, and it's killing people everywhere, and it's also further disabling people, and it's just complicating our lives in ways that we don't need. But we just need the single payer healthcare.
And a lot of times, like, it's because my disability is invisible and you can't necessarily see it. My disability is time and energy sensitive. And so a lot of times people will think you're just lazy. And it's not necessarily feeling lazy, it's chronic fatigue, as well as being able to do things at certain times. Like for instance, somebody's like, "Oh, well, you can do this on a Monday." No, I can't because I have dialysis on Mondays. Basically, I have to go get my blood clean. Whereas you, who are a healthy, able-bodied person, guess what? You're constantly going through dialysis as we speak. Yes, you who are watching right now, you're literally going through dialysis right now because your kidneys are working. Mine don't. So I have to go 3 times a week in order for that to happen. And just as another note, and you guys can clip this so that when people see this, then they know. Just because you're not disabled doesn't mean this information is not important to you, because one or two things are going to happen to you. Either one, you're going to become disabled as a young person, or two, you're going to get old. And you're going to need this system, and you're going to need this information anyway. So therefore, I suggest you sit your ass down and continue to watch this video, because just because a couple of disabled people are talking does not mean this does not or will not apply to you in the future. Because guess what? Disability happens either one or two ways. Either it happens either from a health or accident, or it happens from old age, and you're going to have it one way or the other. So please continue to listen. And if anybody is, that you want to share this information with, please consider sharing this information on social media, emailing it to people, or what have you, because this is pertinent information for every single human being, because that's just what we need to happen.
Absolutely. And I'm sorry, continue.
And I'm just saying that, for a lot of us, people, they don't keep these things cognizant when we voice these things. And we may, and I know that as a person, I have to be careful with how I voice things, because I don't want to come off as extremely pushy or rude. But at the same time, realize that when we're voicing these things, it is deeply important, especially when we tell people about our limitations, because when we don't, because when they don't listen, then they're sit there going like, "What's wrong with you?" And we're like, "Look, this is what's going on. You have to be cognizant of this, because if not, then you really can't deal with us. And in order for us to function in society, and if you have to deal with us." So that's just what I want to say.
Absolutely. And on that, I kind of want to bring up this point. When I was in high school, our health class, or whatever you want to say, we never talked about disabilities ever.
No.
Like,
No,
never even mentioned it. And, needing a cane for the first time, it's a white cane. Most people know white is for blindness. I'm telling you, when I bring my cane places, kids literally step over it. Literally, don't walk out of the way. They step over it. I've bumped into kids, and people, but kids so many times because I'm just walking. They're completely oblivious. They just stand there looking at me, and I'm like, parents need to teach their kids about disabilities and about being aware of these things. Like, I try to tell kids when they stare or they do stuff like that, white cane means blindness. Please be more cognizant of your surroundings. But we don't learn about that in health class. So really it comes down to the parents. Parents need to educate their children. You may see someone in a wheelchair or with a cane or what have you. And we just need to do a better job as Americans by educating people that not to stare and to be more aware of their surroundings. So we can go around again. Michelle?
I think that there's a lot of cultural variables in play when you start to be a disabled person out in society. For for me, I'll be, going towards somebody and they pull their kids closer to them because they're afraid, that fear response. Also, I don't know what it is, but when I first got in the chair, it was like I could not figure out which way people were going to walk, because they'd walk and they'd see me and they'd shift. And then they walk right by me, and I'm like going, if you guys just would let me go, I'd be fine. Just ignore me. Just pretend I'm not here. Yeah. So there's that, schools that we have to also remember, the disability funding in schools is not 100% funded. And there's a segregatory system that still exists that keeps the undesirables, those with different bodies, different minds, different whatever else, it keeps us in a closet. And it's like, it's not normalized. It's not, it is still the sign of failure in public health that you're disabled. That's checked. We failed as a society. And we failed not just with this one person, but this X amount. Now, I wish they actually looked at that and considered it, because maybe we'd get change, but they don't look at it. They don't consider it. It's like, oh, you're the failure. I'm not the failure. You're the failure. And you're too tired and you need too much and you do this and you do that. But and we have to educate ourselves and educate other people. And it's a never ending struggle, because we're already in a system that's stacked against us. And I think that's the never ending struggle. The stigma attached to the human needs that we might have is huge. It took me years to deprogram my mind to where I wasn't embarrassed that I needed an in-home care person. It took me years to reach that point. Through my work, I realized if you have a community that does collective access, your world changes. You change in a way that I couldn't. I always blamed myself for my mental health stuff. I didn't realize that my mental health stuff actually stemmed from a disconnect from a community of care or community of support. So it's like, but that's what the cult of individualism in the United States says, is we're all responsible. It's our responsibility to do everything, to meet the needs of everybody around us, and to bring home enough money to support ourselves. We have to shift from that. We really need to realize that disability is a part of life. And if we plan for those most at risk and most impacted, we can actually make it better for everybody. We'd be done with the pandemic right now if we actually listened to disabled people early on. If we actually met those needs, we would have met everybody's needs. So.
Yeah, I just wanted to add something. And to anybody that's watching right now, let me ask you a question. Those of you who are able-bodied and, have that do not suffer, well, I shouldn't say it that way, but do not have a intellectual disability. Have you ever been in class with someone who just physically they had a disability? They were in a wheelchair, they were in a walker, something like that. I'm because typically, kids who have intellectual disabilities, they're in a different class, things like that, right? But what if you are just physically disabled? Have you seen that person in the same class as you? Have you seen that person in a wheelchair in your class or in a walker in your class? And now you're asking yourself that question. Why? Because I know people who are in wheelchairs and, they're neurotypical. And yet sometimes I'll see them in school, but they're never in any of my classes. And it's like, why? Because, mentally, we're all, at the same level. We're at the same thing. But for some reason, you never see us around them. And then you start to realize that the system tends to take people like us and moves us to the side, moves us out of the way, right? And so it's something to think about, I remember when I was in 5th grade, I had my 5th grade teacher, Mrs. Youngblood, really sweet lady. She got into a car accident and it affected her legs. After some recovery, she was still in a wheelchair. She came back to our school in a wheelchair. Guess what? We took took care of her. Whenever we went out to recess, whenever we went to lunch, whenever we went to the bathroom, whose turn it is to, we would all fight for a turn to push Mrs. Youngblood in the wheelchair down the hall. I think that's something that we all should have, like a kind of mentality within ourselves, to look at it as a privilege to help take care of people who might be disabled, who might need some more help from the community. Because when the community comes together, then we all thrive, just like what Michelle said.
Absolutely. I want to kind of switch gears a little and talk about, the way people are othered as well. So, Michelle, as a fellow woman, how do you think that how gender plays into, being disabled? Is like inequities on top of inequities type thing.
Yeah, there's always that intersectional oppression. And for myself, I have multiple places of identity that I end up encountering barriers because of those identities. I identify as queer, I'm disabled, I am a woman, and I was raised poor, which gives, and I'm still poor, thanks to the systems that we occupy. So with all of that, you get more and more of what I call a muddy mess, basically, because it's intersectional oppression is kind of like mud wrestling, because you don't ever know what you're going to hit when you hit it. But as a woman, I think I've dealt more with paternalism with my disability. The things where people are like, oh, we don't see your disability because I don't see your chair. Like, yeah, you do. You see my chair. And I used to think that was a compliment. I'm like, oh my goodness, this guy values me for me and not because I'm just in a chair. But then I realized, no, that's not the case. He doesn't understand this yet. He doesn't do whatever. So that caretaking. The other thing that is a never ending struggle is within the healthcare system, as a woman, as somebody with complex medical needs, as a fat person, all of these variables, they'll tell you to lose weight instead of treating a cancer. They'll tell you that you just need to relax and do deep breathing instead of dealing with a genetic condition that may actually make your blood pressure crazy and you need to be medicated. So it's like, as a woman, there's a lot of gaslighting that goes on. Our government's been huge with the gaslighting throughout COVID. I'll say too, it gets to be messier and messier as you start to deal with the different variables. The other reality is, as a woman, you make less money than most men still in today's society. I'll say Black and brown people definitely make even less than white women. So with all of that, you end up with the disabled tax on everything. That is, if you need a special mattress, you have to pay not the $600 or whatever dollars for that mattress, but it's suddenly $1,800 or $2,500. Insurance is baked in a way that when you get durable medical equipment, they charge you monthly for the first 11 months of your rental period of that equipment. And if you color outside the lines ever, it's like, oh, we'll take that equipment back now, kind of thing, which you just compromised my life. But the other piece is it's like, as a woman, it's like, oh, you don't really know what you need.
What? These people, do not let me be standing next to you and they tell you that. No, because they will be hearing from me. Oh, hell no. No, you do not sit there and tell a woman what she does and does not need. Because the thing is that women are some of the greatest communicators in the world. And so if they tell you what they need, then you better goddamn listen to them. So that's my thing. Like my mother will tell me what she needs. Okay. I don't have to ask. I don't have to wonder. She will tell me. So guess what? They're going to tell you what they need. So if you just listen, then you'll know. God, paternalism and this patriarchy is such. I'm sorry, but I hate the cuss on this, but that's some bullshit.
It is
All right,
bullshit.
all right. I'm sorry. I cut you off. I'm sorry.
You have done enough shows with me to know I'm okay with cursing.
Yeah.
But
It just makes me mad. I'm just like, and I want to go up to other men and be like, dude, what are you doing? And then on top of it, being disabled at the same time, and you're just like, what? Are you kidding me? It's like, grow some empathy, bro. Oh, it just irks me to no end.
And
I get it though everywhere. Sorry, I get it everywhere.
As a person of color, what is your take on these things? What have you noticed dealing with your disability and how people are receptive to you or not?
Because it's invisible, it's not as prevalent of an issue for me. On top of having male privilege, I acknowledge that I have it. It's not as talked about. But then I like what you said, Michelle, about when people say they don't see your chair, but they don't really see you. They don't see that part of you that's disabled. They are not acknowledging that part of you. It's just like when people look at me and say, "Well, I don't see color." I just don't. And it's like, well, you don't see my identity. You do not see that I am a Black man that's operating within this world, especially within this country. It's like, yes, you need to see that. Joy, whenever you have your white cane, they need to see that because you're operating within a world that tries to see you as othered, or they want to see you out of the way. So, yes, see it, recognize it, and do not push us out of the way. Look at us, because we are in your tribe. We are in your community. We are members of that community, no matter what. And so that's the one thing though that I can say that I guess I'm kind of grateful for, is that because it's kind of a catch-22, because they don't see your disability, so they think you're quote unquote normal, but then they do see your disability, and then they either sometimes forget your limitations, because sometimes the people will want to have a full-on conversation after I get off of dialysis, and I'm like, I'm sorry, I just can't do it because I'm exhausted. And the funny thing about being on dialysis is that sometimes mentally it'll affect me, where my brain will become very foggy, and I'll start forgetting words. Like I forgot a couple words earlier today, and so the exhaustion and fatigue happens. And so it's difficult, and sometimes I'll get asked to be, on a panel on a dialysis day. And so I'm just like, I'm sorry, I have to decline, but I can't expect everybody to remember my dialysis days because, they can't remember. But, it's just, you have to continuously let people know. You have to remind them all the time of your disability, versus somebody who has a physical disability. They don't have to remind people that much. So it's kind of a catch-22.
Michelle, I see you.
I was going to add too that the physical. So there's a hierarchy of disability within the disability community, and then I'll also say there's a hierarchy of disability outside of the disability community, in the sense that people, they're not supports for people, and those supports often are not necessarily medicalized, in the sense that you can use insurance to pay for this service or that service. Or there's so much gatekeeping that goes on that you have to, I recently qualified finally for an insulin pump because I'm a type 2 diabetic and I've used insulin for a number of years. I've always been well controlled, but it was a 6-month process to get approved for an insulin pump. because of one blood test result that came back abnormal, that they then said the doctor didn't order the right test result, so I had to repeat it. And the second time it came back just barely into the normal range. So these hoops and loops and the hierarchy and all of this other stuff, it comes together and it creates a lot of complex situations and complex realities. This is ideal, this panel right now, because we have somebody with a physical disability. Joy, you've got the vision, a vision related disability. JB, you also have a chronic health condition, and we're representing three different perspectives and three different realities that when people think about disability, they think one size fits most, and no, I'd say you need more facets than a diamond in order to make things work for most people, and then you deal with a disconnected network. Technology for blind and deaf individuals, or low vision and deaf and hard of hearing people, there's not an interconnectivity from one device to another device. If you don't do everything completely right, you've then created an inaccessible document. So how do we, it's complex. And when somebody's disabled, there's the other part of it. Oh, you're just angry today. You're angry. It doesn't matter. You're angry. I'm not going to talk to you right now. And then you get this angry crip thing. And I said crip as in cripple, whatever, you get this angry thing, and they're like discounting you and diminishing you just solely because you're pissed about something. And technically 9 times out of 10, very, very justifiably pissed at somebody, because they've failed to provide access, and they likely have put your life in jeopardy as well in another way. So it's hard.
You know what? It's interesting you mentioned that, Michelle, because a hierarchy among disabled people, because there are more disabled people than people realize.
Yeah. Oh, yeah. The statistic for this session was like so not right.
Yeah.
Yeah.
Yeah. Okay. So here this, people. I want you to come to the camera. Come closer. Closer.
Oh, here it goes.
Closer. All right. You want to know something really interesting? If you're wearing glasses, you are disabled. Glasses are a visual prosthetic. Did you know that? So there are a lot more disabled people in this world than others. It's just having a slight visual impairment is looked at as more normal than anything. See somebody with a pair of glasses, you don't see anything different. You see them as a normal person. You don't see them as disabled. But guess what? They are, because they need that visual prosthetic in order to see. Now, if that person does not have their glasses, then you start to see how disabled they really are. And the thing is that, and look, there's a huge industry behind it. In fact, there's one company that owns like an umbrella company for all the other glasses. And then the person wears, and then they have in different fashion designs, and people say you look sophisticated. You're basically saying that because they have a disability and that they're using a prosthetic, they actually look sophisticated. So realize that you may be already in this community and you don't even know it. So guess what? This is one of the reasons why I also said to make sure you pay attention to this program, because it's deeply important. And this is one of the reasons why we're advocating for a single payer universal healthcare system, or greater, as in my case, what I would like to see is a national healthcare system. Because that means every single time you need new glasses, you need a new prescription, guess what? Who has to pony up the dough? You do. And then should your impairment of vision have a cost barrier for you to see? Is that right? Should your impairment orally be a barrier for you to get either dentures, partials, or implants, or get your teeth cleaned, or get a filling put in? Should there be a barrier? Should your condition, that gives you either bipolar disorder or schizophrenia or depression, should there be a cost barrier between you and getting that regulated for your mind. If your answer that no, there should not be a cost barrier, then guess what? This is one of the reasons why we should have the same exact system, well, not the same exact system, but we should have a similar system to all the other developed nations across the world. I think that it's the humane thing to do.
It is. Anything less is violence. That's the only way. It's the only term, violence. And if you guys have not seen it, any viewers, last night I shared an exclusive interview I did with Larry Sanders, Bernard's brother. He was the healthcare spokesperson for the UK Green Party. So we had a really amazing discussion about the NHS. And then afterwards, I showed a video Cavernacle, commentator from the UK, made for us about his experience with the NHS. So National Improved Medicare for All is here. And NHS is here. And we're going to have to keep fighting regardless. I mean, this will never be over. But at the same time, this needs to happen, period. Like now, not state by state, not incremental, not means tested, not all that stuff. Now, everybody in, nobody out, period. I also want to talk about Social Security disability. I recently went through it. Holy shit. Oh yeah. My God. That in itself was traumatic. So you become disabled, and the disability, the trauma of the disability is exacerbated by filling out 18,000 pages of paperwork. Written this big, mind you. I'm like, that's a kind of ableist in itself. And you are breaking up doctor bills, mortgage, everything in the meantime, because even though I had insurance the whole time, what does that matter if I have literally zero income? Because you can't have income when you're applying. It doesn't matter if it takes 5 years. You cannot have it. So I went through, it was 19 months. And blindness is supposed to be one of the things that's like, but they were fighting me on it. They were, and then after everything, after 19 months, I finally got approved. And they said, well, there's a rule that it doesn't start for 5 months after you're approved.
6 months.
What the hell does that mean? So then you wait even more bills, more everything. And then I didn't get any back pay. So that is not truthful when people say, well, you get that money back. I didn't get any back. Why? Because they tried to say that my blindness occurred the month that I got approved, not 2 years ago when it actually happened. And when my doctor stated it happened, when the medical documentation showed it happened, when my surgeries actually occurred, not then, when I was approved, was apparently when it started.
Wow.
So I got zero back pay. So all that money, bye-bye 401k, you don't know what to do. So you just do anything necessary. Thankfully, my husband works full time, but it was hard. I mean, 19 months. And plus, I'm one of those people, I need to work. I need to feel I'm contributing. My husband was like, it's okay, I'll take care. No, we have been 50-50 for 13 years. I need to be 50-50. I cannot do this. And it used to keep me up at night that I wasn't contributing. I'm just not that kind of person. I don't want to be like that. But you're in that position where you're like, I either stop applying and just take some kind of job that's not going to judge me for being blind, which good luck with that. Or I just keep trying to wait it out. And 19 months isn't actually as long as many people wait.
No.
You are put in this violent situation with, yeah, sorry, you have the trauma of going disabled, but yeah, you're also kind of going to have the trauma of having, tons of medical bills, even with insurance, and the fact that you have to keep fighting to even get disability. So I kind of wanted to get your takes on that, what you have experienced in that process.
Yeah. I was fortunate when I got disability in that I had people that directed me to the resources that I needed to be directed to help kind of expedite the process. And just to be clear, being on Social Security disability is different from having an identity of being disabled. Social Security disability is a social network program. It's a support. It's woefully inadequate. It's all this other things. Doesn't matter if I'm on disability or not. And this kind of goes back to what JB had said before too about, hey, people, listen, because we'll all experience disability at one point or another. And if you're not experiencing it, there's somebody in your network who is, But I helped my mom also apply for disability when she became disabled. And they told her she could still do her job. She was sick in bed. She had recurring shingles. She has lupus, Sjogren's, a whole bunch of other, autoimmune issues, psoriatic arthritis, whatever. And they said, oh, but you can still do your job. So you're not disabled. So then we had to push and push and push. But the thing about this too, the other thing is it took me years to realize it wasn't my fault that I panicked every time I got my damn forms to fill out to justify again that I was disabled to these people, even without working, without making what's called substantially gainful activity of employment, even without all of those things, it's those forms would throw me into a panic attack beyond, and I would just shut down. And there were a few times shut down to the extent that I had to check myself into a hospital, a mental health hospital, because I became suicidal and overwhelmed and, I needed the extra supports. But they're scary. And during the last president, there were initiatives that were getting put forward that were even more scary about mandating those forms again on an annual basis for certain people over others. And you can bet that these people weren't doing anything fraudulent, but they still needed their benefits, but the government wanted to knock them off the roll. And then what are we to do? Because for most of us, it's not like we're gaming the system. They don't give me enough to game the system on what they give me. So,
yeah, they don't.
Yeah. But, and it's the education level, the awareness level. Disabled people are not on the radar. It should be, everybody should be on the radar, but disability is still, most people on disability, even those with blind or low vision, they did not receive the same amount as people receiving the extra $600 a week in their unemployment checks for most of the pandemic. And let's remember that I'm not disabled by my body. I'm disabled by society and the structural barriers and the things that exist. So my disability is impacted by what everybody else does more than it is by my internal process, because I have some control over that, or I have some semblance of a understanding of that. But disability, the whole program needs to change. It's inadequate. It doesn't meet the needs. And then you also are gatekept. If you're not on disability, if you're not eligible for Medicaid, Medi-Cal in the state of California, you then either have like way huge spend downs on your share of cost and or spend downs, but you're not eligible for in-home services. So the never-ending struggle, especially within the Medicare for All movement, has been to make sure disabled people are in the room, to make sure disabled people are informing the policies. I think it was Bernie that finally started to add some of the home and community-based services to that. Everybody benefits from home and community-based services. We need to get over this thing of it's only disabled people that benefit from this,
Yeah, this whole thing, it's clear that when the ADA not the ADA, but when disability benefits were created, were there any disabled people actually in the room when it came to the processes of getting these things done? I don't really think they were. I made a tweet of, what was it, over a week ago? Yeah, it was a little over 2 weeks ago. And I asked this question on Twitter, and I'm gonna read it right here. I said, question, why are people who receive disability benefits not automatically enrolled in Section 8?
Thank you. Easy solution.
That's a question that I'm asking. I ask people. Look, I got almost 1,000 likes just from this one. And the crazy part is, it's like, okay, so when it comes to what a true living income is, you don't give it to us on disability. I get the equivalent of what would equal to $7.50 an hour per month. That's it. Yeah, that's it. If you take what you get on disability and then you divide it by 160, which is 40 hours a week, four times a month is 160 hours, and that'll give you how much you get. With that being said, I know what it's like to lose your disability because you're trying to supplement your income. And I lost my disability back in 2019 because I tried to get a job. I had a job and I tried to supplement my income because it just wasn't enough. And come to find out, because I didn't know this, that if you make 1 penny above the approved amount that you're supposed to earn, then they take your entire disability away completely. It's not prorated. It's not anything like that. It is your entire thing away. And so guess what? Your entire means of survival, your primary source of income, gone. And so I panicked. I had to create a GoFundMe just so that I can help make the rent, right? Because my mom, she's also receiving just Social Security, and myself, and that's it. We don't have enough to live on our own. And so I had to do that. And to this day, I still have a GoFundMe just to help out with, daily expenses, just so that I can survive. Because Social Security disability is wholly, when we say wholly inadequate, we're meaning that even if it was the equivalent of $15 an hour we get a month, that would be a huge boom to us. It's not even half of that for some of us. We are literally living in poverty. And some of us, we try to work and then, we can only do so much. Or some of us, we can't work, or it's very difficult for us to work because we have a time sensitivity or an energy sensitivity. So it makes it even more difficult for us. And people say, oh, well, you get free money from the government. It's not free, because if you pay taxes, it's not free. And one more thing. When it comes to the disability benefits that we get, because they're wholly inadequate, here's the thing that I hate. Did you know that the people that you're only taxed on Social Security tax income up to I think it's $143,000 of your income. So if you make more than $143,000, the rest of that income from that does not get taxed for Social Security disability. Now, we do know about MMT and that they can just, pay for it. We all know that. But there's an unfairness in the system when, if you have somebody who's a billionaire, they have all this huge, copious amounts of money, and they don't get taxed on helping people who are disabled. So it's just,
Congress makes more than that. Coincidence?
Yeah. So only on the first 143,000 do they get that Social Security tax.
There's been an added complication, though, in the last few years for some people that receive disability, which is what their Medicare premium actually is. And
Yeah, I
then
have to
there's,
deal with that.
yeah, so it's like I have one friend that her Medicare premium, because her partner is still working, literally guts like a third of her disability check every month. So it's
Yeah.
just so high and so inadequate in so many ways. I have another person that went $20 over the income levels for qualifying for Medicaid, and they made her spend down $900 a month for being $20 over qualifying. She was supposed to pay $900 each and every month before the insurance would kick in.
See, that's where I used to work for medical assistants, and that's where I legit used to tell people, call out for a day before they apply, because they would get turned down for like $5 over, and I'd be like, yo, take a sick day, legit. And I may have gotten let go because I got caught saying stuff like that a few times, but oh well. You know, it's truly incredible. So, you know, we just addressed some of the misconceptions people have. When you're in Social Security disability, no, you do not get free healthcare. No, you do not get free services. No, you do not get any kind of stipend for any services you need, which is, you know, even, you know, transportation or anything you need. You are absolutely still responsible for all of that. And also, like JB said, if you, it's not that people on disability don't try to work. A lot of, look, I've been trying to get a job for 2 years. I've been trying. Nobody wants my ass. Like, I can't even do retail because I can't see the keyboard. Like, I'm trying, but in my state, they don't have to give you accessibility for blindness. In, you know, I was working in healthcare in an office setting. They don't have to help me. That's how I legally lost my last job, because of my blindness. And I was a contractor. They were completely allowed to just, sorry, you no longer are up to our standards of words per minute and XYZ. But I sat there for 3 months like this, holding the keyboard up, trying everything, you know, to keep working. And then when I heard someone walking, I'd be like, and just try and hide it, because I knew I would get fired. And that is legal in so many more states than people realize, especially with contractors, temps, things like that. There are, you know, nothing is in place to help people. That, is it discrimination? Of course it is. But is it illegal? No.
And that goes back to the burden being placed on disabled people to police when these things happen. You know, the fix for the civil rights suit that I filed with the government, with the US government, actually the fix to that was literally the location had to open that zone up again. They had another fix that they could have done that would have ensured accessibility to the site for the rest of time, but instead they shut everything down. They moved the testing site someplace else to open up that pathway again without having to fix anything. They didn't have to change anything. They even had a sign that said, if this is not a disabled access, you have to turn around and go back. But none of the staff in that building knew how disabled people were, you know, wheelchair users would enter the building. So these are ongoing struggles that the system is so set up against us. It's hard. And we're seen as the burden when it's like, literally, if I didn't have to prove that you just discriminated against me, I could have this job that I'm more than qualified for, but you don't want me around because your office is packed too full and my wheelchair wouldn't easily maneuver. And I mean, where I work now, I've created a space, but yet like yesterday, I broke my copy machine. So I spun around and I hit the copy machine and I kind of shattered part of the front cover. It's cosmetic, but it's still, I do that. Because society's not built in a way, even when it is more structured in a way that will meet my needs, it still is hard. And there still are these realities of things that happen. And the discrimination part is spot on, because you have to prove it. It doesn't matter that it happened. What matters is if you can prove it.
Mm-hmm. And just another point I wanted to tell, and this isn't necessarily going after any particular politician, but this is something that I want anybody who is listening to this to keep in mind. In 2020, Bernie Sanders had a disability bill that would increase the amount that people on disability got, and it worked out to about $200 more per year. $200 does not help us that much per year on disability. If you truly want to give disabled people a better life, you would make it at least equivalent to that of a living wage. Because there are a lot of us who, look, all right, real talk, I'm 37, almost 38 years old, and my mother lives with me. I love my mama. But at 37, 38 years old, I would like to have my own spot. Now, either give me a subsidy so that I can be able to have my own place, like Section 8, or raise the benefit rate of Social Security disability. One of the two. Because, and then I don't want to hear people say, oh, well, it's just too expensive because we can't do it. No. You guys got enough money for those wars. You guys just approved billions of dollars to send to Ukraine, but yet you can't approve the money for us to have, a living income on Social Security disability. So no, I don't buy it. We actually do have enough money in this, and I didn't even get to the $4 trillion that was spent during the beginning of the pandemic to prop up the stock market. But I digress. But still, like, if you're trying to make life better for those of us disabled, please go well beyond that $200 per year, because it definitely wasn't enough. And yeah, Bernie was somebody who did it, $200 per year. And there's many other politicians who are saying that, oh, we'll raise Social Security disability benefit. It's not enough.
I want to
didn't know that. I'm gonna have to look into that. I had no idea about that bill.
Yeah.
I want to also state one other thing, and part of this is tagged on to listening both of you talk too. The system is working the way it's designed to work, because the US is based on eugenics for disabled people in typical. In general, when you're disabled, you're so othered and so far on that trajectory that there's so much eugenics, racism, and capitalism are baked into our systems. So the system works exactly how it's supposed to work.
That's true.
And that is to kill me, because I am not valued as a disabled person.
Mm-hmm.
And trust me, there's good reasons for people to value me. There's some that they probably want to push me aside and make me go away. But, it's important that every person in the United States is valued as the person that they are, and the systems need to change. And it's going to be a hard and tumultuous process to changing those systems. I've been able to witness it somewhat here in my county through, getting a disability equity and inclusion pledge adopted. But because disability rights is not disability equity. And we, as disabled people, we also have to realize that. What do we need for equity? And equity is important. How many DEI, diversity, equity, inclusion, and my cat was kind of trying to use my leg there. Diversity, equity, inclusion things fail to include disability. You know, and it's hard every time those doors are shut, every time it's slammed in my face that it's okay that you're disabled as long as you stay in that corner and you eat the food pantry food and you deal with whatever it is that you're given and be thankful for that. Thank us for that ADA accessible toilet that we made in 2020 that you didn't have before then, you know? And these things are the things that everybody needs to stop and realize that the system that they love, the system that they see so much value in, is killing me. It's killing disabled people. It's killing the autistic person next to me. It's killing you, especially an adult onset autism. They can't get the services funded that they need because it's not thought about.
Yep.
So
True.
all of these variables, the system works exactly how it is. You start looking into the history of eugenics in the United States. Germany based their program off the US's eugenics policies.
Yep.
So if you're ever talking with a disabled person, listen and stop thinking with what you know. Think with your heart, see with your eyes, hear with your ears, and just realize together we're going to do more than what we can apart. And I have solutions that, and Joy, you have solutions, and JB, you have solutions that we learned the hard way because we needed to be different. We needed to take something that was inadequate and make it enough.
Yeah.
And so we have to do this work. And the statistic for disability, the most recent one that I've seen through the pandemic is 1 in 3 people.
Yes. Yep.
30%, more than 30% of the US population is impacted by a disabling condition and or disabling medical issues that, you know, that is leaving them behind, making them have to work doubly hard.
Yeah.
So
Absolutely.
we just have to come together.
And, you know, not that I want to end it on like, you know, doom and gloom or whatever you say, but I think, you know, and trigger warning to those watching, I just did a panel on mental health before this. And I want to talk about, you know, the struggle that we go through emotionally, be it coping with becoming disabled, be it being treated differently, be it not being able to afford what we need, anything like that. I want people to really understand psychologically what, you know, what impacts us. We can do the other way now, JB.
Oh Lord, you going on ahead with me? Oh Lord. Okay. All right. I was hoping you were gonna do ladies first again, but oh Lord. What did I tell you about patriarchy? Okay, no, I'm just kidding. You know I love messing with you, Joy. No. Gosh. All right, I'm gonna tell a little personal story. When I first got on dialysis and they took me up to the hospital, I was sitting in the hospital room and I was in tears. And I was saying, why me? I think it was later that week or later that evening, a bunch of friends called me on a group call. And they were all just telling me how much they love me. I was in the hospital for 12 days when I first got on dialysis back in 2007. And it was constantly a reminder because I used to be very religious and I used to go to church all the time. And one of the things that everybody would ask me, they would be like, hey, how are you feeling? And that used to piss me off. How are you feeling? And I'm like, I just had my blood circulated over 20 times in 4 hours. How in the hell do you think I feel? I wanted to say that. I wanted to be mean. I wanted to lash out. Like, how the hell do you think I feel? You see me barely being able to function coming here. But I couldn't do that because that's just not in me to do. And so I would say I'm fine. But then to my closer friends, I would vent about it. And you get to a point where you feel less than, because society also kind of treats you that way, and you feel like you don't really matter that much, because now, because of the energy, barrier, as well as the time barrier, people don't see you as often, so it's kind of more of an out of sight, out of mind type thing. So they don't see JB as much anymore. So therefore, they don't think of him as much anymore. Or if they're having a little gathering or a party or something like that, they don't invite JB over because they forget about you. And so that affects you even more. And so it's tough because you want people to know about your limitations, but you don't want those limitations to cut you off from society. And that's what I've still been dealing with down to this day. I just learned how to maneuver through it a little bit better and to accept those limitations and make sure those are, vocalized as much as possible. But it's still tough,
Absolutely. We all have our days, that's for damn sure.
Yeah.
Michelle.
Yeah. I think there's a process when you become disabled that you kind of deal with your internalized shame, and you have to go through a grieving process. Like, what did I do wrong? How did I do this wrong? If I only did this, then you go into bargaining, and then you go into, whatever else.
Yeah.
Unfortunately, especially with more progressive disabilities, it's an onion. You peel one layer off just to reach another layer. That layer comes off, another layer is miraculously there, and suddenly your onion blew up to 7 onions, as you juggle more, or just as you navigate a world that's not made for us. And then you reach the point that you realize, for myself, I reached the point that I realized my internalized ableism was what was killing me more than what society was at that point. It shifted my point of reference. It shifted the realities. I learned so much from other disabled people that is beautiful in what they do and how they do it, and it's like, how dare you say this person isn't enough? How dare capitalism and racism and ableism and sexism say and determine the inherent value that should be there from birth, no matter what somebody does. Human rights are human rights for a reason. Capitalism says it's okay to circumvent that and to modify it and to make it less than because you don't produce enough for this owner right now.
Yeah.
But yet, like Joy, what you produce through your podcast is amazing, beautiful, and powerful. JB, very much the same. What I do in the community and what I've been able to do I feel very grateful for what I've been able to accomplish. But there's a lot of work behind it too, just because grief, loss, hardship upon hardship upon hardship. And then you get to the self-reflective type point that's like, oh, it's not too much to ask that they have captions on in an event. It's not too much to ask that I get this material ahead of time. Of course, you then still have to frame it hey, yo, people, this is an ADA request, which means you can't say no to me. And that's the weird thing, is they don't want to. How I frame things now is almost like a casual, yeah, I need captions on, make sure they're enabled, and then I have to follow back again and go, oh yeah, and that was an ADA request, because initially they wanted to decline me that service. We live in a space where we go into a leadership space and they don't have accommodations available because leaders aren't disabled people. I don't see myself reflected in certain leaderships. I don't see myself reflected in a lot of things. So there's a whole lot to this. It's a good question though, Joy. We could do a whole podcast, I think, on just this question.
I'm telling you.
I'm thinking about doing one on being disabled and dating too.
Yeah.
We can do that too.
We seriously keep talking about this. I feel like these panels are an hour and a half, and it's like, like it sounds like, 90 minutes, but it's like, 90 minutes. So I want both of you to give any last brief thoughts of what you want the audience to take away, and also Twitter's, emails, websites, or anything, how people could reach you if they want to reach you for props or advice or any of those fun things.
Ooh, ladies first. Ladies first.
You're not going to be a lady today, baby.
Only on Thursday afternoons during tea time.
Yeah, exactly. For me, the best way to reach me is via Twitter, which is on my name on here, which is @ShellPfeffer. It's a weird name. There's a long story behind it, but I don't need to go there. I do have a GoFundMe link that's pinned at the top of my profile, and there's some good details about what it is and the reasons why I'm doing it. I think I'm going to be involved in the third party panels next weekend with CJ on the Revolutionary. I think that's Revolutionary. RBN is doing that. Yeah. I think I'll be on one of those as well. I'm an infrequent guest because my life is overwhelming and I can't figure out how to do a regular podcast because my brain thinks too much. And it is a lot of work. It's not as easy as what some people seem to think. It's not just throwing a video together and doing it. It takes a lot of work behind the scenes. And the other thing, huge shout out to the group that put this together, every piece of it. It's been impressive. I've received some amazing feedback as well from my community members on the different sections being, very informative and important. So huge thanks to you guys for what you're doing.
Thank you. JB? Oh, and before I go to JB, who is this gorgeous creature?
This is my Miss Kitty.
Cutie pie.
Kitty. She's my 15-year-old cat. So
she's beautiful.
She acts like a dog. So yeah.
JB,
Nice.
You said ladies first. Ladies first. So
definitely.
What do you want people to take away from this, and where can people find you in case they didn't know?
Okay. Look, one of the things I want you guys to take away from this is that we are human beings. We have the exact same inherent value that you do, and therefore we want to be seen just as much as you do. So please give us that respect as well. Not just in emotionally and mentally, but also when it comes to our material needs as well. You guys can find me at JB Font on Twitter. You guys can also find me by the same name, JB Font, on my channel on YouTube and also on Revolutionary Blackout Network on YouTube as well. What was I going to say? Oh, and by the way, here's another thing I want people to recognize. Those of you who are in states where marijuana is still either partially illegal or completely illegal, the people who probably might need medical marijuana, it costs a lot of money just to be able to get that through. So if people recognize that, those of us who are disabled, we can't get it like we need it. Yeah, I think that's something to also look into. If you guys, know somebody who's trying to get it, but they just can't afford it, try to, throw them over a couple bones and make sure they can get it so they can be able to help themselves to be able to cope with life or deal with the ailments that they may have. So just to put that down there. Also, just to let you guys know, I also have my Cash App link to my pin to my page. So just to let you guys know that. but yeah, if thank you so much to everybody for having us on. Thank you to the March for Medicare for All crew. Thank you to you, Joy. You've always been such a brilliant and masterful orator, and allowing us to be able to share the space with you so that we are able to vocalize our needs and so that people can recognize our humanity. And so I think one thing you always be remembered for was she was loud and she let people know. And I think I appreciate about you so much.
Oh my gosh. Much love to both of you. I cannot thank you enough.
Thank
You
you.
are both inspiring, incredible, and I just adore you both. So thank you so, so much.
Thank you so much.
Thank you, everybody.
So stick around. We have more. We have another panel, and if you've gotten sick of me today, I'm sorry. I'm not going anywhere yet. I'm kind of a groupie this weekend, I guess. I don't know. Yeah, groupie. An M for all groupie. I'll take it. So oh my gosh, what an awesome day so far. I'm so excited. So before I bring the next panel on, I definitely want to remind everyone that m4all.org, we do have a $20 raffle going on for each $20 donation, meaning like $40 is 2 entries. For each $20, you get a raffle ticket. Shipping is included to get this basket, which is a little over $150. We need donations, and not just for this, but we have events we're planning, and this shit ain't cheap. And we know because a lot of us still have debt on our credit cards, our personal credit cards from last July. So any help you guys can give, it means everything to us. And it, unfortunately, in this capitalist society, we do need donations to do substantial activism. We do. It just, there's travel expenses, there's sound equipment, there's porta pot rentals. I mean, there is so much that goes into planning events, and unfortunately it's something I hope changes, but right now unfortunately we do need those donations really bad to keep doing what we need to be doing. So again, thank you so much to everyone watching. Now we are going to bring in our panelists for this panel is going to be about healthcare workers, and our stories working on the end of the actual workers. Logan.
Hello,
Hey,
hello. How you doing?
I am good. What do you think so far?
I mean, you've been killing it all day. I expected nothing less, so just gonna keep the train running.
So for those of you who don't know, this is Logan. We do a show together with our comrade Andrew every Monday night, post-mortem breakdown, on my Rockfin, 9:30 p.m. Eastern. And we just bounce off each other. We have such a great time together.
Me too. Despite the fact that we talk about a lot of
get out there.
Oh yes. Well, we won't talk too much about that. Yes.
So Andy, if you want to bring the other two panelists in, and we can get going.
All right.
All right. Can you both hear us?
I hear you. Can you hear me?
Yes.
Good.
I
'Cause
can hear everyone.
I'm in New Zealand.
Awesome. Lucky.
But I do live in the US usually.
Okay.
All right, Logan, take it away.
Okay, so I am going to do very little talking and a whole lot of listening and learning, but I just wanted to briefly say why I'm here and why I am excited to help host this. To me, when you think about capitalism and the system, we don't think about the fact that capitalism is inherently ableist. And one of the things that we are supposedly guaranteed in this system is, life, liberty, and the pursuit of happiness. But if you don't have health or a guarantee to health, then how do you have any of that, right? If you have to be careful because you're afraid of any little thing happening to you, how are you free? How is that liberty? How are you able to be happy? How are you able to pursue any of the things that are going to bring you joy in this world if your health isn't taken care of? And that's one of the reasons that I even push back against the use of the word worker when we talk about what we have to do to protect the people, because I don't want to capitulate to the idea that what any of us is able to provide in terms of work, in terms of what we can do, is what makes us valuable. We are all inherently valuable and all inherently worthy of protection. And the last thing I will say is, no matter who you are, the state of being able-bodied is inherently temporary, like life itself. Because whether we're talking about just age or accidents or anything, right? Anything can happen. And eventually, because of time, because of the way things work, your ability to continue going, especially as it is defined by capitalism, is going to wane. So whether or not you think that it is pressing for you now, it is pressing for you. And look, we can't get you to care about other people, but what we can ask you to do is understand that the better everyone around you is doing, the better you'll be doing as well. And that is, to me, why Medicare for all, single payer system, nationwide, worldwide would be great, but let's start with nationwide, is absolutely vital. So I want each of our panelists to tell us what they do and how where they come from in terms of being healthcare providers or working in the system, and the ways that you think you can tell us about why it's necessary that we have a single payer system. And whoever wants to start can hop right in.
Okay, I will certainly start. My name is Dr. Cheryl Kunis. I am a nephrologist as well as a bioethicist. And it's interesting, Logan, that you talk about if you don't have your health, what is there? One of the things that we really talk about in bioethics is that the government provides us with certain securities, such as a fire department, such as a police department, such as rules on the road that when it's a red light, we're supposed to stop, that we should wear a seatbelt to protect ourselves, and so forth. But one of the things that we really talk about is that healthcare is in itself a very sacred and different form of security that our government should provide us with. Although they should provide us with many things, healthcare is in its own right special and different. And under those circumstances, it is a human right, and it should be available to all of us, especially in the wealthiest nation in the world. And I find it very interesting the way health insurance developed in this country and the way it developed in Europe, New Zealand, and Australia, and all of the very wealthy nations. It developed very differently and for different reasons. So, for example, when health insurance began in 1929 in the US, we were in the middle of a depression. And hospitals were suddenly developing and people were going into them, and nobody really knew how we were going to pay for it. Needless to say, it didn't cost what it costs now, but it was still something where the people working there had to be paid and the hospital needed resources. And a very interesting person in Texas had a great idea. He said, look, so many people are out of work. We are in the midst of a depression, but one group of people who always have a job at this time are teachers. So what we're going to do is we're going to ask all the teachers in, I don't know if it was Houston, Dallas, one of the cities in Texas, to donate a very small portion of their paycheck every week to a fund, and that fund will be used to pay for health care in the hospital. And most of them all did it. And that's why the hospitals became solvent at that time. They had a social consciousness that they realized this was important, number one. Number two, they were given a bonus to do it. They were told, should you ever need health care or hospitalization, it will be free for you if you make that 50-cent donation every week to our hospital fund. So this was the beginning of employer-sponsored health insurance. It was a great thing in 1929. It is not a great thing in 2022 because so many people work and their companies with the cost of healthcare just can't afford it. Now, the ACA was passed so that these people would be able to do it. But we all know, what is the ACA? It is a form of private health insurance, which is still very costly, very inefficient, and actually very unfair to the people who are paying for it. And I can give you so many stories about it. But what I can say is the expansion of Medicaid in the ACA has been shown to be effective. So I can applaud President Obama for that part of the ACA. Believe me, if President Obama had his way, we would have universal health care. President Obama, I truly believe, would have wanted it. But of course, he knew he was fighting a very difficult group of people to get anything passed. So right now, we are so worried about what's happening with the private health insurance industry. And most importantly, something which a lot of people don't know about, but that we in PNHP are really trying to make clear. And I'm giving a lot of lectures on it and speaking to church groups and senior citizen centers now. And that is that the government is now trying to privatize all of Medicare so that a private insurance company wants to take over the Medicare system, the traditional Medicare system, such that they are going to make huge profits out of our taxpayer money. I won't go into that now because I don't think we have time to, but this is my take on where we are right now. I also think that, and I was very taken by the Friday night lecture by the woman from Canada who talked about the healthcare system there and how they're doing it state by state. But it sounded to me that she really did think a federal system was the way to go. I think a federal system in many ways would be very easier, much easier, but I'm willing to fight for anything because one of the ways that I'm fighting with the PNHP chapter in New York for a New York State universal healthcare system is because this is education, this is advertising, this is letting the people in New York and the rest of the country know that we believe this is a system that's necessary, whether it's on a state or a federal level. And
so
I will end
actually
there.
have to push back on a couple of those things. Obama does not care. He did not pass universal health care. He had every chance to do it. He promised it. He did nothing. Just like Biden could do it right now with 1881A, an executive order. Obama lost over 1,000 seats while he was president. He had the House. He had, Senate. He had the White House. He could have done it. I will make no excuses or rationalization for any politician who has caused violence to people who cannot afford health care, who literally are dying because of our violent system right now. And he absolutely could have done something about it and chose not to. As far as state by state, incrementalist, no way. That is completely means testing, inherently sexist, ableist, racist. It needs to be everybody in, nobody out. Period. No caveats, no nothing. And that's what these entire 3 days are about. National. No, no settling for here and there. Well, maybe we'll do it first. Nope. National. We're asking for it all. Period.
Just two things. Just to back up Joy, we're seeing a whole lot of things going on state by state right now that we couldn't possibly trust most of the states, especially. I mean, we're not going to go in too far into it, but state by state seems very dangerous, especially right now. And also, I just wanted you, Dr. Kunis, to tell everyone what a nephrologist is. I remember I had to ask you because I did not know. And also tell us what PNHP is, just so we have a little bit more of an idea of your background.
Okay, a nephrologist is an internal medicine physician who deals specifically with people with kidney disease, such as the patient who, actually James, who was just on the show before us, he is on dialysis. So when patients' kidneys don't function and they need dialysis or kidney transplant, nephrologists take care of them as the internal medicine physician. We take care of many, many patients with diabetes because they spill protein in their urine, and eventually many of them go on to kidney failure. So that's what a nephrologist is. I'm going to be telling you some stories during the period of time as to some of the things that we do and some of the ways I feel about the system. And PNHP is the Physicians for National Health Program, which is a national organization with many local branches. And we believe that healthcare is a human right, and we believe in a single payer healthcare system. Now, many PNHP chapters across the country only believe in a federal system. Others believe in a state system. Honestly, I am a federal person, but my chapter is working for a state program. And as I said, even if a state program isn't viable, I still believe that talking about it and educating people and bringing it out to the public, just like all of the results of the California situation where single payer died there. We just want to get it all out because, as you know, it is a movement and we need to educate people just like we're doing this weekend.
So we do have a panel on why, on the dangers of state by state tomorrow. I definitely want people to tune in. There are many, many, many problems with that, with even giving that air, essentially. And that's why we're having this 3 days forum. It is national. And the only way we're talking about state tomorrow is to show all of the flaws, be it 24 states don't even have ballot initiatives, be it CalCare was not single payer. And people like to say, oh, Medicare for all failed. It was not Medicare for all, things like that. So I think we have to be really clear that this panel is 100% to promote national.
I feel very strongly about that. And the experience that I'm familiar with is when they tried to get dialysis and transplant done on a state level, and they tried for 15 or 20 years. It just wasn't going to work. And in fact, when they had one state, which was the state of Washington, that was able to open its first dialysis unit in 1960 and dialyze patients, people from all over the country wanted to get on those 4 machines that they had. How do you have 4 machines and 50 states? And so what they did, which, was a rationing system, they had no choice, was to say, we're only going to take people from the state of Washington. One of the reasons was they had to figure out how they were going to only be able to dialyze people with 4 machines. And the state of Washington had given some money for it. But it was really tragic that in this country, you had to live in the state of Washington and you had to be chosen to have your life saved. And it was picked up in the news, and there was a huge article in Life magazine at that time that said, who decides who can live or die? And that this was such an unethical way of doing it. I mean, that's just one example. But what ended up happening is eventually the dialysis transplant situation was passed by Richard Nixon in a bill that he wasn't even aware of, that they snuck in. And that's how we got it on a national level. And what you say about Obama, it's not that I'm disagreeing. Politicians are always going to be politicians. And we know we can't trust them. And we know that Biden, the insurance industry, was one of the biggest supporters and put the most amount of money into the Biden campaign. And so he's not going to get rid of the insurance industry that we so desperately want to get rid of, because healthcare should not be based on profit making by these insurance companies. This is taxpayer money going to Wall Street and private insurance companies. And we're not talking about small amounts. In the new bill in Washington that's trying to privatize Medicare, 40% of the money from taxpayers is going to go to private insurance companies and Wall Street investment banking firms. This is criminal.
Absolutely. Well, so that was a great conversation, and the clarification and all of that. Love to see it. Can we bring in Elizabeth and get you to introduce yourself and tell us a little bit about you and your involvement in the healthcare system, et cetera, et cetera?
Yes, absolutely. So my name is Elizabeth Meyer, and I have been a registered dental assistant for the last decade. I've worked in nonprofit, corporate dental, and private practice, both in front office and back office. I'm very grateful that most of my experience is working in low-income communities, helping those in their most crucial time of need, regardless of their ethnicity, legal status, or household income. As the dental van coordinator with the nonprofit, I maintained and operated a 31-foot RV that was renovated into a 2-chair mobile dental clinic, being utilized for countless community events, such as Dentistry from the Heart, Project Homeless, Homeless Veterans Stand Down, Children and Adult Dental Health Days, along with many others. As a volunteer in my community, I have also been the triage team lead and an overall dental team lead for Compassion Vancouver Heights in years past. And all of these clinics consist of providing completely free, at the point of service, cleanings, fillings, extractions.
Well, looks like we have lost Elizabeth.
But
Okay.
also, before she comes back, I just want to say she is one of the reasons this is happening this weekend. She works 24/7. She is hardcore for this organization, and we could not do this without her. Yeah, I'm talking about you, and I hope you heard me too.
I don't know why StreamYard keeps giving me the boot, but I'm so sorry.
Quite all right.
So I am now currently a national organizer with the March Medicare for All, and I really do want to thank my teammates on the National Steering Committee, Savage Joy, and the tech team behind the scenes for encouraging me to participate this evening, because I am incredibly nervous to be here, but I am very thankful that you have me here tonight.
It's cute that you said encourage when we really forced you to.
Yeah, I wanted to put it lightly.
And I totally forgot to say why I'm on this panel. I before I became blind, I worked in healthcare for over 10 years. Medicare, pre-authorization, CHIP, medical assistance, grievances and appeals, pretty much everything on the administrative call center insurance thing side.
Okay, so that gives us kind of a state of the case for each of you. So if you could maybe each give us a little bit of an idea of how, the past couple years have increased your basically your vociferousness and your like larger understanding of how much we need to get to a Medicare for all single payer system. What particularly over the pandemic has stuck out to you, or any stories you want to tell us, or anything like that just would kind of give us a little bit of more of an understanding of the urgency as you see it.
I'm going to start out with a story because Elizabeth very much wants me to do this story. And then I'm sure I could probably talk for 6 more hours about other stories and other things that I feel about the pandemic. But I think that this story will give you a good idea of where I'm coming from and why I changed course in terms of my medical career. You'll understand it better. So basically in medicine, it's customary to open a discussion by presenting a case at the hospital, and I would like to tell you about my patient, Mr. Rodriguez, a 36-year-old gentleman whom I was treating for high blood pressure in the nephrology clinic at Columbia University Medical Center. His PSA was rising, that's his prostate antigen, and it was rising rapidly. So I referred him to the urology clinic. And the first available appointment was in 9 months, and it took several years to complete his workup. But if he had been able to see a private urologist in the office, his workup would have been completed in less than 4 weeks. But no private urologist at the hospital, at the huge, impressive medical center, would see Mr. Rodriguez because his health insurance was Medicaid, insurance for the poor, which pays doctors poorly. And that's no pun intended. Since Mr. Rodriguez's active medical problem was now prostate cancer, because I had controlled his blood pressure very effectively, I had not seen him in the hypertension clinic for several years. And while I was attending on the inpatient renal consult service at Columbia, I was called to see a new patient with acute kidney failure due to kidney obstruction. I walked into the room, and there was my Mr. Rodriguez, pale, tremulous, and gravely ill. As he and I reconnected, I will never forget the expression on his face. It was so painful to see him try so hard to smile, which he did, acknowledging my presence, recalling the warm, trusting relationship that we had had for several years. And I thought that maybe I had reappeared and that this time I would be more successful in providing him with what he really needed. But what I really saw in his smile was the fear, the pain, and the anguish of impending death. 9 days later, at the age of 39, Mr. Rodriguez died from complications due to prostate cancer. He died because he was poor. He died because his health insurance prevented him from being treated in a timely manner. And he died because the American healthcare system treats patients differently depending on their insurance, their race, their ethnicity, and their socioeconomic status. This is injustice at the most basic level, the most primitive level, at the level of just plain and simple survival. Access to health care is a moral issue. It should never be an economic one. And this is why I support universal single payer health care, so that we can give everyone in the world, not just in this country, the chance to live a decent life. Various life experiences often precede one's commitment to fight for healthcare justice. And I came to work with PNHP for healthcare justice for several reasons. One, because of patients like Mr. Rodriguez. There are many of them. Others have had personal tragedies, nightmarish experiences where in illness, life-threatening or not, resulted in bankruptcy or death. But I personally also came to support healthcare justice for another salient reason. Over the past 30 years that I've been practicing medicine, I have witnessed the rise of the medical industrial complex. I have become disillusioned. I went into medicine because it was an art as well as a science. In the early 1500s, Philippus Paracelsus, a physician and philosopher of the German Renaissance, said that medicine is an art because the character of the physician may act more powerfully upon the patient than the drugs that are employed. I have witnessed the erosion of this sacred doctor-patient relationship by the medical industrial complex. I was tired of being told repeatedly, Dr. Kunis, you're a great physician, but you have to bring in more money for us. If my purpose was to make money, I would have gotten an MBA, not an MD. In fact, I did take one course at the Wharton School as an undergraduate, the business school. It was one of the most highly regarded courses at the University of Pennsylvania. The professor was world-renowned, a great lecturer. Everyone loved the course, not me. With all due respect to classics majors, it was Greek to me. And interestingly, medical schools used to choose their department chairman because they were great scientists, great clinicians, great physicians. But now they have to be great business people. If medicine is an art, the medical industrial complex has shattered it. I believe the for-profit business model has no place in medicine. It belongs on Wall Street, and I don't even want it there. I recall a poll where people were asked, what is the quality that you believe is most important in identifying you as an American? The answer was fairness and equal opportunity. But this, my friend, does not exist in the American healthcare system. So I ask every one of you who is here with us today to think about all those people, over 1 million just in this country, 1 in every 300 people who died from COVID-19 or just didn't get treatment for any other illness because going to a doctor or a hospital was just too damn expensive. So despite all the injustices that exist in this world today, that many of us experience daily, I believe that healthcare injustice is the greatest injustice of all, and one that could easily be remedied in the wealthiest country in the world. Thank you.
That was excellent. Really powerful. It really summed it all up. And well spoken. Wow.
And there are other things that Elizabeth and Anna Malinow wanted me to discuss, but let's hear from Elizabeth because I don't want to take up all the time when we have so many great people who have so much to offer.
No worries. I mean, I don't have a specific story for a patient because I've seen with all of these different dental clinics that I've done throughout the years, so many people in need. And I've personally been supportive of single payer since 2003 when Representative John Conyers started introducing the legislation into Congress. And that was right about the time that I was actually graduating high school. So I was entering, the workforce as an adult. And, I really just didn't realize until after I went off of my parents' insurance how things were.
Okay, more technical difficulties. Do you want to hop in quickly, Joy, while we wait for her to return?
Yeah. So there's a bunch of stories that stick out, unfortunately. But in Pennsylvania,
Here we have.
Continue.
Yeah, I'm sorry. I don't know why StreamYard is kicking me out every time I start talking. I apologize.
No need to apologize.
So I just started, personally experiencing the issues with our healthcare system. And then being a volunteer in the community opened my eyes to the actual, inequities that everyone experiences. It's absolutely ridiculous, the system that we have. And, Bernie ran in 2015, 2016, and that really sparked the fire within me. And I was already in the dental field at that time. So, it's not just these past 2 years. It's made that glaringly obvious to a lot of people that we need a better system in place. But I've been angry about this system for quite some time because I've seen the people that are hurt by it and the people who are left behind by it and left out by it. Yeah. And, cost is the number one reason why Americans don't get regular dental.
You win again. It's okay. Live things. These things are going to happen. It's quite all right. So, Joy, you want to continue until she comes back?
The second I start talking, she's gonna come back.
I'm sure.
There you
go. Magic.
I don't know if I should keep speaking or not because
no,
it's going to keep kicking me out.
As many times as you get kicked out as many times as we will welcome you back, and we are happy to wait for you. So
we, cost is the number one reason why Americans don't get regular dental care, and 1 in 3 Americans lack dental coverage. But let's be honest with ourselves. Dental care is an afterthought in this country, and I personally know too many people who delay treatment due to cost. And I know that everyone on this panel and everyone who's listening knows somebody who has delayed dental treatment because of the cost. Having a root canal done to save a tooth, getting a crown put on a broken tooth so you can chew on that side. Getting a denture. We've done at clinics full mouth extractions for patients who are recovering that were previously addicted to methamphetamines and have something called meth mouth. We would extract all of their teeth, do impressions, and give them immediate dentures. And it changes their entire life. People who wouldn't open their mouth to talk to you, cover their mouth when they smile or they laugh, it changes who they are entirely. And I know people who have relatives who have passed away because of dental infections that continue to re-abscess.
Oh yeah.
And to think I'm in New Zealand and I have no problem with
I know, right? There's no accounting for the tech in these situations.
You're back, Elizabeth.
Yeah.
Oh my goodness.
Just keep going. Yeah.
It's a major issue in this country. And like I said, it's an afterthought for dental. I used to support the state-by-state efforts here in Washington State specifically, but I had, like a come to God moment where I realized that all of my family that live in Oregon or across the country, they're not going to be able to have the same access. And that is just morally wrong. I'm not okay with that. I believe in healthcare without borders. And when I say healthcare, I mean improved, comprehensive coverage for medical, dental, vision, mental health, alternative medicines, going to see a chiropractor, getting acupuncture, in alternative actual medicine, like earlier today, Purpose First Duo was talking about. And I believe one of the earlier panelists as well, talking about psychedelic medicine. We need to be able to access all of these things, and we don't, because of the death care industrial complex. It is kind to say the medical industrial complex, but this is a death care system that we live in.
Wow, that's powerful.
I
I've
mean,
never
yeah,
heard that
that
before.
was technically
It's
a
true.
mic drop moment.
Yeah, really
You know,
was.
one of the things that really ticks me off is that dentists have zero interest in universal health care that includes dental, because they're getting away with murder. I mean, most people know that, even if you have dental insurance, I've been so fortunate that, my husband has always been employed by a major hospital. I was also for many years, and I left, and it's another story Anna wants me to tell everybody. But so I've always had great health insurance. And I've had dental insurance, but it covers part of it. And fortunately, I haven't had serious problems, and whatever isn't covered, I could afford to do. But most people can't. And dentists, they like it the way it is, because they're as bad as some of the hospitals and insurance companies, et cetera. They can charge whatever they want. So, we're trying in New York. One of the people on our board at Physicians for National Health has been trying to get dentists to work with us, and they won't do it. They don't have the will, because they're there raking in money from patients who don't have health insurance, who don't have dental insurance, and who do have dental insurance. And so, they're a group that we really have difficulty with, and that I hate to say it, I just don't have a lot of respect for the profession for that reason. And I don't mean you, Elizabeth. I don't mean you. You know what I'm saying.
Yeah, I want to definitely make sure we get Elizabeth to finish what she was saying, and and maybe respond to that. And I just wanted to add, I heard someone say that the medical industry has gotten us all, especially in America, to think of teeth as like these special fancy mouth bones and not part of the rest of our bodies for some reason. Like, it's why are they two separate things? It doesn't make any sense. And please, Elizabeth, continue.
No, I'll just speak to that, because that's absolutely true. Working at the Free Clinic, the nonprofit, previously, we had not only a dental clinic, but also a medical clinic. And we would run simultaneous clinics. So if patients came in with a dental infection, but they got in line for the medical clinic, the doctor would do an evaluation. And honestly, they would freak out, because apparently the oral cavity, your mouth, is completely separate from the rest of your body. They do not consider that part of your body, and then they throw you off to somebody else. And we have patients that go consistently to the emergency room and to urgent care, and all they get are pills. They either get a prescription for an antibiotic to treat the infection, and then they get pain medication. They do not receive treatment in an urgent care or an urgent care or an emergency department. So then they
Okay, well, there we go again. I'm sure she'll be back momentarily. So, the death care thing, and B, the this whole thing about dentistry it's really, I mean, to hear that they specifically don't take care of teeth at urgent and emergency care, it's wild.
That just happened to me last week. I went in for
wow.
a toothache to the emergency room, and they gave me an antibiotic. But it was a toothache. Like, I mean, I thought I was dying. Like, the worst migraine, my entire face hurt. I couldn't sleep. Excruciating. And they gave me an antibiotic. Thankfully, it worked. But it cost me $100 copay to even go here. So
Wow.
But I digress. Continue, Elizabeth.
Oh no, you're fine. That's exactly what happens. And it blows my mind that these professionals who go to school for so long just disregard your mouth. When you come in to see them, you're looking for help. And one of the things that I've come across being in the dental field, as I mentioned, I've not only worked in nonprofit, but also corporate, where they just treat you as a number. You're just a cash cow for them. And it doesn't matter if you're a patient or if you're an employee, you are replaceable. And then in private practice, as an employee, you have to upsell. You have to talk people into getting things that they don't actually need at the time. No one really tells you that when you have a root canal, you don't have to get a crown on that tooth.
That is true. Second opinions, even though they're not cheap, in dental, my husband just went through that. They told him root canal. He went back and the woman said, I don't know who told you this. That's not necessary. They do upsell all the time.
Constantly. We upsell. We are forced to upsell because the private practice is functioning just off of the private insurance. They will accept some cash pay patients, but it's not very likely. You have to have some proof of assets and things like that you are going to, solve this bill within 90 days. The other portion of it is dealing with the insurance companies. I mean, I actually have now allowed my registration to lapse because I am just so fed up with this broken system and telling patients, we submitted your pre-authorization. Somebody who's never done an evaluation on you before is telling us that you don't get to have this treatment, that your insurance is not going to cover you because they've never even.
Just give it a couple of seconds.
Well, I am on video, yes. Then use that bathroom. Oh, you can go in the bathroom. You're wearing clothes.
Keep going, Elizabeth.
Man, StreamYard keeps trying to hold me down. Is StreamYard ran by the NSA or something? What's going on right now?
No, it's literally run by dentists.
Yeah. Big dental.
Oh gosh, big dental.
Being held down by big tooth. Okay.
Yeah, so I mean, I see it all the time. There's waste, there's overages, there's fraud even. People are getting treatment that they don't even need, just so people can bill out to these insurance companies and make money. It is disgusting. And you know that is happening across this.
Yeah, they're really on it, huh?
She should change her location where she is, maybe.
Maybe so.
Could be it.
If you guys don't mind, I'd like to actually give Elizabeth a quick suggestion. You notice that when she speaks that there's quite a bit of distortion, and I would probably guess that you're not using like a explosive cover, like a like a foam cover, something that gets rid of explosions. If you want to try, maybe back away from your microphone a little bit, we'll see if that takes care of the problem.
Well, I'm using my headset. Should I not use that anymore?
And it's kind of fixed, so you gotta maybe just not be right in front of your face. Maybe lower it below your chin. We'll still be able to hear you, but then it won't pick up and there she goes.
And she's gone.
So much for that idea.
It was worth a shot. It was worth a shot.
All right, I'm out of here. Bye.
Bye. So, what do you think? Do you think we want to, Joy? Do you want to start going, and then maybe we'll let Elizabeth's stream settle in for a while, and we'll get her back in, and then we'll get kind of more of a little bit of a flow after we've gotten you all to tell a little bit of your stories.
Sure. I mean, I have so many, but there's one that I just will never shake. In over 10 years in the healthcare system on the administrative side, you see so many things as well that a lot of people don't think about. When I was working in Medicare, I used to have like 90-year-old people send me their water bills and say, look, I know I have a $20 bill due, but I have this $40 light bill or electric bill, and I can't do both. And you're looking at these documents and you're like, this is violence. That's it. It's violence. Like, you really want elderly people to sit there in the dark so they can pay this? It is so inhumane. In Pennsylvania, we had something called adult basic. And people used to call it adult chip or whatever. I worked for CHIP. It's not.
What is CHIP?
But in any case, this was before Obamacare, which the one good thing about Obamacare, it did take away the pre-existing condition clause, which changed a lot of our lives. So I will never take that away because it really changed many of our lives. Not far enough, but it did. So this was before then. So people were absolutely denied when they would apply for healthcare. Some people because they're a woman. Some people, they literally would ask if you had allergies and would deny people on that, depending on the company. So we had this Pennsylvania state program called Adult Basic, and it was basic. Here's the flaws with it. $638 a month. And this was a few years back, so it was even, it was expensive. Also, it covers only medically necessary, so that's pretty much nothing by the time they get through approving, denying. And it puts you on a waiting list to get it for like $239 a month. But during that time, if you cannot afford the $638 to get on that insurance, you are not allowed to get any other insurance. If you get some other insurance, you are kicked off that waiting list. The waiting list was over 3 years long. Then what happened? Our governor did away with it. All these people have been on a waiting list for 3 freaking years, lost any hope they had. Sorry, you can't get health care because you're on the waiting list. And then they went all that time without it. And I worked at the call center. I had to take these calls when people see on the news, oh my God, this is, I've been on this waiting list. It's the only hope I had of healthcare because it's the only way to get it with a pre-existing condition. I used to talk to women with breast cancer who literally had to stop chemo treatments and stuff like that, and were on adult basic because it was the only way they could possibly get care, and then they were kicked off the waiting list anyway. So, but the one story in particular, which just, I hope I don't get emotional, but there was this woman who called, and like I said, it was the only option in Pennsylvania before, the pre-existing condition clause ended. This woman called, I picked up, and I heard moaning in the background, and then kind of some garbled screams. And the woman was hysterical. She said, I need insurance. I need it. My son needs it right now. And I said, ma'am, just go to the hospital. What's wrong? And she said, my son was just shot in the stomach. And we can't go to the hospital because we cannot afford the bills we're going to get. Can you give me insurance right now over the phone? And I couldn't. There was literally no way. Regardless where you get insurance, there's a time. It's the first of the month, or you need payment first. And I was just at a loss. I'm sitting at my desk just bawling. I'm like, I don't know what to do. Finally I convinced her to just take her son. And I said, ma'am, and I went against the rules because I really don't give a shit. And I gave her my personal email so I could try to help find services and stuff afterwards. Thankfully, Medicaid, picked up retroactively. But the point is, this woman literally has her son dying, bleeding behind her on the couch, and she is begging for health insurance instead of taking him to the hospital. That is the violent capitalist system we live in right now.
Wow. I mean, it is really, really difficult not to, I mean, that underlines for me, like you said, Joy, the inherent violence of this system. And this is the basal layer of it. You know, this is where once you are not useful for whatever reason, right, you can go and they don't care. And the fact that the first thing this person had to think in order to save her son's life was how they're going to pay for it. When people talk about civilized nations, and there's been a lot of discussion about civilized nations, the absolute barbarity of not being able to save someone's life. Look, you could go 10,000 years ago. You know, you could go any number of thousands of years ago in any human society. And the number one thing is, if somebody's hurt, you fix them. What you might not know how, you might not have stitches, you might have to like throw some mud on it and call it a day, but you do that. And here, we don't even do that. And that is the reason why we need to be so much more vocal about these things, because this is the bottom layer of everything. This is everything. And wow, that story just really upsets me, because I've heard similar things like it. And I've had some friends be in situations that were like that as well. You know, for those reasons and for other reasons, if you can't get help, with your health, you can't have anything. So I want to bring in, just to kind of shift gears, let's talk about some ways that you think that we can help people to A, realize how important this is, and B, ways that you think that we can get towards this goal.
Well, obviously, education is so important because we really need to let people know what's going on. One of the things that really bugs me is that until people have the personal experience, they don't realize it. They think, like everybody talks about, the United States has the greatest healthcare in the world, the greatest doctors in the world. We have all these wonderful medical centers. Yeah, we devise and we develop all these great drugs, but they're not affordable. And that, when you have Medicare, one of my patients who has lung cancer now, she's got traditional Medicare and she's got a secondary that's one of the California secondaries. She's still paying a significant amount of money as a coinsurance for her chemotherapy. And that's one of the reasons we talk about improved Medicare for all, because despite the fact that because traditional Medicare pays 80% of the Part B health doctor visits, there's another 20% that has to be paid for. And that's the unfortunate reason that so many people go into Medicare Advantage, which absolutely is a for-profit system. Medicare Advantage, the insurance company takes the Medicare money from the government, from the taxpayers. They divvy it out where they take a 15% profit on the top. They take that 15% profit. It used to be more, but the ACA told them they couldn't take more than 15% profit. That is still hundreds of millions of billions of dollars a year of taxpayer money that they're getting. The other thing that Medicare Advantage does is they get even more money from the government because they do something called upcoding. And I think that some of this was discussed in the former, the former session, so I'm not going to go over it. But it's amazing how much more money they get, and that's all profit for insurance companies and Wall Street investment firms. If taxpayers knew that their money was going for corporate profit, maybe they'd start thinking about it a little bit more. They wouldn't have to just have a medical condition where their family went bankrupt or died because they didn't have health care. So the first thing is that we at our organization speak at churches and senior citizen centers, as I mentioned. We have rallies and protests in New York, in Albany. There are a number of protests where, we'll travel to various places. We go down to Washington. So we're really trying to make it vocal. We need op-eds. We need things in local newspapers as well as big newspapers, like the New York Times, that are telling people what's really going on, so that maybe eventually it'll get into their heads what's going on before they end up in trouble. All of those those are the ways that we can get the American people to come and work with us, because we, the people, hopefully will have the power. And our politicians may say one thing, and when they get into the office, it's something else. So how do we deal with it? It is so frustrating to be able to deal with these politicians. And although you said that Obama didn't want to do it, I guess also what I'm saying is that I think that if you took Obama when he was 30 years old and he, was not president of the United States and he wasn't even in politics yet, I believe that he is the kind of human being who, in his heart and mind, understands the plight of the American people.
He literally campaigned for Bernie Sanders, literally, before he became president. Like, he had populist views. And, if only we had him that way, he kind of changed a little. But yeah, like, you can literally go to YouTube and see him endorsing Bernie and, like, praising him. It's truly astounding.
Yeah. I recently saw something from him at an anti-war rally.
The whole world, though, I mean, when you see what's happening with this movement that put Trump into place, I mean, it happened in Brazil. It almost happened in the Netherlands. There's this really terrible sort of right-wing belief of populism that, history obviously is cyclical, and it's happening, and we have to prevent that as well. So I think that the main thing is to get behind the movement, to get people to understand. We have to start at the local level, where we have people in small areas all over the country, making it clear what the government is doing just in terms of destroying Medicare now, and getting private insurance companies to get in there. That private insurance companies only have one thing, and that is to make money for themselves, their CEOs, and their stockholders. They couldn't give a damn about healthcare. And that's the problem now, is they're all getting in on the bandwagon. That's what this whole DCE reach thing is about, that hopefully we can stop now, which is one of the reasons that many of us are working in that area, because it's an area that is not yet law, that is not yet accepted, but which the government is doing under the radar. We have to prevent this from happening. And it's a very, very tough situation, but it's life or death. That's why I said in bioethics, we feel healthcare is a very unique phenomenon, different from any other form of entitlement that people have being residents of this country.
Yeah. And I mean, maybe you've talked about this before. What is DCE reach?
Okay, that very briefly, and that's something you're going to be hearing a lot more about. So basically what happens is that the Medicare system, as I mentioned, has costs that are in addition to receiving Medicare, where you paid out of your paycheck for many years. So the Bush administration put into effect Medicare Advantage. And what that is, and I think I mentioned before, that the private insurance company takes Medicare trust fund taxpayer money and they divvy it out as a private insurance company to the Medicare beneficiaries. And there are many ways that they make more money, as I mentioned, by upcoding and by denying care. Let me give you an example. My patient had a head and neck cancer. He went to a doctor who took Medicare Advantage at Mount Sinai because they're one of the hospitals that take it. And not every Medicare doctor takes Medicare Advantage, because another way the private insurance companies work it is they pay the doctors and the hospitals less than traditional Medicare. Patient was there and the doctor evaluated. The doctor decided that that he was planning on surgery in a couple of weeks, that he would be able to cure this man. The man was 65. He had just gone on Medicare, and his company demanded that it be Medicare Advantage to, quote, save money, which is a bunch of baloney. So what happened is the doctor said, well, in order to do the surgery, I need an MRI. I need a total body MRI, because I need to make sure that your cancer is only in your neck, that it hasn't spread anywhere else, because I don't want to put you through this surgical procedure if your cancer has spread to other areas, because the treatment would be different under those circumstances. His Medicare Advantage plan said, we will not allow an MRI. The MRI at Mount Sinai was $12,000. Now, there is no reason in the world an MRI should be $12,000 when in the UK it's $400 or $500. Okay? They said to him, okay, well, if you'd like, you can appeal it. His wife said, appeal it? How long is it going to take to get an appeal done? So they said, oh, well, it could be 3 months. And then she spoke to various other people who had had the plan, and they said, oh, it took a year to do the appeal, and then it was accepted. It turns out they tell you to go for an appeal, but it's going to take so long, most people don't do it or they drop it. Okay? Well, you know what? The woman said, I don't understand this. My husband's, I don't want him to die. He's got cancer. And fortunately, she said, we'll just have to use some of our savings. And she paid $12,000 for the MRI. The patient, I can tell you, it's 2-3 years later. He's, thank God, knock on wood, he's fine. But this is what we're dealing with. It turns out that 85% of their denials, if you stick with it, are things that shouldn't be denied, and they accept it. But that's the whole thing. It is true that fee-for-service healthcare has a lot of, probably many unnecessary procedures that are being done. But if you look at the total amount of money spent for traditional Medicare, it's still less than Medicare Advantage, because you don't have the middleman there. You don't have the insurance company there making a killing on it. The insurance companies in Germany are non-profit. They do have insurance companies, but from 1880, when they were started by a terrible human being, Bismarck, which Dr. Brown mentioned yesterday, the reason that Bismarck gave his people health insurance is because they were emigrating to the United States, where miners and carpenters made more money in 1880 than in Germany. And Bismarck wanted to keep them there because he wanted a great economy for this country. He wanted Germany to expand and take in all the little duchies, and he wanted to improve the economy. So he gave them health care, and they stayed in Germany. He gave them disability insurance. He gave them funeral expenses. He did all of that. He did it for the wrong reason. He didn't do it because he cared about the people. He was a terrible politician as a human being. He was a cruel, nasty human being. But he gave them health care and they stayed there. And that system of nonprofit health insurance to this day has given Germany one of the best healthcare systems in the world.
And I noticed that working in admin too. Like whenever I worked in appeals and grievances in Medicare for over 3 years, and let me tell you, people were not appealing bills for $10. Every single appeal was like thousands. And it's like, okay, that's what they're being denied for. The really big dollar things that people need. And I was just like, approved. Like, I'm not doing that to people. But, and now after what happened to me 2 years ago, for anyone watching who doesn't know, I woke up 2 years ago without 85% of my eyesight. And I've been legally blind, missing 85% of my eyesight for 2 years now, unexpectedly. And when it first happened, I went to the hospital and they said, well, your disorder's rare. You're never going to get any of your sight back, but we can give you eye injections, which will at least help save what little sight you have left. So at this point, I'm traumatized and I'll try anything. And they said, well, it's $12,000 per eye every 30 days. We just called your insurance. They have denied it. You're too young and it's too rare. So you have two choices. You either sign this document that says you will pay the $24,000 personally, or we have to appeal it and we're not sure how long that will take. Now, at this point, I'm still working because this happened out of nowhere. So I'm like, okay, I'm working a contract job. I have no sick time, nothing like that. And I just had to call out of work continuously until that was approved. And then when it was approved, it still had caveats and everything like that. So everything like that exacerbates any kind of disability or trauma or anything like that. And I also interviewed a gentleman, Rusty, a few times. He had testicular cancer and he was turned down by an insurance, and it spread all throughout his body while he was trying to appeal it. And 6 months later, just cancer all throughout his body. And then after over 6 months of appeals, then he got health care. But it still wasn't free, of course. But, just like Cheryl said, these things could be more preventative, but it's not profitable to be preventative.
Right. Seems like the conversation has even been stolen from, thriving is what we should be aiming for, not just merely surviving and just barely being able to stay alive, but like everyone being healthy and being able to live as robustly as they are able. And that the fact that we're not even, we're fighting for just staying alive at this point. And we're going back to what you said, Cheryl, like the person being able to pay that $12,000, like, the average American, and this was before the pandemic, more than the average American, like 75% of people could not afford a $400, $500 emergency. So, and since COVID has happened, I'm sure that number is way more because everyone, not everyone, but, lots of people lost what little they had saved up. So it's even more dire now. So this is it's a really horrible situation. And I think also just wanted to go back to something else you said, Cheryl, which is information and getting people to really realize how bad things are, right? Because I've learned already so much just about how it works and what they're denying, what they're allowing. And it's like, I knew it was bad. And obviously for me, it's a top line item, but it's like, no matter how bad you think it is, it's worse. And that is something we really need to impress upon people. I wanted to see if we can get Elizabeth in here as we're like approaching a close. Just want to see if you'd like to contribute.
Does my mic sound okay?
It
now?
does, yes.
Okay. So electoralism is not the route. I am do it from the outside the system, burn it to the ground kind of radical. And I want us to all imagine what we would like this to look like for ourselves, not for the corporations, not for the government, not for Wall Street, but for us, the people who take care of our elders, who, take care of our kids, who work and run. We are the ones who make this country happen. And we need to reimagine how this country should be, and fight for all of us. So I just kind of wanted to maybe say thank you, because I don't know how much longer StreamYard's going to let me stay on here. So on behalf of all the volunteers and organizers at March Medicare for All, I want to thank each and every one of our hosts and panelists for taking time out of your busy schedules to participate.
I second that.
Yeah.
And also, that made me think of something else. When I think it's a huge misconception that Americans think that, well, if you go to a hospital, they have to see you. Maybe in theory it's supposed to be that way, but I've interviewed Amy Bilella, who will tell you legit her daughter went to the ER with a blood clot in her leg, was not seen, and died. She was 21, I believe. Wow. And, maybe they were supposed to see her, so they didn't. They said, you don't have insurance. We are not seeing you. So just because it's not supposed to happen does not mean it doesn't. This is why we need national improved Medicare for all. So shit like that doesn't happen.
The voluntary hospitals and, of course, the public hospitals will see emergencies, okay? So that if you're having a heart attack and you go to a private hospital, they're supposed to take care of you, but transfer you. So, for example, one of my patients her husband has Kaiser Medicare in California. Actually, this is the partner of the person who I mentioned before, who's paying $1,000 each month for her chemotherapy with traditional Medicare. But when he had a heart attack, he was taken to the nearest hospital, but they said, we're not going to do any intervention or whatever. We're going to just make sure that you're okay. And we send you to a Kaiser hospital because your insurance is Kaiser. But you never know. I mean, I know people who have died because they've had to go to a Kaiser hospital and it was too far away. Right. So there are just so many problems. And I just want to put in a plug for how the ACA is just such a bad system, and all this garbage about improving the ACA. The only way you can improve the ACA is to get rid of it and make it a single payer system, because I can tell you that private health insurance, in fact, I was surprised that there were some people in my organization who were, big healthcare, progressive, radical people. And they didn't realize that when you have ACA Blue Cross Blue Shield, that's not Morgan Stanley Blue Cross Blue Shield. It is much more limited. And you know what? It's damn expensive. And I can just tell you that I'm just going to quick story, and this is very quick. I'll try. My son's wife, 34 years old, was hit by a racing biker going 70 miles an hour in the park. She was wearing a helmet, walking with her bike. They smashed faces with each other. There was blood everywhere. My son was called right away, ran over there. My son said, "Mom, it looked like a murder scene." The ambulance took her to the closest hospital. They had Oscar, which is the worst, Obamacare insurance. It was costing them $16,000 a year with a $15,000 deductible. These are not high-income people. My son is a student. He's actually going to be a health policy expert, believe it or not. His wife is an avant-garde British theater producer. They're pretty low income, but they're not low income. My son doesn't believe in going on Medicaid, even if he could, just because he thinks it's unethical, that there are people who need it more than he does, because, you know, his mother will help him if need be. Anyway, they don't want to pay for the hospitalization, and their insurance says if it's an emergency, it doesn't have to be an Oscar hospital. This was a Columbia University Medical Center, quote, affiliate, and they didn't take Oscar health insurance that is owned by the Kushner family of the Trump group, okay? It turned out that they were pressured, and out of the $30,000 bill, they paid $3,000. Her mother sent money from London. I paid all the dental work. And then what happened is they kept saying, well, you should go to a dentist that's in, she had to have root canal and everything because her teeth were destroyed from the accident. And her whole mouth had to be sewn up and her lips and everything. And they're giving every excuse in the world. And he said to me, Mom, I'm going to sue Oscar because, not because I know you paid for the health care, but I want to sue Oscar for the principle of the matter, that this is an accident and they went against their rule. I spoke to him last week and he said to me, you know what, Mom, Lucy and I talked about it, and I do not have the energy to deal with them in any way, shape, or form. I have been on the phone with them getting the biggest bullshit forever for 8 months. And Mom, I just can't deal with it anymore. I have to go on with my life. And I know I am fortunate that I had parents who could pay for it. But he goes, most people don't. And that's what makes me feel terrible. He said, most people in this country couldn't do what I was able to do for my wife. And I feel so guilty about it. We got her to the best plastic surgeon at Mount Sinai. That still cost a lot of money, but at least they knew they were getting the best health care because the mother could pay for it. And anyway, he's given up on that health insurance. And I think that is a serious issue. And that's only one Oscar story. I could tell you many, many more. Most people give up. But, you know, it's funny, Joy, you mentioned about how they're only doing the MRIs and the CAT scans because they're expensive. That is true. But I can tell you that one silly consult that I did, that they would pay me $170 for, it's United Healthcare. They want all the records. They want this, they want that. You know what? It's not worth my time. So they can get away with it because I can't be bothered. So they're even going for the little ones, not just the big ones. And United Healthcare during the pandemic has never, ever made more money because they didn't have to pay for elective surgery. Their stock went up 10 times. People made absolute fortunes on United Healthcare stock because during the pandemic, they were like bankruptcy lawyers. They've never done better. They made their money off the pandemic. Is that a disgrace to this country? I find it so disgraceful.
Yeah, and that's why I said on a prior panel today, you know, people say, well, we get free vaccines. Well, okay, but they're not free. You know, they're free to you, but the fact of the matter is, look at Pfizer, how much they've made in the past year and a half. Billions and billions. They're not doing any favors. They're not, oh, we want to give you vaccines because we care about you. Like, they're getting even more rich. That's awful.
I do know people who wouldn't take the vaccines because they didn't trust the pharmaceutical companies. That I had a little trouble with. I tried to explain that the vaccine has been proven to truly, you know, and the booster specifically medically has been shown to, you know, improve the prognosis with Omicron. But that's how rabid people were feeling about the pharmaceutical industry. But you know what? I have to be honest with you. The hospitals are doing everything they can. The prices of the emergency room services are insane. There's no such thing as a cost of anything. Like, I always say, you go to Macy's, the dress is $140. It might be full price at Bloomingdale's, but if you go to Macy's, there's always a coupon, there's always a sale. There's no such thing as a price of anything in medicine. It's whatever they can get away with. That's why an MRI is $12,000, because it'll be $8,000 at Cornell, it'll be $12,000 at Mount Sinai, it'll be $14,000 at NYU. It's whatever they can get away with. And the insurance companies know they need the hospitals. They have contracts with them, and that's why they're paid. And that's why the hospitals aren't going to go into a situation where they're going to be getting less money, because they are making a killing as well from the private insurance industry. It is a vicious cycle, and we have to stop it.
Logan, I think you're muted.
Yeah. Sorry. I think we're approaching the close, so I wanted to just give you each a chance to, give some closing thoughts and that sort of thing. And just wanted to say, I just heard from a person who has done medical billing that whenever you deal with a hospital, make sure to ask them for an itemized bill of everything, and that will almost always reduce the amount you have to pay. Make sure ask them for like a printed receipt, because the more light they have on these things, the less likely they are to charge you as much as they can, because they just want it to get by under cover of darkness because they can get away with it. But just force them at every time that you can, because they try and get by on despair. They really do.
But
And thank you all for educating me so much.
The hospitals all use billing companies that have nothing to do with the hospital. The billing company will be in Boston and the hospital will be in Atlanta. They're using companies who couldn't care less. Yes, sometimes people can argue and try to get the cost down, but basically the billing companies, the more they make, the bigger their percentage profit. 10%, 12%. So the more they collect, the more they make. So they've got a vested interest in making more money as well. So, it's really tough. But if you look at a hospital bill, it's unbelievable. They often do send it. I went to the emergency room for food poisoning. I couldn't even get to Mount Sinai where my insurance was, because it was 5:00 in the morning. I went out onto 7th Avenue. The taxi driver thought that I was a drug addict withdrawing because I was vomiting and moaning, etc. I went to NYU in my running gear with my insurance cards and enough money for the cab. Then they wanted all sorts of other ID. And I went, I didn't bring it. I figured this was enough. Okay. I get a bill for $38,000. I was there for food poisoning. I had blood work, and I got an IV fluid, and I got some, they wanted to knock me out because they said I was bothering the other patients and I was making too much noise. And they gave me IV Xanax or Valium or whatever. I got the bill. The IV fluid was $9,000. The IV Xanax was $4,500. I had a $38,000 bill. Now, if I have NYU and I have United Healthcare, Mount Sinai, United Healthcare, NYU. I paid $150. And all I could say was, oh my God, can you imagine if this was somebody with no health insurance, or if they didn't take their health insurance because they had Oscar or they had Obamacare insurance, because NYU only takes one Obamacare plan. If you had the other Obamacare plan, you'd be responsible for $38,000. They're made up numbers. They're made up. They're just what they can get away with, and that's the problem.
Yeah. Elizabeth, would you like to give us some closing thoughts?
Yeah, sorry to everyone who's watching and listening that I keep getting booted. I apologize for that. But I really just wanted to thank everyone because without the teamwork, collaboration, and the passion that we all share for achieving.
Hopefully.
And Elizabeth told me that she never realized how much work it would be to put this together. So real kudos to her that she'd never done this before, and she did it. And so I think everybody is so grateful to her. And will not stop thanking her, which we all are doing now.
Yeah.
And
for
Joy,
sure.
how about you?
You know, I've been on like so many panels yesterday, today, and tomorrow that I just, there's so much I could say, but I've already had opportunities to touch on so many things. I think the thing I want to tell people is also going with Cheryl, what you said, and Logan. I really want people, when you get those EOBs, don't just throw them out. Look at them. Look at those prices, because those are the prices that you would be paying if you didn't have insurance. So if you get an EOB that says $3,000, even if you only pay $100, look at what that price is. Because if you didn't have insurance, that's what someone is paying.
Absolutely.
And I think we can all say it's criminal and it is unethical. And if this country is supposed to be, well, we're not going to talk about the politicians, but this is a country of of golden opportunity. If you don't have your health, you don't have anything.
That is very, very real. And I think that brings us to the close, right?
Yeah, Logan, if you want to stay on with me before I transition, we've just been having a hostess
Sure.
with them both, with each other.
Okay, well, thank you, everybody. I think that we're all on the same wavelength. We all feel the same way. We have to get the rest of the American people to feel the way we do.
Yeah.
So thank you all.
Thank you
and
so
Thank
I'll
you,
be tuning
Cheryl.
into some of them, and I know that we can watch them afterwards on YouTube, right?
Yes. Yep.
So that's going to be great. I'm going to, every moment I can, I want to go to the ones that I had to miss because I couldn't do everything, but I'm really looking forward to it because I did do Friday night and I thought it was fantastic. I was like really taken. I really was. So thank you so much.
So much. Like so much. This has been amazing. Thank you so much, Cheryl, for joining
Thank you,
us.
Cheryl.
Okay, great. Speak to you all soon. Thank you for being here.
Bye-bye. So, wow.
Yeah.
I mean, so you don't work in healthcare. So what is your mind just like, right now?
Yeah, it's a lot to take in, and really, it just underlines a lot of the things that I already sort of, know and suspect about the system, and it's just every single time I find out something else, it's like I said earlier, whatever you think you know, it's worse. It's worse. It's worse, and it's like not just a little worse, it's way worse. Like the bottom drops out once you get more pieces of information filled in, and it's like it's absolutely, I mean, it's not unbelievable, it is thoroughly believable, but it is horrible and it's unconscionable, and it reminds me of why we just need to stop saying things like, there's nothing good or virtuous about this country. If there ever was, and I will say that there never was, but still, right now, it still can get worse, and it is getting worse, right? Especially when we have this rise of, what people call right-wing populism, but it's not populism. It's not popular with most people. They're using that term to lie and to get people in. And what it is it's a word that rhymes with smashism, and that's how it always comes. Okay, it always comes in the same guise of like, oh no, just stand with us and we're gonna fix some few things for you, and it's a lie every single time, and we can't fall for it this time. You can't be on side with people that are talking about populism but are willing to leave aside whole huge sections of society. If they're saying that, they're lying to you. They're using you, and you will be discarded as soon as they're done with you.
Absolutely. Well, Logan, I knew you'd be awesome at this. Thank you so much.
My
I love
pleasure.
doing shows with you.
Same.
And everyone stick around. We've got more. Thank you again, Logan. Love you.
See you later. Love you too.
Hey there, this is Jordan Chariton with Status Quo.
I am talking to you today about my healthcare story from a journalistic perspective. And the top story that comes to mind in terms of human suffering and injustice is the Flint water crisis and cover up, which I've reported on a lot over the last 5 or 6 years. A lot of people don't realize that other parts of the country, particularly Libby, Montana, which is 96% white, when they had a massive health catastrophe, an asbestos crisis that killed hundreds of people, Medicare for all was snuck into Obamacare for the people of Libby, Montana. The people of Flint, Michigan, who were poisoned by their own government while they were drinking toxic water, the state government of Michigan, the Republican Governor Rick Snyder, was fully aware that the water was toxic and still allowed them to continue drinking it. When I say them, Flint is majority Black, a lot of poor white people as well. And then after it became a national crisis and scandal, they continued efforts to cover it up after the fact. And the media has essentially been in league with the politicians to declare the water fine, even though it's not. I have been in Flint nearly 20 times over 5 or 6 years. And I can tell you, I have sat on porches, front porches with children and prompted them if they could recite the alphabet, and they stop at around the letter D or E when their parents tell me they used to be able to say the whole alphabet. Same thing when I would ask children if they could count to 10 or 20. They stop at 6 or 7. I've spoken with children who clearly have trouble constructing or processing thoughts that did not have those issues before. I've spoken with children and adults who have really major tempers and mood changes and can kind of go from 0 to 60, which is a side effect of heavy metal poisoning and lead poisoning. There's also the fact that a lot of focus has rightly been put on children and the learning disabilities, behavioral issues, permanent damage. I have spoken over the years with many adults, including adults that when I met them were in their mid-30s, maybe 40s, who have a whole host of issues they never previously had before drinking that water. We're talking about severe autoimmune issues, kidney problems, liver problems, Parkinson's, epilepsy, cancers that they have no family history for and they developed, severe muscle and bone pain. The list goes on and on and on. And then you tack on top of the ailments that they received from the toxic water, a global pandemic, which it wasn't just people over 65 or people with autoimmune issues that were susceptible. Pretty much all of the people of Flint, including children, were more susceptible because their autoimmune and systems were pretty much destroyed. So this is, the term crisis, people become numb to that, but it's still very much a crisis in Flint, not just the actual health problems that these children have and adults. And I know somebody who just died from COVID in Flint. He was about 60 years old. And who knows if the issues that he had from the water, and he had a lot of issues from the water, contributed to him not being able to fight off COVID. But besides the just unbearable and unfathomable health problems that these people have to live with for the rest of their lives, the bills that have stacked up. I have talked to residents that are literally near bankruptcy trying to afford environmental doctors. Because remember, when you're dealing with heavy metal poisoning, there's also a lot of bacteria that was in this water, waterborne diseases, a waterborne disease known as Legionnaire's disease. A regular internist isn't what you need. You really need specific specialty doctors, environmental doctors, which most insurances do not cover. The residents of Flint got short-term Medicaid expansion for a few years. That's pretty much up. So they don't have Medicare for all to pay for their environmental doctors, their specialty doctors, women who have there's been a whole host of miscarriages in women as a result of that water, fertility issues. If you're watching and have struggled with that as a woman, it's not cheap. Fertility doctors and fertility treatments. So they do not have Medicare for all. They don't even have really a permanent expansion of Medicaid, and they have bills stacking up, not just related to their health problems, but Flint is one of the poorest cities in the country. And the government, a lot of people think, oh, what are you talking about, Jordan? The government under Obama sent Flint like $170 billion. No, that money was sent through the Republican governor at the time, Rick Snyder. And my reporting indicates a lot of that money got diverted elsewhere. So if you go talk to the actual people of Flint, how much money they directly got for their health problems, for fixing the water pipes, all those things, not even close to what was earmarked by Congress. And then you have a settlement. You have a settlement that was reached last year, the state of Michigan agreeing to pay over $600 million to the people of Flint. Well, when you calculate that per family, they're getting about a little less than $10,000. It's about the price of a used car. So Medicare for all, we need it for everybody. But at the front of the line should be people through no fault of their own who were poisoned by their government and then basically have been left to die. Because make no mistake, the people of Flint, year by year, and I've been there nearly 20 times, and I will continue going back because this is still a crisis. And if no one else is going to cover it, status quo will. But I will tell you, this is still very much a crisis because people are slowly dying. Real quick, a couple years ago when me and my former partner, Jen Dyes, went to Flint, we knocked on nearly 450 doors working on a story about the state of Michigan cheating on the water testing. And almost every block we went on, if somebody would open, we'd say, hey, we haven't really got people opening their doors at these homes, if they'll be home or if they just wouldn't want to talk. Pretty much almost every block we were told, oh yeah, that person recently died. So we need Medicare for all. We need Medicare for all people of Flint. We need Medicare for all for everyone. And I will continue to cover the movement for Medicare for all.
You're muted, Joy.
I keep saying these revolutionary things and I'm muted. Damn. I forgot what I was saying. But thank you so much, Jordan, for that. That's so important. If you haven't seen our panel from noon Eastern today, that is what we discussed. We talked about environmental trauma to the body, and having lack of healthcare, what that does. So we did that at noon. Then we did healthcare, racial disparities. Then we did mental health. Then we did disability. And now we just did healthcare workers. This is only the second day. So if you missed any of those, watch them. If you missed our program last night, watch it. Tune in tomorrow for sure. But we're still not done tonight. So before I get to our next special guest, I want to sincerely thank all of our panelists, hosts, everything. I'm fangirling over all of you. You guys are all amazing. Thank you so much. And also, I'm going to pimp our gift basket again. We have a gift basket, free shipping, $150 value, some M for All swag, some treats, all kinds of fun things. Every $20 you donate, you get a raffle ticket. So let's say you donate $40, you get 2 tickets. Of course, this is all online. These are, this is virtual. We're all volunteering, but we do have actions coming up and we still have, debt from July. So donations are unfortunately something we need to keep doing our nationwide events. So anything you can donate, we truly appreciate. screw sending it to politicians who say they support Medicare for all. Send it to mutual aid or organizations like this who actually are fighting for Medicare for all. If they get elected and they prove themselves, cool. But focus on the action. That's what we need to do right now. Activists lift each other up. So thank you so much to anyone who has donated, who can donate, and really anyone who has tuned in and commented and shared. Smash that like button, share. And now you can bring in our next guest, Andy. Hi. It's been
Hello.
forever. It's so good to see you.
How are you? Good to see you too.
I'm good. And okay, so you're in freaking Thailand right now.
I am. Yeah.
That's amazing.
Yeah.
So, for those who don't know, this is Timothy Bracken. He performed at our DC Medicare for All March in July. And I immediately asked if he could join us for this as well. And so you're in Thailand. What is healthcare like there? Have you had to use it at all?
No, just visiting. Been here for almost 6 weeks. My wife is from here. We met in Baltimore and got married, and we haven't been able to come back here until just now. But the healthcare here is not subsidized in any way. So I still think it's a lot less expensive than what it is in the US. I've run into a lot of expats here, and from what I hear, it's pretty cheap. Even though people have to kind of foot the bill, it's not outrageous as far as I know. But that's just from what I've gotten from folks in casual conversation.
And you're actually moving to Canada. So
21.
Lucky. And you have a baby. So how does that make you feel that now your healthcare is going to be that much better and that much less of a worry?
It's huge. I mean, that was kind of the biggest reason that we wanted to think about leaving the US was healthcare for us to stay alive as long as we can, to see our kid grow, but also for our child too. Man, it's crazy. Musicians, anybody in the service industry, just so many people got devastated by COVID. With everybody being forced to not work with almost no support. A lot of people couldn't get the unemployment, the special assistance, those kind of things. And a lot of people, even with that, like myself, we had a mortgage payment and a car payment, and trying to get healthcare on top of that was a nightmare. So, but getting to Canada, if you can get a permanent resident card approved, as soon as you have that, you get healthcare just like a citizen. Anybody, you get all the services that you would get as a citizen. And nothing's perfect, but anybody you talk to in Canada is going to tell you that they're so happy that they have that, and it does work. There's nothing's perfect, but it's worlds better than what we have here.
That's for damn sure. Well, you are going to play us a few songs about, I just love the song choices you did at the march. So I didn't tell you what to play, so just, I trust you.
Yeah. So I'm thinking about, just to avoid any issues, just playing, a couple original songs.
Sure.
Yeah. So I had a couple of mine. So I will play one. This is called Enjoy the Show. It's a song about, I think I wrote this almost 10 years ago, maybe about 10 years ago. And it's just kind of about the general state of how
It
things
kind of
have
fits.
been.
Enjoy the show.
Yeah, here we go. Stuck in the television age, how we like to be afraid, how we like to be amazed, and nobody is ashamed. I haven't seen you in a while. That was when we used to smile. Now I'm smaller than a child. This whole world has gone wild. And it's not for me, but I can't let go. When will I enjoy the show? Nobody cares about the facts. Don't you ever talk back. The conversation is a trap. Just blow them off the fucking map. Whoa. And it's not for me, but I can't let go. When will I enjoy the show? All right. I didn't ask about profanity ahead of time. I'm so sorry.
Swear away, brother. Swear away.
So, yeah, just keep going. Do another one.
Yeah, just keep going. Joy's just taking a little break. You're doing great. Keep rolling, my friend.
All right, cool. So, yeah, I'll do one or two more here. Let's see what we got. So, this is a song I did with a band called the Weber Brothers. I wrote this song, sang it with them. We did a little lockdown album, put it out last year. So that's what we got here. From the time they rolled into town, we were let down. In the dark, digging up the ground, we were let down. We were let down and down. Nothing is perfect as it sounds. We were let down. Wake up, there ain't no way around. We were let down. We were let down and down. I need. To tell you where you're bound, we were let down. Realize just before you drown, we were let down. Oh, we were let down. And down, we were let down. All right. Okay, I'm gonna try. I think I got one more. So, I believe it was after the 2016 primary. I wrote a Bernie ballad, and since then, it's been a lot of debate among those on the left about, how helpful Bernie is now. But I won't get into that. But I will say he was right. So that's my song. It's called Bernie Was Right. So here we go. Everything has a price. Your outrage is directed at a horrible man with a red tie, soft hands, strange plans, even he don't understand. The same blood money funds the old rich blue leaders. They're just as good as cheaters, nearly perfect sleight of hand. While you march in the street and gathering to eat, slap each other's backs in a 5-star hotel. Media monopolies, neoliberal policies got us where we are right now. It's really not complex, it's not religion or your sex, it's the money every goddamn time. Bernie was right. I feel it in my heart when I go to bed at night. Bernie was right. He tried to pick us up and lead us to light. Bernie was right. Only honesty and decency are gonna win this fight. Bernie was right. It's not about a leader. All right. When they get behind closed doors, they joke and laugh at death and war. I've seen it for myself, no lie. Instead of picking sides, I just wanna run and hide. We've collectively lost our minds. Bernie was right. He tried to pick us up and lead us to the light. Bernie was right. Tried to pick us up and lead us in the light. Bernie was right. Only honesty and decency are gonna win this fight. Bernie was right. It's not about a leader, it's everyone. All right. Oh.
You're muted, Joy.
Muted, Joy.
Damn it.
Hi.
I've only done that every single time, okay? I'll get used to it, by then of tomorrow. Thank you so much.
Yeah.
I wish you best of luck with everything. And also, is there anything you want to leave with people to take away from this weekend about why we need National Improved Medicare for All?
Oh my goodness. It's something that almost every other place has that we don't have. I think if anything, just for that simple reason, um, healthcare should be a human right. Healthcare, if you look at it from a moral perspective, is a human right. And the fact that you have Republicans, that they're against it, and that's terrible. But when you have these so-called, politicians that they call themselves progressives, yet they won't do a thing to, they have millions of Twitter followers. They won't do a thing to get people to do anything about getting Medicare for all, let alone do anything themselves. So I think people need to just put pressure on those progressive people in office. Just stay on top of those people and just keep demanding it. Keep action, direct action. It's getting harder and harder to do these kind of things everywhere. But that's really that's all I have to say about it, I guess. I mean, it's a thing that should be. We just put $14 billion to send to a war in Ukraine, and it's horrible that's happening. But what could something like that do to get people health care or end homelessness or any of those kind of things? It can be done.
It can. And we have two options: be defeatist or get the fuck in the street. So this is the time when we have that choice. So I want to thank everyone so much who has been part of this forum yesterday, today, and who will be tomorrow. This is inspiring. This is what people need to hear. These are the things people need to think about and learn. And this is the only way we are going to change things, is by action, by education, by hearing people's stories. So thank you so much for being part of this, Timothy. Much love to you, your wife, your baby, everyone.
Thank you so much.
Sure. Take care.
All right. Bye-bye.
Bye. So I don't know how to deal with this. Everything's been so awesome the past 2 days, and we have more tomorrow. So tomorrow we have several more panels. If you have not seen last night's panels or videos, please watch them. You can find them on my YouTube as well. Today's panels you can also find on my YouTube. And tomorrow you can tune in to either Indie Left or Real Progress in Action, Real Progressives, my YouTube. There's plenty of places that you can watch. And if you'd like to see tomorrow's schedule, we have some great panels and a lot of cameos from some people you may recognize, just telling us why they support national Medicare for all. So some familiar faces, but also some people who have been victims of our violent sick care system. They've shared their stories as well. So tomorrow's going to be another powerful day. If you want the schedule of everything tomorrow, or to watch what we've done thus far, m4m4all.org. You can also sign our petition. You can also donate if you can. For every $20 that is received, you are entered into a raffle to get a badass gift basket with tons of swag and treats and all kinds of fun stuff, shipping included. with every $20 you donate, that money will go directly to our actions. It's not used for anything else. This is a volunteer organization. So every hour we put into this is volunteer. So any money we raise goes to our actions, physical actions. And we have some coming up. So we do need some help. Anyway, I want to thank our sponsors so much. Indie News Network, Real Progress in Action, Real Progressives, National Single Payer. I can say that.
You did. Good job. I just wanted to weigh in quickly, and I just wanted to make sure if people weren't paying attention that our panels are an hour and a half in length. And on the first day and the first part of today, the hosts were flipping back and forth, an hour and a half on, hour off. Joy did 2 panels in a row as host. And then the panel after those 2, she came back as a panelist. So she sat there and talked to you for 4.5 hours straight. Joy, I think that you deserve a huge amount of thanks for everything you do, especially here.
Thank you. And I don't know if people think that's a good thing or a bad thing that I was on air for, like 5 out of 6 panels today. But thank you
I think
so
we
much.
can assume. Let's assume that it's a good thing. Okay.
Thank you so much. Yeah, I mean, like, I was honored. These people are my comrades. And I mean, that day in July changed my life. It changed many of our lives. Organizing for that was monumentous. So yeah, anything I can do to help further our need, further our cause is I'm down with. So thank you all so much. Thank you, Andy, for being our tech guy. Excuse me. That's what happens when I say your name. But thank you all so much for watching again. Please go to our website and check out our schedule for tomorrow. Also, watch any things you missed from yesterday or today. There's so much. So thank you so much. Much love to everyone.